to public testimony on board agenda items. Members of the public who signed up to testify, you must be logged on to WebEx using the same name you used to sign up for testimony. Board staff will call on you in the order in which you signed up to present oral testimony. You will be unmuted. Please test your speakers and microphone before your name is called to ensure that they are working. Instructions on how to do that can be found on the board's website. If you're not audible because of technical issues, you will be muted and the next testifier will be called. Testifiers will have a 2-minute time limit. Our agenda states that testifiers have 4 minutes, but I'm using my discretion to adjust the testimony time. We have almost 40 people signed up to testify, so I have set the testimony time for 2 minutes. I have done this so that we can hear from everyone that signed up. I respectfully ask your understanding. Please state your name, your organization, if applicable, and the agenda item you are testifying on. A chime will sound when you have 30 seconds left, and a second chime when your testimony time expires. You will be automatically muted once your allotted time for testimony expires. Okay, I'll ask staff to begin calling on our testifiers.
Corey Rosenlee, Phaedra Robinson, Johnny Appleseed. Corey Rosenlee, can you hear me?
Can you hear me?
Yes, loud and clear. Mahalo, your testimony time begins now.
Good afternoon, board. I'm Corey Rosenlee, president of the Hawaii State Teachers Association. I will be sharing the first half of HSTA's testimony, and Osa Tui, HSTA's vice president, will be sharing the second half. On August 15th, the Hawaii State Teachers Association's Board of Directors overwhelmingly voted to state that we have no confidence in School Superintendent Christina Kishimoto's handling of the reopening of Hawaii's public schools. The day before, HSTA filed a prohibited practice complaint with the Hawaii Labor Relations Board against the DOE for refusing to bargain with HSTA in regards to the changing conditions related to reopening of our public and charter schools during this pandemic. HSTA therefore is asking the BOE to take action on the following concerns. 1, Hawaii's public schools should not reopen until at least the end of the quarter. The constant uncertainty of teaching has led to confusion and stress among teachers and students. Right now, the complexes of Lahaina, Lanai, Maui, Kekalike, and Baldwin have delayed reopening until the end of the first quarter, and all other complexes should follow. 2, develop and release clear criteria from the Department of Education and the Department of Health. Right now, some of Hawaii's public schools are scheduled to reopen on September 14th without any criteria to determine if they are safe to reopen. A recent New York Times article shared, Bill de Blasio is getting pressure to delay New York City school openings because he is trying to reopen schools which no other big city mayor is even currently trying to do. No major school district has been able to reopen without a dramatic increases in cases. Hawaii and the rest of the nation must begin to face the reality that it may be too difficult to open schools for in-person learning during this pandemic. Thank you.
Phaedra Robinson, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can. Mahalo. Your
Okay.
testimony time begins now.
Okay. Aloha. I'm a special education teacher with the Department of Education. Thank you, Board of Education, for giving me an opportunity to testify. Thank you, Corey and HSTA. I am testifying on the agenda item related to the opening of public schools amidst the pandemic and focusing on concerns for health and safety. I've been teaching special education here in Hawaii since 1998. I love it, and I love my students and their families, and I miss them so much. I've always been an advocate for my students who cannot speak for themselves, as well as for their families who trust me to do what is fair and appropriate for their children. Because of this responsibility, I do not feel comfortable being asked to make any return to learn plans for my students with IEPs for in-person instruction because I do not feel it is safe right now for anyone to do so. I don't think it's safe for anyone to be on our campuses. Depending on the school, some special ed teachers are being given the option to provide distance learning just like everyone else is doing. I know some of our students with special needs have great difficulty in participating in remote learning, but we need to think of their safety and ours safety first. Please delay the opening of schools for in-person learning for at least the first quarter, as we are not prepared given the complete lack of safety protocols throughout our schools and islands, such as lack of daily health screenings for faculty, any sort of COVID testing requirement for students and teachers for in-person instruction, and that DOE has no contact tracers assigned to us, all of which was discussed at length in yesterday's Senate hearing. Thank you, senators. I'm at high risk because of my health. Please do not make me choose between my life and my career. I'm ready, willing, and able to teach my students with special needs remotely. Thank you for letting me testify.
Johnny Appleseed, Nicole Grove, Rebecca Hadley Schlosser. Johnny Appleseed. Johnny Appleseed, can you hear me? Final call for Johnny Appleseed. Nicole Grove. Nicole, can you hear me?
Hi, yes, I can hear you. Can you hear me?
Yes, Nicole, mahalo.
Okay, thank
Your
you.
testimony time begins now.
Thank you. Nicole Grove, Associate Professor, University of Hawaii at Manoa, Department of Political Science. I want to thank the board for this opportunity to speak. Thank you, board. I'm testifying about the Excellus program for distance learners in Hawaii public schools. As a public school parent, I've submitted written testimony for this meeting, and I'd like to use this opportunity to add to that testimony. First, whether or not the DOE is using Excellus or Excellus Academy or any other Roger Billings affiliated program, this does not make a difference with regard to concerns about Excellus academic leadership, their questionable credentials, the awarding of invented degrees, or whether or not there are primaries at Excellus with any certifiable background in education. Accreditation is the barest minimum of what we expect from a school. The fact that Excellus meets an arbitrary standard for Common Core does not mean that it fits with our community standards for what is an adequate education. I want to draw your attention with my limited time to two examples of problematic content on Excellus shared with me by Hawaii parents just over the last couple of days. The first is a question on an Excellus placement test that asks what organization is associated with Osama bin Laden. This is a reasonable question. However, one of the multiple choice answers presented to the child was towel ban. As a professor of Middle East politics and international relations, I can tell you that towel ban is a derogatory term that blends the word Taliban and towel head. This is an explicit reference to a racist term for Muslims that does two things. It conflates all Muslims with the reprehensible actions of the Taliban, and it legitimizes a racist term that alienates and marginalizes people of Muslim faith. It is vitally important that we trust our children are getting an education that is free of misinformation, sexually inappropriate content, which I also have evidence of, and racism, either online or in a physical classroom. Hawaii teachers should be supported right now in directing their energies toward developing a comprehensive online curriculum that includes
Rebecca Hadley Schlosser. David Miyashiro. Ty Baird. Rebecca, can you hear me?
Yes, I can hear you. Can you hear me?
Mahalo, yes. Your testimony time begins now.
Good afternoon, members of the board. My name is Rebecca Hadley Schlosser, and I'm a special education teacher at Nanikohono Elementary School. I'm speaking today on discussion item A. According to Superintendent Kishimoto, all schools have PPE. This is not true. As a special education teacher, I was told that I would have face shields, masks, gloves, hand sanitizer, and other necessary PPE in my classroom, which would be provided by the DOE. While all teachers at my school were fortunate that we have received most of this because our principal was forward-thinking and ordered these items early on, this is not the case across the state. Let me share some examples with you. One teacher I know has only received a pair of gloves and a mask. Another has not received anything, being told that it's all on back order. We were told that some special education teachers will be provided with gowns and other PPE that they have not received yet. When you're dealing with bodily fluids on a daily basis, how can you ensure your personal safety when your employer does not do this? We should not need to pay out of our pocket for materials that we have been told would be provided by our employer in order to remain safe in our jobs. We were to receive written guidance from the Department of Health, and that has not been provided to date. As I've indicated to you in previous testimony, I am in the group of school staff considered to be high risk due to having diabetes, asthma, and chronic kidney disease. I don't think that I would be granted permission to telework if needed because of the students that I work with. My job may be considered essential, but should I run the risk of becoming ill with COVID and possibly dying? I'm only 54 and I have a 6-year-old grandson. I want to live to see him grow up. Please wait on opening schools until it is safe to do so. Our numbers are going too high. We've already had schools who've had teachers and staff diagnosed with having positive COVID results. Please take this into consideration. Thank you.
David Miyashiro, Ty Baird, Osa Tui. David, can you hear me?
Aloha, can you hear me?
Yes, David, your testimony time begins now.
Aloha, and big mahalo to our schools and teachers for the hard work to make the return to school safe and productive. Your work is very much seen. And mahalo to the board for this space for a productive conversation today. The increasingly divisive narrative around school reopenings, nationally and locally, I believe leads to reactive decisions at a time when we need clarity and unity desperately. So I wanted to highlight a few of the recommendations from our diverse coalition that we submitted in a written testimony. Number one is more clarity and consistency around attendance. So we've heard reports that for some schools, attendance and counting present is merely logging on for a few minutes and logging off. That is not acceptable, and I think a standard definition needs to apply across schools. 2, digital equity. This issue is huge, and it is a major hindrance for 100% distance learning. Yet the forms that went out to parents, I think, are highly inadequate for getting to the nuance that we need. For example, for devices, it does not clarify what kind of device. Not all devices are equal and can support distance learning. And for connectivity, it does not specify the speed. Again, just because one has connectivity through a phone hotspot doesn't mean it's strong enough for digital learning. So we need the data because the private funding community and nonprofit communities desperately want to support and work with the Department of Education. 3, we would recommend creating public data dashboards, not unlike what's being used for the dynamic strategic plan and for FAFSA completion tracking. That kind of data is critical for building trust and prioritizing resources and supports. And lastly, for instructional days, we need to look seriously at using all of the dates in our calendars and pay our teachers more to work during those breaks and make sure that we actually can support our kids with a quality education this year. So thank you so much for what you're all doing, and please be safe. Mahalo.
Ty Baird, Osa Tui, Susan Piccola Davis. Ty, can you hear me?
Can you hear me?
Yes, Ty, your testimony time begins now.
Thank you. Aloha. I am a special education teacher on the island of Maui, and I am testifying on school safety and school protocol in regards to school safety. I have been at work since Monday, August 17th, 2020, with my fellow teachers, with students on campus. We all started work on July 29th, reported then, but since then, our numbers have continued to surge, and we cannot continue to tell our society that we are all safe and that our teachers are safe. My colleagues and I are attending work as we should, as well as preparing for distance learning as agreed upon by our contract. Yet we have, in special education, the most vulnerable population in our hands since Monday. And we are servicing our students in person. The most vulnerable of our population depends on us every day. Yet there appears to be a large discrepancy among bargaining unit 5 members as to what appears to be appropriate. While safety is paramount, there are different degrees of this term. This is totally unacceptable. And we are all striving for higher standards for safety, yet it is not consistent. The added pressure of controlling safety boundaries, making sure social distancing is in place, all while managing to teach children, has become extremely challenging and unfair to our students. I have spent more of my days this week disinfecting student manipulatives, cleaning my floors, wiping my tables, student desks, than I have in regards to my primary role as an educator. It has caused me to question the level of our pedagogy and its effectiveness we are so used to priding ourselves with in our public schools. We are not able to use play structures on our campus because they cannot be disinfected against COVID. Our public health and safety manual states we can't even do this. We cannot use our playground structures. How can we give these children an adequate and an acceptable education in this pandemic? I pay for our children to have these resources.
Osa Tui, Susan Piccola Davis, Kyra Raish. Osa, can you hear me?
Aloha, Gina. Mahalo for everything you're doing.
Oh, mahalo, Osa. You're a little soft. If you can get a little closer to your microphone, please.
How about now?
Maikai, mahalo. Your testimony time begins now.
Continuing President Rosenlee's remarks, thirdly, Haido must implement 100% distance learning for all students. Vulnerable students will continue to report to campuses, including up to 19,000 students with special needs, 16,000 English language learners, 3,000 homeless, and 92,000 disadvantaged students, leaving 43% of students who do not fall into one of those categories. HSTA head faculty reps statewide report varying degrees to which these populations are reporting to their schools, despite leaders saying only those who can't access special education services or internet from home will be on campus. It's disingenuous to claim that our public schools are using full distance learning. Multiple fully self-contained classroom teachers are sharing the dangerous environments with disturbing reports of rooms with 15 to 20 adults not able to maintain 6 feet distancing, which include one-to-one EAs, paraprofessionals, etc., and some of these kids unable to wear masks. Special needs students and teachers are not impervious to the coronavirus. Fourth, HSTA's contract states when students are sent home from school or not required to attend during emergencies which endanger health or safety, teachers will not be required to remain at nor report to said schools. It is very evident that students are being sent home for health risks, but the DOE will not admit this obvious fact and maintains that schools are safe for students to return, which is again disingenuous and fails to protect the health and safety of teachers. We asked our head faculty reps if their schools offered teleworking, and 83 of 148 of them said they had not. Please give clear guidance to the department that teachers should have the option to be allowed to work from home at their request during this pandemic. State and county leaders are instructing employers to be flexible and allow employees to work remotely. Requiring work from classrooms, even if all students are learning from home, will risk exposure to the virus that have already occurred statewide, even without students on campus. This will also help hundreds of teachers who have childcare issues. Please give clear guidance to the Haido as time is of the essence. Please set an emergency meeting to deal with these specific issues as you have no action items today. Thank you.
Susan Piccola Davis, Kyra Raish, Carrie Smith. Susan, can you hear me?
Can you hear me?
There's a very bad feedback on your microphone.
Sorry. Oh my gosh.
Can you adjust your sound, please?
I'm so sorry. I think it stopped.
Yeah,
Do I
that's
begin?
much better. Thank you. Your testimony time begins now.
Aloha, this is Susan Piccola Davis. I have submitted written testimony, and my oral testimony focuses on our superintendent. The superintendent needs to answer all information requests from the board, or the board needs to request an auditor from the state, as the Senate Committee on COVID did yesterday due to your unresponsiveness. Apprise the board of any important information prior to announcing to the media. Create a collaborative decision-making process that doesn't create groupthink. Distribute accurate, transparent, explicit, and timely information to all constituents. Stop using the data from quarter-force surveys to justify your current decision-making or using it to confuse or sway other decision-making. It was only a snapshot in time. Provide timely professional development. Sequence relevant training so that those completing it will be able to do so in a rational way. Stop the appearance of retaliation and retribution. Bargain in good faith, which includes acting ethically, discussing truthfully, and seeking a reasonable outcome for all parties. Stop creating a hostile relationship between the DOE and HSTA and other unions. Act professionally and display competence. I would trust that you will take this testimony in consideration of what went wrong, why it went wrong, and how do we correct this. Respectively submitted. Thank you.
Kyra Raish, Carrie Smith, Lynn Otaguro. Kyra, can you hear me? Kyra? Final call for Kyra. Carrie Smith. Carrie, can you hear me?
Yes.
Thank you, Carrie. I can hear you as well. Your testimony time begins now. Carrie?
Hello, can you hear me?
Now we can again.
Oh,
Your
sorry.
testimony time begun and we lost you.
As a member of the Hawaii education community, I have been very concerned that our schools are using the program Acellus Academy as the primary learning tool for our keiki. I want to make the school district and community leaders aware of the harm that the creator of Acellus Academy, Roger Billings, has caused. There are several reasons why this program should not be used for students in Hawaii or anywhere. Roger Billings is a proclaimed prophet and leader of a cult in Missouri, and this cult practices polygamy and forces its members to become polygamous. We have members of our community who have firsthand experience with this. There is also one member of our community who has children in these schools who was taken to this cult when she was a child and sexually molested by Roger Billings himself. And for me, that is a hard line. I cannot support anyone who sexually abuses children, period. While this program is not the man, and the owner and creator of this program directly benefits from our tax dollars being spent on this program. Being a member of our Hawaii community, this person has shared her trauma with the school principals. While some school principals swiftly took actions to remove this program, other principals have not. While we advocate for complete dismissal of this program from all Hawaii schools, we recognize that other principals are offering zero tolerance and allowing for accommodations. As a member of this community with 2 children who attend school here, I ask that we would be offered proper accommodations so that we can stand with victims of abuse and allow our children to continue education in these public schools and not have to use this program. Thank you for your time.
Lynn Otaguro, Danielle DeLise, Caroline Batule. Lynn, can you hear me?
Can you hear me?
Yes, Lynn, loud and clear.
Oh.
Your testimony time begins now.
I am Lynn Otaguro. Before I was a teacher, I worked as a Deputy Attorney General representing our state, including the Department of Education. I am testifying on item 5A. Recently, Civil Beat asked, is COVID-19 spreading because people have gotten tired of restrictions? Maybe. But part of the problem is that we in state government are giving people mixed messages. When we were clear that it was necessary to lock down, people were good. Now, with worse numbers than in March, we say that the situation is serious, but we only closed down some things, and we say it is okay to go to school. Is the situation serious, or is it safe? Under these circumstances, would our students believe us when we say they must not play together? In the past few weeks, we have seen COVID-19 infection rates rise dramatically, and members of our medical community express concern about our hospital capacity. A group of health professionals that I know is gravely concerned. At this point, when we talk about reopening schools, we are not just talking about students and staff, but about the safe health and safety of our communities. This is a public health concern. COVID-19 must be addressed and levels of infection lowered before we can have any in-person instruction. There is no plan for our states to implement testing, or for our schools to implement testing, or any proposal that limits the infection from coming into our schools. Not inspected our classrooms for adequate ventilation or airflow. We don't have metrics to say that it's safe. But we do know that when schools have opened in places where infection rates are high, the infection has spread. And so our message must be clear and our actions must match our words. If we do not want our schools to become places of transmission, if we are serious about health and safety, then this board must determine that there will be no in-person instruction until infection rates stop.
Danielle DeLise, Caroline Batule, Derek Gavin. Danielle, can you hear me? Danielle. Final call for Danielle DeLise. Caroline Batule. Caroline, can you hear me?
Yes, hello.
Hi, Caroline. You have an echo behind you. You might want to readjust your sound.
Oh, let's see. Is that any better? Hello?
All right. Your testimony time begins now.
Okay, thank you. I am testifying today because I would like more transparency and consistency with regards to which children are identified as a part of our vulnerable population district-wide rather than on a school-by-school basis. Our elementary school, while on a military installation, is not a DoD school. However, our administration has placed children on full face-to-face educational tracks based on their parents' employment in the military, among other subjective criteria. While many parents requested full face-to-face schedules, including those with children in grades K through 2, many were told the school couldn't support these requests with the staffing they currently had. However, other children without disabilities listed by the DOE were also given the choice of face-to-face learning. When clarification of the criteria needed to qualify for face-to-face instruction was sought out, parents were told it was a need-to-know scenario and too complex to discuss. If our district had decided that all children of working parents should have a safe place in which to do their schoolwork on their virtual days, I would welcome this solution to the burden that distance learning places on working parents. But to only offer the option to people of certain occupations and to allow those children to have full face-to-face time while their peers receive half the face-to-face time at best is both an economic advantage to the parents and an educational advantage to those children. Why, in a public school setting, are we considering the needs of parents above the needs of children? Why is asking who employs a child parent not considered incredibly discriminatory, but instead hailed as being a personal approach? Public education is about the needs of our children, and educational equality and equity is what our principals should strive to achieve. I believe there must be more oversight and enforcement of guidelines in order to ensure our children are all getting an equal opportunity at education. Thank you for your time.
Derek Gavin, Ashley Kelso, Benjamin Konchak. Derek, can you hear me?
Yes, can you hear me?
Yes, Derek, if we can. Your testimony time begins now.
Dear Board of Education Chairperson Payne, board members, and Superintendent Dr. K, my name is Derek Gavin, and I'm a special education teacher for students with severe special needs in the community-based instruction program at Roosevelt High School. With respect, Chair Payne and Superintendent Dr. K, please hear me out. You know me. You've both been in my classroom. You know my students. You know my passion and my love for my students and this profession. This week, we welcome students virtually into my class. I have 5 contracted skills trainers and RBTs that I was giving on Wednesday of this week to set up for the school year. They showed up with only a cloth mask. Their companies provided them with no training and no PPE at all, especially not medical grade. So who is responsible for this when they get sick from inevitably breaking the 6 feet distance norm? I can't use Zoom. It's not allowed. I need video breakout rooms to support my families. I need time to set up the programs with the skills trainers and the RBTs. And to be clear, this week's virtual learning was a disaster. I wasn't alone in this feeling. Just today, another FSC teacher messaged me, said, quote, "I feel like such a failure today." The fault is not that we're not setting up programs or working incredibly hard. It's that things change weekly. Plans have to be adjusted, and I have not had adequate time to prepare this virtual program for each individual student. I'm a good special education teacher. And to be clear, my students rocked virtual learning with me over Q4. I love my profession, but I hate waiting for a mess which could be resolved with more planning time. I'm happy to work on a committee as a SPED teacher to develop appropriate next steps. This being said, I must be opposed to discussion item regarding reopening of schools face-to-face. With respect, I'm urging you to please hear me. Allow us more time to prepare appropriate virtual and face-to-face programs for the time when it is safe to open schools again. Thank you.
Benjamin Konchak, Ashley Kelso, Debbie Anderson, Steve Wardle. Benjamin, can you hear me?
Yes, I can. Can you hear me?
Yes, Benjamin, loud and clear. Your testimony time begins now.
Thank you very much, board and teachers and everyone else working on our education of the keiki of Hawaii. I am a parent who lives on the Big Island, and I have chosen the distance-only option that has been offered by my son's elementary school. I have two topics that I wanted to talk about today. The first is I wanted to reiterate the other concerns that were brought up by some of the other testifiers about the Acellus distance learning program. When I first looked at the program, it looked acceptable, maybe a little bit plain, but it appeared to be a sufficient program. As some concerns were brought to myself by another parent about the background of the organization, and I did some reading on the founder and the Institute of Science that puts out the curriculum. What I found is it appears to not meet professional standards. The Institute of Science is not accredited. It appears to be an organization that has some cult or religious affiliation that brings people in and awards them degrees, and it appears uses them to develop curriculum in exchange for these degrees, and then also use them to develop the curriculum. And I think this is an insult to our teachers that we have curriculum being developed by unaccredited unaccredited teachers. The second thing that I wanted to bring up is I really would like to encourage distance learning, and for the Board of Education to support distance learning as COVID is rising, and we need to have the tools and the training for our licensed teachers to provide distance learning, a uniform approach, and a commitment.
Ashley Kelso, Debbie Anderson, Steve Wardle, Sherry Nakamura. Ashley, can you hear me?
Hello?
Ashley Kelso. Final call for Ashley Kelso. Debbie Anderson. Debbie, can you hear me?
I can. I unmute.
Debbie, I can hear you. You're fine.
Thank you, Gina.
You're welcome. Your testimony time begins now.
I'm the grievance rep at YK Intermediate in Hilo, speaking on discussion item A, particularly item 6, reconciling collective bargaining agreements, CBA. Article 11 of the United Nations Declaration on Human Rights includes the right to protection of health and safety and working conditions. So that's the foundation of what our conversation is regarding. The Centers for Disease Control and Prevention reports that one of the most effective ways that employers can help reduce the spread of COVID-19 is teleworking. The governor of Hawaii stated that he was asking employers to accommodate their workers' needs for flexibility to be home with young children who are not able to be in school. We have a spike in COVID-19 cases and widespread transmission. We have 5 new cases in Hilo today because of the community transmission issue. In our contract or CBA, Article 10G states, when students are sent home from school or are not required to attend in person due to emergencies which endanger health or safety, teachers will not be required to remain at nor report to said schools. So the default is that teachers should be working safely from their homes unless they choose to opt in to work on a campus by notifying administration that they would like to do so and that their room would need to be cleaned afterwards. In June 27th, the superintendent and Corey Rosenlee stated that at-risk teachers could be provided options, including telework. It's not good faith to cancel this. There are guidelines for the Department of Telework program that says telework shall not be unreasonably denied, and the OTM assistant superintendent can waive requirements in emergency situations.
Steve Bortle, Sherry Nakamura, Kylie Sanchez, Cara Flores. Steve, can you hear me? Steve?
I can hear you. Can you hear me?
Yes, loud and clear, Steve. Your testimony time begins now.
Awesome. My name is Steve Bortle. I am a special education teacher at James Campbell High School. I'm also a retired military and been around the world and seen a lot of unclean environments. And it doesn't make any sense to me to allow students to go back in school when we still have number of cases in the triple digits. Although we're saying that we can have telemarketing or teleteaching, distant learning for general education students, our special education students that are in a community-based instruction classroom or a fully self-contained classroom are able to come to school with no restrictions. This puts a major strain on the classroom, the teacher, the students, the parents, the education assistants, the school as a whole. And by allowing students to come, you know, if any of us get sick, if any of us come in contact with someone with COVID, that puts a major strain on everyone in the classroom. We already have had teachers who have called out, and then we have to get unqualified subs to cover for them. And plus, there are still students in those classrooms that are doing the distant learning. We should push everything, all students, to distant learning. If we cannot have 5 people meet up in a supermarket, 5 people meet up at a tennis court, 5 people meet up anywhere that the mayor and the governor are saying, then why should we have 5 or more people gathering in a classroom? That is all I have to say.
Sherry Nakamura, Kylie Sanchez, Cara Flores, Inga Park Okuna. Sherry, can you hear me?
Yes, yes. Can you hear me?
Yes, loud and clear. Your testimony time begins now.
Mahalo. Aloha, Chair Payne and members of the board. My name is Sherry Nakamura, Director of He'e Coalition. I'm commenting today on discussion item 5A. We thank the board for having this discussion on the reopening resolution policy and school level implementation concerns. We wanted to highlight 2 community concerns, which is also articulated in our written testimony. And it's just a note, I didn't see our testimony posted, so I just resent it for the board members' reference. The first one pertains to lines 154 to 172 in the resolution regarding the criteria for transitioning between instructional delivery modes. While we know that the COVID-19 situation is fluid, we absolutely need system-level clarity on the changes and an information rollout that is timely. As the resolution directs, we need clear, objective criteria to let families know when it will be full distance learning or back to in-person instructional models. With this, families can plan to adjust and also have a better understanding of why decisions are made. The recent change to distance learning days before school started was extremely jolting and difficult for everyone. Health Director Dr. Bruce Anderson mentioned that the Department of Health, in conjunction with the Department of Education, is working on criteria for triggers, so we hope to see these metrics very soon. Secondly, we would like some clarity on distance learning terms. We hear that families are struggling with the myriad terms and are confused. It would be great if the department could define these terms so that there is common language across the system. We have members in our HUI who are extremely experienced and versed in this distance learning arena and would be happy to provide assistance. Thank you for this opportunity to testify.
Kylie Sanchez, Cara Flores, Inga Park Okuna, Alexandra Abra. Kylie, can you hear me?
Yes, can you hear me?
Yes, I can. Your testimony time begins now.
Okay, thank you. My name is Kylie Sanchez, and this is my 7th year teaching in Waianae. I am teaching 100 art students virtually with 0 students physically in class. I am speaking today on behalf of all teachers who are forced to teach from empty classrooms. We have been denied the right to telework, though a vast majority of teachers desire and have the ability to do so well. And the superintendent is blaming the July 24th memo, which was posted 2 weeks prior to when distance learning was announced on August 7th. Doesn't that make the policy irrelevant since it has not been revised considering distance learning is happening now? We should have the right to choose if we need to get into our classrooms or teach from home, which gives us more time for our students. I spend 1 hour a day driving to and from school. A teacher next door to me drives 3 hours daily. Wouldn't these 5 to 15 hours a week be better used when our curriculum has to be completely revamped to fit online platforms due to the fact that we only had 1 week notice of distance learning? Please do not do that to us again by waiting until September 8th to decide for once again a plan that we are expected to roll out less than a week later. Telework should be our choice, and denying it is a violation of our contract. Stop saying principals or CASs are to blame, because I have the most caring and intelligent principal, and he would let us work from home if it wasn't being told to them under the table to not allow it. You are denying the students' right to a quality education by forcing teachers to do what has been deemed unsafe for our students, to come on campus every day and waste time sitting in empty classes when there are thousands of us who desire to telework. We don't all need markers and whiteboards every day in our quote unquote schoolhouses. We're the ones actually doing the work day to day, and we know what we need, yet we are treated as if we aren't professionals. We are demanding higher standards for how we are treated and trusted to do the job that we've been doing all along without needing a babysitter. It would go a long way in boosting morale when teachers are starting to resign and find other jobs. If we aren't babysitters, then prove it and treat us like we don't need to be babysat ourselves. I'm sick of the double standard of DOE officials working from home while we are not afforded the same choice, as if we are replaceable workers.
Cara Flores, Inga Park Okuna, Alexandra Obra, Shoho Wong. Cara, can you hear me?
Yes, can you hear me?
Yes, I can. Mahalo. Your testimony time begins now.
Hi, I'm Cara Flores with Hale, Hawaii. I'm a concerned parent, and I wanted to call in and address the fact that the Department of Health does not have its act together. They've been called out publicly by our Senator Tulsi Gabbard and our Lieutenant Governor Josh Green. And how are we supposed to trust them to tell us how to open schools safely when they aren't doing even the most basics of their job? It is the state's job to stop community spread and get an environment created where it is safe enough for us to have school. That's not the Department of Education's job, and they shouldn't try to force school to happen in an unsafe environment. There needs to be a stop to community spread, and until that happens, it is not safe to have in-person learning unless it's safest to not do it. Also, I don't understand why teachers are not being allowed to work from home when other state employees are being allowed to do this. I believe all teachers who don't have students in their classroom should be able to work from home if they choose, because it minimizes the risk of exposure to other people. Parents and teachers should have the right to know if there is COVID at their school. It shouldn't be by districts or areas. It should be by school, and everyone should be notified right away. There need to be benchmarks for things to know when they're safe. It's not responsible to have school without having some benchmarks for safety and understand the metrics that are being used. I need to know that you guys are consulting experts and not just making it up as you go along. I'm also appalled to find out that there are no school nurses, and my kid's school does not even have a health aide. Why aren't there professionals at school who are trained in medicine during a pandemic? How is anybody supposed to be safe when there's no one medically trained to handle a public health emergency?
Inga Park Okuna, Alexandra Obra, Cheo Wong, Amanda Ka'ahanui. Maya Leibowitz. Inga, can you hear me?
Yes, can you hear me?
Yes, Inga, mahalo. Your testimony time begins now.
Hi, my name is Inga Parker, elementary school counselor and a parent and grandparent of public school students. I am also the HSTA Honolulu chapter president. I hope you are concerned as many schools are having students on campuses. As the number of positive COVID-19 cases have risen, so has the anxiety over schools reopening. Teachers have been contacting me as well as our Honolulu UNICEF directors to express their anxiety in having students come back on campuses. We look to the DOH and DOE for assurances of safety, but there isn't any forthcoming. One can assume either they don't have the requested metrics or that the metrics would show that it isn't safe to have students on campus. Honolulu teachers have expressed concerns over having to be on campus, especially in larger schools. Teachers have told me there have been positive cases among students and or staff, and they don't know if they were exposed to COVID. A teacher who had multiple health issues in C5 said that she actually interacted with some students who were diagnosed with COVID a couple days later. She was wearing a mask, she had gloves on, but the fear is real. Since she had to hand things over to them, they were only a couple feet apart. Teachers should be able to work from home if they want to or need to, and if they are in their classroom, they should feel safe and protected. That can't happen if they have their vulnerable or preschool students on campus. Recently, we've been hearing how young children are carriers of COVID and when infected have higher than the average amount of the virus in their noses and throats. And many people are asymptomatic, so there's no accurate way to screen students or staff members. Until we can be together on campus, please initiate 100% distance learning for all students, at least through the first quarter. Protect our most vulnerable. Please allow teachers to work from home if they want to. Please respect and trust that we will work above and beyond, and let teachers decide where we need to do our job and how to feel safe. Thank you for the work you do on this board.
Alexandra Obra. Xiaoho Wang. Amanda Ka'ahanui. Maya Leibowitz. Alexandra, can you hear me?
Yes.
And I can hear you as well. Mahalo. Your testimony time begins now.
My name is Alexandra Obra, principal of Waiahole Elementary School. Today, I'm advocating for the health and safety of my students, teachers, staff, families, and the Waiahole Waikane community. During the first 2 weeks, I prepared my staff for the inevitable by letting them know that we need to be ready, not if COVID-19 happens on our school campus, but when it happens. Recently, an employee tested positive for COVID-19 at the school. This is not the first nor the last time an employee will be tested for COVID-19. I am writing to let you know that I recently tested for COVID-19, or I had to test for COVID-19 as I came into close contact with the employee who tested positive at my school. I have years of service with the Hawaii Department of Education, and without a doubt, this has been the most stressful experience that I have faced as a school leader. I am physically and mentally exhausted. My question today is simple for you. If a principal tests positive for COVID-19, who will run the school? At Waiahole Elementary School, I do not have the personnel to move around to help run the school while I am out. While we are dealing with the positive COVID-19 case, the following staff members were out due to testing. My SASA, myself, the school health aide, my custodian, the substitute custodian, a special education teacher, and 3 educational assistants. I ask you again, who will run the school in my absence? Is there a contingency plan for when the principal tests positive for COVID-19? I am disheartened and extremely frustrated with the lack of support that I am receiving during this time to do my job. As frontline workers, we need support and clear processes to help guide our decision-making at the school level. I urge you to make the correct decisions and the best decisions to keep our keiki, our teachers, our staff members, and our communities safe. Thank you for your time.
Xiaoho Wang. Amanda Ka'ahanui. Maya Leibowitz. Deborah Bond Upson. Xiaoho, can you hear me? Xiaoho Wang. Final call for Xiaohu Wang. Amanda Ka'ahanui. Amanda, can you hear me? Amanda.
Can you hear
Final
me?
call for, yes,
Hello?
aloha, Amanda.
Thank you so much.
I can hear you. Your testimony time begins now.
Aloha, my name is Amanda Ka'ahanui, and I'm testifying today on agenda item 5A. I am the proud parent of a high school special ed student on the windward side of Oahu, and I have 3 concerns to share with you today. Number 1, we need to keep providing virtual instruction until at least the first quarter. Making parents and teachers wait until the last 3 days before virtual instruction ends to decide if they'll keep going or switch to in-person is not appropriate leadership. Our kids need a routine so they can feel safe and secure. Our parents need time to plan and make arrangements for work and childcare, and teachers need time to prepare for that pivot too. Number 2, we need a solid policy around returning to school in person. We need a threshold, a number. How many days with no new COVID cases before it's safe to return our children to school for in-person instruction? We had that in the spring with the DOE statement, no in-person school until we're 4 weeks with no new COVID cases, and we should have a similar policy to that now. COVID is not going away, and until we do our part, that's what the governors, the mayors, the doctors are all saying, do your part. Keeping kids at home until we reach that safe threshold is the DOE's part in this process. Number 3, we need community input and partnerships around decisions on instructional delivery and other topics at the state level. Do another survey. Ask us what we want and what we need right now, not based on when our COVID numbers were nearly gone in May. Some schools had community input meetings, but not all of them. My school did not. The all or nothing approach is not working, not for gen ed, and certainly not for special ed students. Some special ed students are vulnerable students, have health concerns that make it unsafe for them to come in person. Acellus, as we've heard, is not an appropriate learning platform, and a virtual learning model was not offered at the state level. Some kids don't do well with virtual instruction either, but some, like my kid, love virtual. He gets to see his teachers and his friends, and he doesn't get sick. No one asked him what he wanted. His student voice has been silenced. We need a continuum that will work for all students.
Maya Lebowitz, Deborah Bond Upson, Justin Manuel Bergonio. Maya, can you hear me? Maya?
I can hear.
Hi, Maya. Your testimony time begins now.
Hi, my name is Maya Leibowitz. I'm 11 years old, and I'm going into 6th grade at Kailua Elementary. I am testifying to attend virtual school until it is clearly safe to attend face-to-face. Now, I love school, I love my teachers, and I love my friends. But right now, it's just not safe. We shut down schools when we had 20 cases of COVID every day. Well, now we have about 200, and yet we are still going ahead with the plan to open schools face-to-face in about 3.5 weeks. I say this as a kid, but also as a sister to a 5-year-old. The plans in place are completely unrealistic. You cannot expect kids to stay 6 feet apart and wear a mask for 7 hours all day, every day. You can hardly expect adults to do this, much less a 5-year-old. At this rate, we are not going to go from 200 cases to 0, or at least a safe amount in 3.5 weeks' time. And opening up before it is safe will just raise cases. More people will get sick and fatalities will most likely rise. These are not just numbers on a screen, these are human lives. So instead of rushing forward with an unsafe plan to open face-to-face, we should take this time to build a solid distance learning plan, finding ways for kids with special needs to get what they need, making sure everyone has tools and an environment they need to learn. Last year, no one could have prepared for this, but now we have time to, and we need to take it, making sure that we can get the most out of school while staying safe at home. Thank you.
Deborah Bond Upson, Justin Manuel Bergonio, Denise Caddy. Deborah, can you hear me?
Yes, Tina, can you hear me?
Yes, I can. Mahalo. Your testimony time begins now.
I'm Deborah Bond Upson from Learning Bond, testifying on agenda item 5A. I usually testify from my volunteer board role at Parents for Public Schools of Hawaii, but today I'm speaking from my lifelong career leading education organizations in developing and delivering blended learning solutions to states and districts. I mention my background so that you know I speak from experience in learning technology issues at the state and district level. Please see my more detailed thoughts and charts in the written testimony. As we consider further delays to a safe return to on-site school, I want to share that virtual learning can be more effective with well-designed systems when mediated by our teachers. We can deliver blended teacher-mediated instruction online and on-site with meaningful attendance and assessment capabilities, not just in this pandemic, but on into the future. We in Hawaii need to reevaluate what should be developed strategically and provided by the district, and what should the schools and teachers be able to create and localize as only they can. We need a state-level health and safety guidelines, and we also need integrated, modern, streamlined education management and instructional systems now. Leaving learning system decisions to schools causes inconsistency, stresses families, and wastes our most precious resource, teacher time. We should create and integrate systems that enable teachers to access resources easily and maximize student contact. Blended learning mediated by teachers works. Online learning without teacher leadership falls far below effectiveness. In this pandemic, schools and districts have communicated in many ways, yet families are struggling for information and understanding beyond a tech helpline. We need a central entrance, an effective portal for two-way communications for every family, student, and teacher to access the latest news, to enter the learning system for curriculum and progress to best support students. These needs will not go away when we
Justin Manuel Bergonio, Denise Caddy, Christine Russo, Amanda Lacar, Burke Burnett, Muriel Ellsworth, Carly Kaneshiro. Justin, can you hear me? Justin Manuel Bergonio. Justin, can you hear me?
Hello, can you hear me?
Yes, Justin, I can.
Beautiful.
Your testimony time begins now.
All right. Thank you again for hearing us out. My name is Justin Manuel Rivera Bergonio. I am a sixth-year math teacher at Waipahu High School. I'm here to offer testimony to action item 5A regarding the reopening of schools during this global pandemic. Last time I testified, I had shared with you my fears and worries and anxieties for my students, colleagues, friends, and family upon the reopening of public schools. To put it plainly, I was scared, hopeless. It's been almost 3 weeks since then, and I can tell you that in addition to those feelings of fear and worry and anxiety, you can add exhaustion and excitement and hope and hopelessness all in one. That's what it feels like to be a teacher right now. I'm exhausted because I spent almost 12 hours just last night coming up with an organized lesson for my geometry and calculus and physics class this year. This included a structured Google slide presentation, strategically placed checks for understandings, a digital syllabus so they would not need to submit anything physically, and an online survey to get to know my students' interests, tech capabilities, and past experiences with math. Forgive me for not being more prepared. Besides the basic whiplash of distance learning, asynchronous, synchronous, back and forth by the DOE. In addition to that, all last week I had to worry about my aunt's and my father's and my wife's and my own COVID test results after both my aunt and my father came into contact with coworkers who tested positive in their own separate workplaces. Fortunately, we all tested negative, but we can't say the same for their coworkers and families. I want to tell you that it's just been a roller coaster, to say the least, and I don't know what to believe, and I'm trying my best to understand both sides, but it's just really hard to figure out who's right and who's wrong. And all I can say from the ground down here is that it's just really exhausting, and I want to stay in it for the kids, and I'm trying my best to be there for them, but how can, I be okay for them if I'm not even okay? Thank you for your time.
Denise Caddy, Christine Russo, Amanda Lacar, Burke Burnett. Denise, can you hear me? Denise Caddy. Final call for Denise Caddy. Christine Russo. Christine, can you hear me?
Yes, can you hear me?
Yes, I can, Christine. Your testimony
Okay, thank you.
begins now.
Aloha, Chair and members of the board. My name is Christine Russo. I'm a teacher at James Campbell High School. I'm testifying on item 5A. During the physical school closure in fourth quarter of last year, I imagine the Department of Education was working on a comprehensive and well-structured plan to educate our students in school year 2021 in the midst of this global pandemic. However, since then, we've seen one chaotic shift after another that has left all stakeholders reeling. Parents who can't plan for the future because the situation keeps changing, administrators who are left with vague guidance, and who have their own interpretation of this guidance, and teachers who have had to scramble at every turn, whether that be the impossible task of preparing their classrooms for a biohazard or updating curriculum so that the content is engaging, interactive, and relevant, even in the online setting. The reason we've been in this endless loop of chaos is the department lack of foresight on the realities of this pandemic. Even in March, we knew this virus wasn't going anywhere. Yet even today, the department has failed at providing a long-term comprehensive plan that puts the health and safety of all students, administrators, teachers, and staff at the forefront of everything. After all, there's no learning in the midst of illness, trauma, and death. I appreciate that the State Departments have been dealt an impossibly complex situation to manage. However, we can no longer continue on this path of last-minute shifts. It's time for the DOE to create a long-term plan that puts the health of everyone first for the remainder of the school year. I also plead with the board to immediately address the fact that some of our most vulnerable special education students are still coming onto our campuses. It's negligent to be bringing students onto our campuses while our community continues to face the exponential spread of COVID-19. Our teachers and EAs in our FSE classrooms are terrified, many sharing that in the midst of this surge, their students are unable to participate in even the most basic sanitization procedures or wearing a
Amanda Lacar, Burke Burnett, Muriel Ellsworth, Carly Kanehiro. Amanda, can you hear me?
Aloha, yes I can.
Mahalo, Amanda. Your testimony time begins now.
Hi, my name is Amanda Lacar. I'm a special education teacher at Mokolele Elementary. This is my first year at an elementary school. I'm speaking on 5A. I've also submitted written testimony. There's a lot of different points that a lot of us are making, and I hope to be able to cover some of them today. The first one I want to make mention to the Board of Education was that as a teacher, as part of HSTA, which I am HSTA, I personally felt bullied by our superintendent, by her using the DOE email and also sending a separate email and deleting it from our system. I feel is just totally should never have happened. But again, I feel bullied because she went against just so many things of what our president was saying, and he's the face and voice of HSTA, but I am HSTA. My colleagues are HSTA, and we will not stand for that. Another point I want to bring out is I'm a special education teacher. I have spent 22 hours this week instructing students. I have no real breaks with them. I have no time to work on their IEPs because I have them from 7:45 to 2 o'clock. The state is going to be mandating the distance learning plan soon. The DOE, the superintendent, is not providing support to the principals. And I know this from my school and many other schools across the state. The superintendent is not providing supports for those 3 hours per CC student for every IEP care coordinator. If that's not being done now, when it comes for those law cases, it comes down on the superintendent. As a special ed teacher, I want to do right by my students. I would love to be given more time to prepare for distance learning because we were forced to learn to prepare for face-to-face, and then videos were shoved down our throats. And I provided written testimony to show the Board of Education how horrible many of those videos were, and they were.
Burke Burnett, Muriel Ellsworth, Carly Kanehiro. Burke, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, Burke, mahalo. Your testimony time begins now.
Thank you. Aloha kako, my name is Burke Burnett. I'm the parent of an 8th grader at Kaimuki Middle School, and I'm one of the founders of the group Hawaii for a Safe Return to School. I want to thank the DOE for its decision on 7th of August to delay in-person classroom instruction until at least 14 September. This was an important step forward, but it's still insufficient to protect the well-being of our community. The current surge will continue for at least several more weeks. This is simply the nature of pandemic disease curves. So it's therefore imperative that the DOE extend the mandate for 100% distance learning until A, there is a clear and scientifically sound set of metrics indicating the level of COVID exposure risk in the larger community, and B, those metrics indicate that reopening schools can be carried out with a reasonable degree of safety. This will require additional input from outside Department of Health. In particular, I'm calling for Hawaii to use a basket of metrics, including the number of new cases per 100,000 people, number of active cases per 100,000, the estimated rate of transmission or RT, hospitalization rates, ICU headroom, and other metrics. It is critically important to not use a single metric, such as test positivity rate, to drive decisions. The TPR is a measurement of how good your testing program is. It's essentially telling you how good your other numbers are, but it's not a good measurement of the current state or its trend of the disease. We should be following the California model, which uses a basket of metrics to guide when it is safe for schools to reopen. For example, one metric used in California requires schools to stay closed if there are more than 100 new cases per 100,000 residents over the previous 14 days. That's an example of a good metric to use. Unfortunately, given the catastrophic failure of the Department of Health to competently perform its duties, it is essential that external experts be part of the process to drive these metrics and reach a consensus that reflects and serves the needs and wishes of our community, protect the health of our citizens. Thank you.
Muriel Ellsworth. Carly Kanehiro. Muriel, can you hear me?
Yes, this is Marae Ellsworth.
Thank you, Marae. Your testimony time begins now.
Yes, I'm a public high school teacher in Hilo, and I just want to address the board that trust is in very short supply. Toxicity is rampant, and I'm not just talking about the virus. In fact, a title of a book comes to mind, The Death of Common Sense. It makes no sense to go against the sound advice of working from home during this surge. They're saying no gatherings of more than 5, yet schools are open. I had high school students all week online, and my students have been asking me, what is going on? They see the lack of common sense, and they're watching. And adults, especially leaders, need to make common sense decisions to be role models to our youth. Regarding blocking telework, teachers are just insulted. I mean, you trust us with kids, but you don't trust us to do our job from home? Where is the common sense? Next, make the common sense decision to extend distance learning until at least the end of the semester. I mean, we're in a surge, and as speakers before me said, kids need consistency. I would hate to have to tell a small child, yes, you're going to school. Oh, no, you're not going to school. Yes, you're going to school. No, you're not. It's horrible. And for teachers, I can't even make a syllabus. I can't even plan ahead with this week-to-week, month-to-month thing. It's stressing everyone out. It's adding to the stress, which is unhealthy. The kids deserve a quality education, not this piecemeal week-to-week decisions. It's crazy. You need to allow telework and extend the distance learning. You need to trust teachers, stop insulting and disrespecting us, or you might have a mass exodus. That's just common sense. I want to thank you, Chair Payne, for your 68-page document.
Carly Kanehiro. Carly, can you hear me?
Yes, can you hear me?
Yes, Carly, I can. Mahalo, your testimony time begins now.
Hello, my name is Carly Kanehiro, and I am testifying on action item A. I am a teacher at James Campbell High School. Superintendent Kishimoto said, we are ready. Our students are ready. No, Superintendent, we are not. It seems the DOE and the department that represents us is not listening to us. Over 7,000 pages of written testimony advocating for the safe return of public schools have been submitted, and here we are, after we had 4 days of face-to-face instruction for many schools. How many keiki, parents, kupunas, teachers, and staff will have contracted COVID from this reopening? How can we live with ourselves knowing that we could have prevented this, but we chose a more dangerous path? The option where the ones we are trying to protect and support are the ones we end up hurting. We're most likely going to see a spike in cases because of this in the upcoming weeks, yet the DOE still thinks it's a good idea to reopen to hybrid learning after September 11th. When will you see how the decisions you are making are impacting the lives of our community and our Ohana of Hawaii? Why was September 11th chosen as the date that we may return face-to-face instruction? Again, what is the data for that resume date? What are the metrics that schools would be safe to reopen, or did they just pick a random date? Is this going to be a month-by-month basis? Are parents, students, teachers, and staff going to have to plan month by month because our leadership is not strong enough to make definitive decisions? How will the Board of Ed and DOE respond to the rise in cases? What will you say to parents or teachers or childs that will get sick? Or a family member that loses their grandma because they contracted COVID at school? Or the Sped teacher who is immunocompromised but who asked to show up for her 15 FSC kids who could also be high risk? Why? Do you think these decisions are protecting our vulnerable population? No, they are not. What our keiki truly deserve is to have strong leaders that will listen and consider the health and needs of the community. Thank you.
Chair Payne, that concludes oral testimony.
Thank you. Thank you to all who testified. We've also received several hundred pieces of written testimony, and I recognize many of the testifiers as among those who submitted written testimony. They are all publicly posted on the board's website. Board members should have been reviewing this testimony over the past few days. And since there's no more testimony, we will move on to our next agenda item. This is an action item 4A related to the UNGA versus Board of Education et al. There is a complaint attached in your meeting packet. It was filed on April 14th, 2020 by plaintiff Sunny Rainbows Kim against the Board of Education and the state of Hawaii. Per its administrative rules, the board cannot take action in executive session and is required to take action in public. We have a recommendation that I'm going to ask approval from the board. I'm going to read it and then I will need a motion. I recommend that we grant authority to the board's Deputy Attorney General to enter into settlement negotiations with plaintiff in UNGA versus Board of Education. May I have a motion and a second, and then we could have discussion if needed. Board Member Takeno?
I'm so moved.
Board Member Bakarse?
Second the motion.
The motion has been moved and seconded. Is there any discussion? Seeing none, I will proceed to the roll call vote. Board Member Voss?
Aye.
Board Member Takeno?
Aye.
Board Member Nama'u?
Aye.
Board Member Fallon?
Aye.
Board Member Cox?
Aye.
Board Member Bakarse?
Aye.
Board Member Asher?
Aye.
And Board Vice Chairperson Uemura?
Aye.
Okay, the motion has been approved. Thank you very much for that. We will now move to our discussion items, which is 5A. This is our only discussion item for the day. It is an update on the implementation of the board resolution adopted on June 18th, 2020, directing the department to prepare for the reopening of public schools for the 2020-2021 school year amid the COVID-19 global pandemic, focusing on concerns regarding health and safety, distance learning, personnel, food service, student transportation, reconciling multiple guidance documents, and collective bargaining agreements and communication. On June 18th, 2020, the board adopted a resolution providing the department with big picture guidance on preparing to reopen schools amid the global COVID-19 pandemic. The reopening resolution is attached as Exhibit A to my memorandum in your meeting materials. School administrators, teachers, and families submitted written testimony for the board's meeting on July 23rd and July 30th, expressing serious concerns regarding the reopening of public schools. Both during the July 23 to 30 time period and after these meetings, individuals have reached out directly to the board and have continued to express serious concerns. I want to share some thoughts before we move into the board discussion. This has been a very hard journey. We have all been on this journey since March. We like to say things will get easier as we learn more and figure out how best to adapt or pivot, a word I'm starting to dislike. So far, it has not gotten easier. Some of you have expressed that you are losing your balance from all the pivoting. I know that there is a human limit in all of us, and that as leaders, we have to be mindful that our jobs require our personal limits to go beyond those we are charged with caring for, supervising, and supporting. This includes teachers who are leaders in their classrooms or within their faculty and who care for their students and colleagues. This includes principals who care for staff and students and administrative staff who oversee schools, districts, and state offices. It includes the Board of Education as we try to understand and give direction from the highest balcony, while at the same time hearing concerns about how things are being experienced in schools. When we are dealing with daily uncertainty from the highest levels of leadership in our nation and in our state, our stress and frustration evolve into fear. When we are afraid, we drop to the lowest level of our developmental hierarchy and just want to find a way out of the situation that is causing us fear. That is rudimentary brain science. And as leaders, this is the first thing we have to address in a crisis. Parents and children, our students and their families are also worried about what is going to happen next. And that worry plays out differently in families as it does in schools. There are many different situations that impact risk and fear that are related to specific contexts. We have heard from almost all groups that I have mentioned, but not all, and some in our community do not have their voices in this discussion. So we must not forget them in our upcoming conversations. The issues in the posted documents from the board were current as of 9 days ago when they had to be prepared for posting. Since then, board members have heard from many more of you through conversations and written testimony. As we lift your voices, we will try to discuss these issues with our policy of naho'openo ao and our values of giving hope, acting with kindness, and working toward togetherness in the front of our minds. We can hardly ask this of you if we do not practice it ourselves. I want to say mahalo to all who trusted us with your concerns. I read all of the testimony yesterday and especially want to point out that some that was sent from our community partners have some valuable suggestions. There is value in the thoughtful research suggestions from OHA and the ideas from the Appleseed Project staff who never forget our most challenged students, and in the outstretched hand from SEAC to partner with us on specific ideas for supporting our special education students. There were other very thoughtful comments from school level staff and from other agencies in the community we partner with. And I encourage DOE leaders to consider what they are sharing and the support they are offering. One theme running through a lot of testimony, previous and current, is the frustration with the Department of Health and the expected information from them that has not been evident. The superintendent can speak to this, as there have been developments as recently as yesterday. I also sent a letter to the director asking for the status of the expectations expressed in our resolution, which are also in the memorandum of understanding between HSTA and the DOE. In addition, we heard from a number of charter school staff, and while there are some things we are working together on with respect to COVID-19, I hope they are also communicating their concerns to the Charter School Commission. We heard from school leaders and teachers who are frustrated by the frequency of directions that are changed, requiring things to be done differently with changes made in a very short time. An example is the plea from parents, as reflected in the letter from the Appleseed Project, for students to be able to pick up grab-and-go meals at any school, since it may be difficult or impossible for them to get to the school they attend while they are engaged in virtual learning. The state's food service team worked really hard to figure out a solution, which they did, but the downline consequences meant for some very fast changes at the school level. We needed to do this for the children, but with every decision we make, we also must think of each consequence and of what new actions will be needed and who will be impacted so that they can be included in the discussion. Sometimes as leaders, and I include myself, we're acting in such haste that we forget what's the next thing that's going to happen because I make this decision. So many of the concerns relate to communication issues. I know this can be challenging at any time. With the universe we are in right now moving so fast around us, it is especially challenging, but it is also especially critical. However, sometimes it takes longer to go back and recommunicate when we do it wrong. And I am, again, speaking from experience as a leader. This whole process of including everyone affected in the conversation is hard. But even though they may not be making the decision, it is very important and something we must all work on. No one likes to be the last to know, especially when he or she is the one who has to implement the decision. We also heard from parents, some of whom want us to open schools for face-to-face learning, and some who do not. We read their concerns about the online learning platform that the DOE has adopted for students who want 100% virtual learning. We heard also from university people and who are partners with us in other projects who are also very concerned about that particular learning platform. We heard from custodians and others in the schools who say there's still not enough PPE and cleaning supplies. We heard from teachers and principals who want to open schools and work virtually in their school sites. And we heard from a lot of special education teachers who are worried about the unique interactions they must have with their students, where physical distancing is not possible. But we also heard from quite a few who said they want to be with their special population in their classrooms. And we heard from others who want to telework from home and who are very upset about the policy that limits their ability to do this. We heard from CASs and principals who want time for the plans they develop to be fully implemented. They do not want the Board of Education to make them and their staffs pivot again. As I have said to those who spoke with me directly, this meeting is not one where we are permitted to take action on any issue. It is a time for us to get information from the department on how they are doing with the BOE resolution. So we are going to have that conversation. I know that when folks get upset, words can be used that are difficult to walk back. But I want us to remember that we are not at war with one another. And when this virus is vanquished, I hope we will still be here working together for our students. What we do now and how we treat each other and how we go forward is going to make a big difference in how we are able to work later. Leaders must find a way to bring our valued and valuable resources together for the sake of the students we serve. So with that, I want to emphasize that, again, that this is a time for board members who want to understand the concerns that we have heard and what has been done to address these concerns, what still needs to be done, when any outstanding concerns will be addressed, and what we can do to improve. I would like to request that board members use my memorandum with all those convenient boxes and bullet points as general roadmap for our discussions today. The concerns are complex and numerous, so I'm hoping that that methodically following a roadmap will help us to have these important conversations in a positive, productive, and organized manner. The memorandum is designed to provide a toolkit of information that is relevant to the discussion. Public feedback is crucial to our work, and the level of recent public participation is incomparable to anything the board has experienced in the past. Because of this, I wanted to find a way to have a discussion about the feedback. The feedback is categorized into 5 major areas of concern: health and safety, distance learning, personnel, food service, and student transportation. All of this information is included in Exhibit B. In my memorandum and your meeting materials, I'm focusing on the concerns most expressed in the testimony from principals, families, and the public. However, I want to emphasize that all the testimony we received is important and was considered. I will introduce the overarching guiding questions for each area of concern and provide any necessary context. Superintendent will be invited to respond to the overarching guidance questions. She can call on any of her leadership team to assist with the response. After that response, we have additional guiding questions, and we will follow up with those. My hope is that this will help to frame the subsequent dialogue. Many of these areas overlap, so I ask board members to really focus your questions on the topic at hand. My hope is that we can connect the concrete implementation examples described in the specific concerns shared by the community with the policy positions the board has taken in its resolution. If we do this, we can provide further clarification to the superintendent and the department regarding how the board interprets its resolution. If it appears that concerns are not being addressed, we can also talk about whether the board's policy positions continue to reflect our expectations in the constantly changing landscape. I would like to recommend that we impose a 30-minute time limit on each section, and note that the last 2 sections following the 5 are those broad sections related to guidance documents and overall communication. These issues sort of flow through all of the others, so keep those in mind. Before we start the discussion, just as again a reminder, I'll wait for me to call on you, raise your hand in WebEx, and when you're finished speaking, lower your hand. So if there are no questions about any of the process, we're going to start. We'll probably take a break in the middle of this somewhere because I know it is extensive, but we are going to begin with health and safety. And again, we'll try to not get stuck on this for the whole time. We probably could, but let's try not to. Okay. The first guiding question, and the superintendent can begin, or she can ask someone on her staff. I'll leave it up to you, superintendent, to call on your own staff for response. What has been done to ensure that all staff are ready to open schools safely in all instructional delivery modes? And if you want to include in your response some of the follow-up inquiries about what still needs to be done and when will that happen, that would be fine. So you can incorporate the follow-up into your response. Okay, go ahead.
Thank you, Board Member Payne. This is a huge area because everything we are doing is couched in health and safety. I want to state that there are two major challenges before us. One is the actual health pandemic that creates impossible situations with more questions than we have answers for right now. And the other is that the health pandemic has continued to uncover or re-uncover, because I don't think that we're surprised by this, the inequities that exist in our community that make it challenging, and that the challenges are different for different groups within our community. And so even when we're talking about voice within making decisions about how reopening is happening and how health and safety protocols are being put in place, we have people experiencing the pandemic in many ways, even beyond the health factor. And so we know that that creates a challenge. The other challenge is that as we the DOE, put systems in place as best possible with what we know and what we learn and the new information that comes, the DOE is often asked to take on roles in solving community issues that are well beyond the mission of the DOE. And so I thank everyone, because everyone has been at the table, as someone said, going through this roller coaster ride together. It's been up and down, and it has been stressful, and it has been exhausting, but everyone's been working really hard. Every employee group has given their heart and soul to making the best decisions possible and coming with very open arms, open hands, open hearts, and lots of their personal time to making this happen. So this week we opened up with 4 days focused on providing supports to students to get ready for distance learning. And I thank everyone for that work. Everyone has different stories that they're sharing around how well that worked. And it's these 4 days that are going to help to continue to structure what those supports continue to look like, not only in health and safety, but in the other matters we're going to talk about today, such as connectivity and access and engagement and success for kids. We are creating and maintaining optimal learning environments for all students while we continue to minimize the risk of spreading this infectious disease, including COVID-19 as our main objective in health and safety. And so we have developed this return to learn plan, the health and safety plan, that's posted on our website. It's been vetted at the tri-level, the DOH and the Board of Ed. But we know that as we implement this, and we're in implementation mode now this week, we're going to see where it works and doesn't work. And we have to be willing to keep making adjustments and clarifications. And so there are lots of things that change every week that we're adding as additional resources, data points, or clarifications as we go. Our school facilities were cleaned prior to our staff reporting for this opening, and we know that that step is going to be a repeated step every day because of the pandemic. And Randy Tanaka will be able to, Assistant Superintendent of Office of Facilities and Operations, go into more detail about PPEs and cleaning supplies, professional sanitation services that we've been using, custodial training, and the ongoing work that has to happen there, because this is something that is a continued commitment. We have talked about the school models that were created to facilitate the social and physical distancing, and we have built in time in these models, knowing that this isn't a normal school year, and time has to be spent cleaning and sanitizing, prepping, transitioning, and within the scope of distance learning that we're in for the next few weeks, and potentially through the quarter, and evaluating whether this is through the semester. This we'll have to keep looking at the models for cleaning, sanitization, and continuing the health and safety protocols and training modules that are going to continue to be necessary, especially as our public health agencies continue to provide more information. We did receive feedback from community, especially our internal employees, asking for more training time, and we spent 9 days of additional dedicated time for training and have collected information and feedback from the employee groups about that training, and also what else they're going to need as follow-up. So we will continue to do that. Safety is not only about the health pandemic. As we transition to a web-based, a distance learning process, safety is taking on all kinds of other definitions. We also have paid very close attention to internet safety for students. The DOE network has content filters that are enabled. It blocks certain types of content, and certainly the more typically defined content that's considered, of course, dangerous is content related to drugs, alcohol, weapons, pornography. But there are many layers to preventing unsafe content from coming through and making sure that there are appropriate filters to protect our students and to make sure that all of our DOE, Ohana are working within a safe environment. I'm going to have Deputy Superintendent go into the details of how we have gone through, verified, and now utilized the protocol for what happens when there is a confirmed COVID case. We know that as long as there are positive cases in community, we will have positive cases that impact our employees and our students and our internal community. While at this point, we don't have cases that are stemming from schools because we've been largely not in schools, we know that we exist in community. And so the protocols we have put in place have been tested, are good protocols. We're going to go through it very quickly. I'm going to turn this over to Deputy. But I do want to give the board and the community an update about a step that I know everyone's been anxious about, waiting for, and we have some really good progress around. Yesterday afternoon, the Department of Health invited a team of 20 public school, private school, and charter school teachers, leaders, and staff members to come together to review several models for triggers that would project schools in and out of various types of models, whether it's in-person, blended, or distance learning. And so we had a conversation yesterday and looked at the Oregon, Connecticut, West Virginia, and Minnesota models. These models have not just one metric, but one driving metric that looks at cases per 100,000, either in a 7 or 14-day period. And it creates, by looking at several metrics, a color-coded system of triggers for their state's public schools. And in our case, we would be looking public, private, and of course our charters, triggers for moving in and out of in-person, blended, or distance learning. This work is going to continue on Monday of next week, and we hope that we will get a pretty quick turnaround on this. This will allow us to go from the distance learning we're going into on Monday to having these triggers defined by the Department of Health and in place before we have to make another shift, which I think will be extremely helpful to all of us as we receive that additional guidance. So I wanted to mention that because I think that's key to what Phyllis Unubasami is now going to speak to, are the actions that are taken when we learn about a case in a school or in a department. So Phyllis, would you please walk us through that process quickly, and then we'll go in and get a high-level overview of PPEs.
Yes. Aloha, everyone. Phyllis Unibasami, Deputy Superintendent, and we do have written guidelines for the response procedures for positive COVID-19 cases and even possible exposure. We have used these written guidelines to walk us through. Some things that I think are important to note is that, of course, we are always looking to the Department of Health to guide us through specific cases. But what we have learned over our experiences is that probably the first person who is informed about a possible COVID case is the principal or the leader of the office. And so usually what happens is that they are notifying the response team. Every leader, every principal and every CAS and an assistant superintendent knows who's on the response team and has our cell numbers. They send us a text message letting us know that there's a possible case. And we start to, and in the response team are Cindy Covell for personnel issues. We have Randy Tanaka that helps to take a look at and assess what kinds of facility needs need to be, guidance needs to be given. We also have Lindsay Chambers helping with communications, making sure that the leader has someone to communicate with. We also have Jennifer Ryan, who is our liaison with Department of Health. She comes from Department of Health. And then Heidi Armstrong, who is also in charge of the school health division. With the response team, we all will jump on a line to talk with the administrator if we find that the case is not necessarily going to follow the process exactly. Like there might be questions that the leader has and or some extra care that we need to give to this case. So we jump on the line, we listen to the leader, ask him or her questions to understand the situation, and then we start to plan with the leader about all of the things that we need to do. Generally, at the end of the meeting, we have agreements about what kind of communications are gonna go out. Typically, it is always first to the people who might be in close contact with the individual, just to give them a heads up and asking them to please cooperate and check with their physician to see if they can be tested. We also then talk about the different types of leaves that might be needed in that particular situation. And we then take a look at the types of cleaning that we need to do in the school to ensure that if there is the presence of the virus, that we are taking care of it immediately. Within 24 hours, in fact, at night, by the time we reopen school the next day, it has been cleaned. We work with the principal to ensure that we know which classrooms, which facilities, restrooms and lunchroom areas that the person might have gone into are cleaned completely by the time we open school the next day. We also make sure that there's communication not only with the possible close contact, but also with the school community. If the students and parents might be in fact affected, we also put out a notice to the parents in the school community, beyond the school community, but to the families in the community. When it is a private provider or vendor on campus, we also work with the company to ensure that they themselves are notified, because we want to make sure that if anyone comes back on our campus, either to do repairs or is providing some kind of related services, that we are keeping the school and the organization as safe as possible. And that's it. So thank you, Superintendent.
Okay, I was just going to go and include Randy Tanaka to just do a quick overview of the health and safety components put in place through, in terms of the PPEs in the schools, and some of the adjustments that we have made based on feedback from the school-based level, and some additional changes that are forthcoming that will be helpful. One of the things that, as some of you may have heard me talk about, the the amount of goods that we are moving throughout the state started out as being centralized in Oahu. We've worked with Haima. That was not going to work on a long-term basis. And so now Haima works with us to drop-offs at the complex level. And so that allows us to have goods showing up across the state and not in Oahu, where we're trying to do these big shipments and movements of goods. And that's a huge improvement of that process. With the amount of goods that we have pushed out, even when I say we have almost 3 million disposable masks that went out to schools, almost 79,000 of reusable cloth masks and so forth. As I go through those, it is hard for the community to see where that's landing, how that's distributed. And so one of the points of reflection with the feedback is that we have now laid that out by school and are working on what that outward or public facing component will look like, so that we can show what has gone to every single school for school reopening, and what the continuous orders are, which need to continue to happen in 3-month supplies. So Randy, if you can just spend a quick minute and a half, 2 minutes, just recapping some of the changes that we've made and where we are, and then we'll be guided by the board what other detailed data they may want to have.
Thank you, Superintendent. Aloha, Board. A.S. Tanaka. Regarding the volume of PPEs that we have distributed, over 1 million face masks to all the schools. We've delivered gloves, hand wipes, masks, gowns in different quantities. Our first priority was the face mask to all our employees, both cloth and disposable. The second area of importance was really the health offices and the Sped teachers. So we fulfilled those needs, and there was a high need for face shields. So over 1,200 delivered. I just got a note here that come Wednesday, we will have another 49,000 gowns delivered to the schools and nearly 4,000 boxes of gloves that complement the needs. So also know that this effort started way back in April, when we first had an indication of what we would need. And we distributed goods based upon the inventory we had, so all schools will have PPEs. Not all schools got what they wanted as a full complement, but we have been able to backfill those orders. In terms of cleaning supplies, that has been managed at the school level because they can best manage the use. One of the issues we had was what is called a burn rate. There was no way for us to identify a burn rate. We think we have a pretty good handle on it now. We used 3 metrics to measure that. We went out and polled all the principals on what they thought they needed. We had responses of 150 schools, so we have a pretty good inventory now. Prior to that, we were using a metrics when we were passing out based on school population. And the final metrics is something that we got from the Haima folks about how they were distributing to hospitals and local needs. So that trifecta of things gave us the balance and the metrics. The burn rate, we really won't know. At this point, we have 60 days of supplies at the schools. So we're going to see in the first 60 days what that attrition rate on supplies will be. I can with confidence tell you every school has PPEs, masks and cleaning and hand sanitizers. So in that regard, we're in good shape. Thank you, Superintendent.
And I'll end with just saying that the reporting out of that distribution is something that I will share with the board as we work through also a way to publicly present that data so that the community is able to see that material. the material has been distributed and what material is forthcoming. The other part of this that we've been talking about as we continue to get ideas and improve processes is whether there's a need for a hotline that would be a place where we could record, where our employees calling in and saying, at this site, there doesn't seem to be enough of something that we can check against what's distributed to schools and engage the complex area superintendent, the principal, and the staff member from facilities to look at what that specific situation is, because there are a lot of goods and materials out there, and we want to make sure that it's getting distributed within offices, within schools, within programs within schools very quickly, so that there aren't these continued concerns about where this material is. So, Board Chair, I'm going to stop there so that I can be guided by where the board wants to go with this conversation.
All right, so we now are open to board comment and questions. And I see Board Member Cox has her hand up, so go right ahead.
Thank you, Chair. Board Member Cox here. I have two questions. The first one is, when there has been a positive case at schools and you have to do the deep cleaning, who's paying for it? Is it weighted student formula that has to pay for it, or does the state have a fund that's set aside to pay for it?
Can I have AS
Yes,
Tanaka
you can just
answer
respond.
that?
You can just respond. Whoever is appropriate, superintendent, have them respond.
I'm sorry, I was looking for my unmute button. I'll get better at this. AS Tanaka, can you answer, please?
Yes, right now we have a fund in our auxiliary services that pays for these services. I will tell you that the provider we have meets all the CDC requirements, the OSHA requirements, and the EPA requirements. And he has provided a highly competitive rate that is allowing us to do these kinds of area cleaning. I would tell you, if we were at market rate, it would be extraordinarily expensive to do this. The other issue, not only cost, is speed. From talking to our principals, we need that classroom back online, that auditorium, that cafeteria, whatever we're cleaning, the very next day. And what this vendor does is he comes in the late afternoons. We hit the rooms, whatever we need to do, and the room is ready for occupancy the next day. If we don't get it ready the next day, the unintended consequences of moving things around and moving our cafeteria services around are much more complicated than we need to make it. But back to the cost issue, we have it in our aux service. We've allocated money to it, and that's where it sits right now.
So does that include neighbor islands, or is this only for Oahu?
It includes the neighbor islands. We're not completely settled with those services because the providers are not as robust as we need to. We had an incident on Kauai last week, and we managed that. It went actually quite well.
I'm familiar with that one. Okay, second question. What is being done for the front offices? Because so the secretarial staff, the SOS and so forth, I'm assuming they're going to be given shields and masks, but is there anything that the department is doing to put up those, I don't know, whatever you call those barrier things to protect that front office? Because that's where you're going to have a lot of people in and out.
So, if you don't mind, Superintendent.
Yes, please.
We have provided every admin office with 5, with the delivery we had of face shields to every admin office across the state. When we looked at the desk shields, the plexiglass shields, the effective way to implement this was have the school decide what they wanted. And because every counter was a different size, every location was a different size. If you would have had facilities operations do that, I will tell you that it would take an extraordinary amount of time to complete. So I've visited a number of schools. They've implemented their program. DAGs on the neighbor islands help install it. Some of the providers that had provided that installed it themselves, and some of our maintenance staff installed it here in Honolulu. So across the state, we encouraged the schools to engage with these providers because there was no way we could effectively get it all installed in time.
So I'm hearing that it came out of weighted student formula.
No, those are reimbursable items. Of the ones that have been installed, we have a list of about 150 schools, is what I've been told, that have applied for reimbursement through the FREMA process.
Okay, good. Thank you.
Thank you.
I yield the floor.
Board Member Fallon?
Thank you, Chair Payne. This is a follow-up to the overview provided by Deputy Superintendent Unabasami. So can you please confirm that the overview you provided and the description of the process and procedures is in writing? And if it is, who has received the information and has it been distributed in a manner that folks have the information? Thank you.
Aloha, Board Member Fallon. This is Phyllis Unabasami. So to be clear, the procedures are with the leaders, the superintendents, and the principals, the leaders of the organization, so that they have immediate, they have a checklist of things that we have to, and steps that we're going to be taking. So I can confirm that. We also have given out our contact numbers 24/7, so that any leader can get in touch with us individually or as a response COVID team, the COVID response team, sorry, at any time. We have held meetings with our leaders at their convenience, whether it's on the weekends or on the evening, in the evenings. Thank you.
I'll just add that we also have those two process flow charts, whether it stems from DOH or stems from the school site level. It's part of our school reopening plan that was revised after the first iteration. When we were asked at the last board meeting if those processes could be put into a more user-friendly visual. So those are posted and will run through the DOH.
And so this is a follow-up question. At this point, what do you feel still needs to be completed and done so to minimize confusion and anxiety around the health and safety and reporting issue?
So I would say that one big next step that everyone's been waiting for are these triggers that I spoke about, that the DOH convened several of us to discuss yesterday, and we'll have one more meeting with us on Monday, and then we'll be finalizing their work. These triggers will answer even some of the comments we heard today from our community about not being sure why, when we're going to change from one approach to another, especially if it's due to cases in community, or are there conditions when there might be cases within a school or within education, not just public schools, but private schools, just collectively amongst our young people. So the triggers piece is important for us to be able to say before we make any other change, even from distance learning that we're going into, back to a blended learning approach, that we have those metrics well defined by the Department of Health, by their medical experts, that we can say that's what we're following when we're making decisions to open more access on campus or to provide more space on campus by having more distance learning, that we have clarity from Department of Health.
So thank you. So will part of the trigger process be identification and clarity about when a school opens, when a school closes, and who makes that decision?
Yes, it will. It will actually set benchmarks or triggers for when we switch instructional approach. So we want to be very careful. We're not looking to shut down schools, right? Because that communicates the wrong thing. But we would we would be in a situation potentially if cases keep going up of being full distance learning, or as numbers go down, how much time has to pass before Department of Health is recommending to us that it is safe to go back to some kind of blended learning. And it's about just being very clear about those health metrics that are guiding our actions, and that we have to stay within that guidance.
And do you see what the strategy is, or is a strategy in terms of communicating this information to the public, both at that school community level and at higher levels? Is there a plan to have a communication plan, and who will be the lead?
So Board Member Fallon, I'm not sure if you're still referring just to the metrics. I'll start there. The governor has charged the Department of Health with developing those metrics and presenting those, I believe, both to HIEMA and to himself. And those are meant to be part of a larger set of metrics for the governor and mayors to follow around these switches where, for example, they shut down access to some community resources like hiking trails and beaches, or to businesses and so forth, or to travel, right? That they're looking for very clear metrics that kind of trigger those responses as well. So the DOE, or I'm sorry, not DOE, the education related metrics are meant to be part of this bigger plan that the governor will communicate. That education specific metrics is what we have been asking for, advancing faster than some of these other metrics. We need them now, right? We've opened up, so we need them now. And that's what DOH is working with us on. So it looks like the rollout of these metrics are going to be these education related metrics first, and then these other broader metrics that the governor will announce. So this is really the Kuleana really lies between DOH, HIEMA, and the governor for the communications. And of course, we will take that communications and create parent-friendly communication. Was that your question?
Yes, thank you.
Okay.
In our plan, there were different stages, and one of them had to do with by September 11th, decisions would be made about next steps around students going on campus, continuing distance learning. And September 8th is the decision-making point that has been identified whereby a decision needs to be made. I believe that was the date. Are we going to meet that timeline?
Yes, so thank you for asking that question, because that's a really important one. The way that timeline was defined and agreed to was that came part of that recommendation from the CASs working with their principals, asking, they met with me, they asked, can we look at several days of support for kids and going to full distance learning, and looking at whether the distance learning needs to be, 4 weeks, for a quarter, for potentially, at the more extreme end, for a semester, and we agreed to that. I thought that was a very sound recommendation. They wanted time for this week to happen, where they're meeting with kids and parents and meeting back with their staff, seeing how this week goes, seeing how next week goes with the distance learning that's going to be much broader than we've ever done in the state, right? Watch that and then come back with recommendations. So what we've said to the community is that by no later than September 8th, we would be announcing how long this distance learning is going to go, giving each county time to look at what's happening with cases, and also making sure that that we are not missing out on supports that families say they need in this distance learning environment. So it was really the time that the principals and CASA said they needed to be able to look at these first few weeks and to watch the case count and to make sure they're making a decision that really balances between the kids that can be in distance learning and the kids that may potentially struggle with it, and being able to support both.
Is the Department of Health aware of the pressing timelines you have?
Yes, I talk to them constantly. We not only have a liaison from our health office under AS Armstrong that works directly with a liaison from the Department of Health, but we also, I meet with Dr. Park and Dr. Anderson on a continuous basis to talk about what we need, what I'm suggesting. There's a number of things that I've asked for and suggested, and we're still working through those. These metrics are one of them. There are a couple of other things that I think really would answer another layer of things that we're hearing from community that would help them feel much more certain about how to exist in this pandemic world. And part of that is that they've heard from us, and they've heard from educators from the private schools and the charter schools as well, is there needs to be much more education around what the data says about these cases and the spread and how it spread and so forth. That it's the education of community that still needs another layer, because it would help tremendously, because there's a lot of kind of guessing at what is safe and what is not safe, and there needs to be more clarity from Department of Health. So those are the asks that they have, and they've been pulling together and meeting with us around this.
Thank you. I yield.
Thank you. We have Board Member Uemura, Vice Chair Uemura.
Thank you, Chair. I just wanted to, first of all, get some clarification from the superintendent. Also, I have some questions for the two presentations from Deputy Superintendent Phyllis and also AS Randy. But Superintendent, first of all, this is just a simple question to you. We had a guiding question that was submitted by our chair. So I just want to make sure, so I don't make a false assumption, that your presentation on answering the question, what has been done to ensure all staff are ready to open schools safely in all instruction delivery modes, has been answered. Is that a yes?
My first line that I stated, and I'll reiterate it because I think it's significant here, is that there are many, many layers to this and lots of information. And so so what we gave is just a broad stroke of some of the components that we keep hearing about, but there may be other questions the board has where we can provide greater detail.
Yeah, thank you, Superintendent. I think that's the clarity I needed, because, you know, I do have other questions that wasn't addressed, but it's, you know, relevant to our discussion. But before I go into that, let me address questions to Deputy Superintendent Masami's presentation. And I just wanted to make sure, because you talked about the COVID response and how that you are using the Department of Health guidelines, or they will guide you through how you respond, and that you have a response team in place that are made up of 5 people. So my question to you, and I think that's great, because I think now you have a team that can respond to any COVID cases, but how many cases can the response team handle at one time? Because we know that there's going to be cases at the schools when, students get back to school. And what is the timing of responding, knowing that the Department of Health has not been exactly upfront with us, the public, on their contact tracing abilities? And also, we're only talking about positive cases, right? So we're only talking about positive cases because that's what you're releasing to the public. How long would that take for the response team to react if you're not getting the response times for positive cases in 3 or 4 days? So, so that was a couple questions you can think about. And this, let me go to one more, and this is a military contact tracing. We talked about that at our last board meeting, and I was wondering, how is the response team addressing that portion of COVID cases? So I'll wait for your response, Deputy, and then when you're done, then I'll go to and ask Randy his questions.
Aloha.
So let me just start by giving a quick overview of what we have right now in responsiveness, and then I'm going to have Deputy Masami give more detail. In terms of positive cases and suspected cases, the difference is really driven by whether the employee or the parent has given us documentation. So if they've given us documentation that says it's a positive case, then it's already noted as a positive case. If they have just told us verbally and we're waiting for the documentation, is a suspected case, but the process is the same. We notify DOH, and our internal COVID-19 headed by Deputy Masami goes to action on what we need to do while we're waiting for contact tracer to contact the principal or the supervisor to start the DOH end of this work. What we have seen, and because I shared with the board the 15 positive cases we have had up through Friday of last week, and then the cases that we've had this week, we have had anywhere from 1 to 4 days of timeline or delay in responsiveness. So some cases we've had, response from DOH as quickly as within 24 hours. And in some cases it's taken 2, 3, and 4 days. What we're asking the DOH is to work with us on improving that system so that we have responsiveness within 24 hours. On Deputy Unabasami's end, the responsiveness is immediate. As soon as that text comes in, they're on the phone. So they're providing support so that we're not waiting for the contact tracer, but we can take some action meanwhile. So Deputy, can you fill in anything I've left out, please?
Yeah, thank you. Mr. Uemura, there's for the response team, we treat any concern that the school has, whether there's a suspected case or a positive case, we treat it pretty much the same in the beginning. We know that there's going to be a gap. We've talked with DOH, and we know that it really depends on where the individual is getting the test and where that confirmation is coming from. The delay sometimes is because the transmission from the provider to DOH. So sometimes we are the first ones letting DOH know that there is a positive case on our campuses. We have shared with them our logs so that they can see that, so they're getting names from all over the community, and we want them to know that this particular name is coming from within the Department of Education. It's school related. So hopefully that matters in that work. We are, as soon as the superintendent, the CAS is informing us, or the assistant superintendent is informing us that there is a possible concern, we are already asking information through group text, and then we're calling a meeting. We will do it as soon as 10 minutes, a little bit longer if there's some kind of delay for whatever reason. But we will jump on the line. When you ask about multiple cases at the same time, we've already had that where, because we're looking at suspected cases and also COVID positive confirmation cases at the same time. We have worked enough with each other I do want to make it clear that this response team is very committed to being responsive to the schools. We know that there's a high level of worry and fear, and we are doing what we can to respond to as quickly as we can so that people have information and they know that they're not alone in having to deal with a situation on the campus. So we have been on the phone sometimes at 10:45 at night, responding to a principal and or a CAS. We've also let them know that we are available to them, even if their case is closed. If they find out they have another question, they have another concern or need to follow up with us, that they can reach out to us and we will talk with them and help them navigate through this. So while I can say that we have had multiple conferences at the same time, and that there have been times when we have divided up the response team, but we have listened to each other enough times that we know what questions each of us are going to ask. Each of us are going to ask in order to get information, and also in some ways that we're going to respond. When the situation is unique, we will defer. If the person is not on the line yet, we will defer and push that part of the conversation to the end of the conversation when that person jumps on the line, and then they will answer when that situation is unique. Thank you.
Vice Chair Uemura, you can unmute yourself and ask your follow-up questions to AS Tanaka.
Thank you. I didn't know it. If I don't talk for a while, it actually mutes me, so I apologize for that. So Deputy, thank you. My reason for asking the question is really to understand your resources. So I know you said you handled multiple. So multiple could be 2, but can you handle 20? Can you handle 30? You know, the reason for the question is really to make sure that you have the ability and the resources to handle multiple cases. And so that's the reason for that question. And have you any response to the military contact tracing? Have you guys addressed that at all?
We have had, I guess I want to explain that when we are dealing with the inquiries and possible cases, I have not asked whether they're stemming from the military or not. We know that there are military impacted schools, but that is not top of mind for us, whether or not this is a military dependent or a military spouse. We are handling that as if it doesn't, I just want to say it doesn't matter to us whether or not this is the status of the individual in relationship to the military. Our superintendents for military impacted schools have a very strong and close relationship with the military bases, and they are our conduit to ensure that anything that is happening on the military bases is being shared back with us. But in individual cases, we are not necessarily paying attention to the status of whether they are connected to the military or not.
Yeah, Deputy, the reason I brought that question up because I've been following that pretty closely with some of our legislators as well. And I think I would recommend that you pay close attention to that. And we have a military liaison on our board that I think you can discuss with her. But I think we have to recognize that because we don't know a lot of what the military is doing on their contact, and they may be doing, 100% perfect, but we don't know that yet. But I think that we need to follow up just to get an idea of how they're doing the contact tracing and how it affects us. And I don't think we can just treat them as any other student or parent in a public school environment. So that's my recommendation to you. And I appreciate your comments. And if you don't mind, I'd like to ask my questions to AS Randy Tanaka on the PP&Es.
Before you do that, Vice Chair Uemura, I see that military rep Captain Yatko has her hand up, so she may have something to say relevant to what you have just been talking about. So may I just ask her to speak to that, and then you can have the floor back to talk.
Yes, that'll be fine. Thank you, Chair.
Okay, Captain Yatko, go ahead. You need to unmute yourself, Captain Yatko.
Yeah. Let me check if you can hear me.
Having a little trouble hearing you. You're not coming through.
All right, let me.
Okay, there you came through for a minute there. So just a second when you just were moving something, I guess.
Can you hear me now?
Yes, a little in the distance, but clear enough, I think.
Apologize for that. Okay, I'll just speak loudly so that I can hear. So this came up at the last Board of Education. Thank you so much for mentioning military contact tracing and trying to appreciate and understand that process. I sent a follow-on email, so I first want to make sure that that was received. And I'll pause there to see.
It was received, Captain Yatko, and it was disseminated by our executive director to all board members.
Okay, so given that, and I had some information on contact tracing, and the detail I provided just sort of as a reminder was that each service component in Hawaii, and I tried to keep it to locally what we're doing here as a community, has a response contact team. And there are a sequence of events that take place to make sure that we are identifying contacts of a positive case. And those appropriate notifications are taking place. Some of this I was learning on my own, and thanking you for that question, because it was educational and reinforcing to me. I had also identified that that the military does in fact share on a daily basis any positive COVID cases we may have, specifically at Tripler Army Medical Center and our service clinics. Any military person or family member that tests positive is reported to the State Department of Health. And also, if any military or family member tests out in the community, of course, they are part of that reporting process through the state's reporting. I'm going to pause there because I might be missing what the question and concern is in terms of contact tracing for the military. I'd like to highlight that in addition to working and partnering with the state contacting process, contact tracing process, we do have a very specific one ourselves. Over.
I think we just lost you there, Captain Yatko, and there was a lot of breaking up, but if you can hear me, I'm going to try to capture a little bit of what you said. And she did have a very comprehensive memo that did go out to all of us, assuring us with details about the process that the military uses in communicating with the state, and that the state numbers include the military. And I think the contact tracing, I couldn't really hear what she was saying there, but I know the military is helping us with contact tracing, so that may be part of the process. But I think if we have any concerns about the military not communicating with the State Department of Health and having their numbers included with our numbers and partnering with tracing, I think that those fears should be laid to rest, because it does sound like from what she said now and what I read in her memo that is a process that is occurring. So Captain Yatko, you want to try again to confirm that what I said was accurate?
Yes, thank you. And yes, I did hear you. And thank you for
that. I would just like to add, as it applies to the Department of Education and to our schools, if there is a concern about contact tracing that might apply to a student, I would suggest the process is the same as any other student who might come into contact with a COVID positive person. We in the Department of Defense here on the island have that process. Again, working with, so each service has their own contact tracing team, and partnering with the state. So I'm very satisfied based on the information that I'm hearing and learning that this process is in place, tightly coordinated, and pretty detailed. I continue to learn and appreciate what the state's contact tracing process is, because I would again submit that that is equally related and affects our schools as much as the Department of Defense as well. And I'll stop there in case there are any questions or comments. Thank you.
Thank you, Captain Yatko. I think you confirmed what Deputy Superintendent Unibasami was sharing, that contact tracing of our students is the same no matter where the child is attending school. So thank you for that. Vice Chair Uemura, would you like to proceed?
Yeah, thank you. And thank you, Captain Yatko, for that. And my understanding is slightly different from yours, is that my understanding is that the number of cases in the military is reported to the Department of Health, but that it goes no further than that. In other words, they don't share their contact tracing with the Department of Health. And that's sort of like the agreement that they had, as Bruce Anderson said, it was like an agreement they had to take the numbers in and that's it. And so we have heard testimony, no, I shouldn't say testimony, stories, I guess, with people on base that had COVID cases and they weren't even notified. There's no contact tracing done at that particular site. So I am concerned, but if that's your understanding, that's not my understanding. But I don't want to, I'm just making the recommendation that I don't think Phyllis and your group should just put that aside and said it's fine. I think you should do more work on it as I am doing and figure out exactly what's happening over there, because that's a big population for us. But so Chair, if you don't mind, I'm going to move on to Randy Tanaka and ask him some questions.
Go right ahead.
So, Randy, there's a couple questions on your report, and thank you for your burn rate, something that I understand. So I was happy to hear that you're looking at that and that you have 60 days of supplies. Let me ask you a question. Is the 60 days supplies, do you break it down by type? As an example, we had testimony that some of our most vulnerable teachers that teach most vulnerable students really need the N95 mask. So do we have that in the 60-day supplies? And has that been distributed to the schools?
Yes, Vice Chair Uemura. It's not N95s, it's a mask called KN95. And the reason is the N95s require a fit test. And that's much more complicated to execute. But the KN95s fulfill the same function without the requirement of the fit test. And our last load, we had, I think, 80 some odd thousand KN95s that have been distributed across the system based upon population base of the schools and the needs per school. So not everybody got the same supply, but it's balanced that way.
Randy, because I think one of the testimonies we had was based on the supplies, they wish that you align it to the school needs. So I think what you're telling us today is based on your knowledge that all of the schools have 60 days of supplies based on their need. Correct?
Yes, that is correct. And so let me
Okay.
give you a sample of sensitizing that imbalance. One of the schools we're most careful to watch is those that are adjacent to public housing. So we've had a couple discussions with those principals, and they've asked for a little bit more because the occupants of the public housings don't have the kind of financial wherewithal to get masks and hand sanitizers. So we rebalance that against what the principals ask us for. So we're constantly rebalancing inventory.
Okay, so I'm assuming, Randy, that since the testimony has been given, that you have done all of that, because one of the areas of concern was exactly what we're talking about right now. So you can assure us that the rebalancing have been done. So other principals, the teachers that need the required EP&Es have it right now.
That is correct. Based on some of the testimony we heard today, I'll go back to a school. I think there was a young lady that was from Nanai Kapono out in Nanakuli. So we'll reach out to them and try to see what's happening there. And we do that with every situation that we looked at. You should also know, Ken, that we doubled up inventory in hard to reach locations, Lanai, Molokai, Hana. So they would have a greater inventory, a longer supply, because it's just a little more difficult to get stuff out to them.
Yeah, and I think the superintendent had mentioned that at the last meeting, that on the rural side, they're looking to give them a little bit extra because it takes longer to get it to them, exactly as what you said. So I think that's good management of that. So it's comforting to know that the PP&Es are there. So that question for you is that we now have enough PP&Es. HEMA has, I think, taken over, according to the superintendent, the distribution directly to the schools. Is that correct?
That is correct.
Okay. Okay, so one last question for you, Randy, before I let you go. The bus drivers, one of the things I read was the bus drivers will be having enough masks to give to students that don't have masks. Is that correct?
That is correct. We have supplied all our bus providers about 100,000 masks. We run about 380 buses a day, 630 trips in the morning and the evenings. Our expectation, if a child comes to the bus without a mask, we have a supply to provide to that child. No child gets left on the curbside. That's our management philosophy. So we're geared up in that area.
Okay, so how are you monitoring that? Because I just got a report not 20 minutes ago that students coming out of on a bus from Campbell had no mask on. So is there any way you guys can monitor? I know it's hard to have a bus driver monitor that because they're our vendors. But are we doing anything else to make sure that the kids have masks on in the bus while they're traveling in the bus?
And thank you for that report. So what I'll do is I'll call our primary provider here on Oahu is Roberts. We'll reach out to them through our transportation. We have district managers and remind them of the mask policy and get to them.
Yeah, I know it's difficult times, Randy. So it's just, it's kind of one of those things. We just have to make sure we have the procedures in place to cover that. And so I have other questions on transportation. I'm going to wait for that because I know we're going to cover that later on in our review. So I'm going to let you go for now. And we'll see you on the other side, as they say.
Thank you very much. Thank you.
Thanks, Randy. I appreciate it.
Okay, remember Nama'u?
Superintendent, Superintendent, sorry, Chair.
Yes, I'm sorry. I haven't used the floor yet. If you would like to continue, go ahead.
Yeah, I just have a couple more questions. Just a general overall questions. And this is to the superintendent. And the question I have, because there's a lot of testimony that came out on the DOH guidance, and as we know, with recently, and you just mentioned that you're in constant contact with Bruce and Sarah and some of the other people at the DOH. So I'm just wondering, part of the BO resolution and the MOU with the HSTA was, which includes the reopening plan, was to have a guidance from the DOH. So what are the conditions that you use to support your decision to reopen the schools without the DOH guidance? Because we don't even have it today, but you mentioned that they're working on it. So, and the schools theoretically have opened on August 17th. So if you can just address that quickly for me, I appreciate that, because it has been a concern with a lot of people that have been testifying.
So without completely speaking for the DOH, but certainly talking from the DOE perspective, the DOH has issued a number of documents, and they have a website that connects what they're issuing with CDC guidance. That's what they're considering their guidance. We don't tell them how to create their work. That was their response. They also have reviewed all of our health and safety documents. They also reviewed our DOE school reopening plan and signed off on all of those as not having concerns and not finding any contradiction between our reopening plan and their guidance. And then Dr. Anderson issued a letter stating so that we also posted on our website. They will continue to issue additional guidance and user-friendly visuals is what they're focusing on. So even this week, they issued some additional kind of user-friendly summative visuals that they're using as a way to further explain their guidance and making sure that it's clear. The work around the triggers was the piece that was still outstanding. So for us, we certainly are waiting for that. They're working certainly within the timeline that the governor has set, and so that's work that sits outside of us, but it's important to us. We have continued to work with DOH, governor, and the county mayors around each level of our decision making, and so they've all every point of decision making leading up to school reopening, we've gotten complete sign off from DOH, governor, and the 4 county mayors, and we find that has been very important to make sure we're all on the same page, and that my questions, governor's questions, and the county mayor's questions about readiness and health and safety are, from the DOH perspective, are answered in terms of comfort with each level of decision making. There are articulations of, we need more. And I think that's something that we keep talking about. What are some of those next level guidance that would help clarify, each of the DOH's positions around signing off on DOE being open and also other entities being open.
Superintendent, thank you. And I think that's what that's my question, is really the written guidance as far as, when does the DOE open and what happens with the COVID and things of that sort. So I think what you're telling us basically is there is no written guidance other than what's on the website, right? So, and I think that's...
Yeah, and I don't think DOH would say that. And that's why I was trying to distinguish between what DOH would say. They would say, yes, they have written guidance because their position has been that they have adopted CDC guidance. And so what they have posted is their guidance. And what they've signed off on is our reopening plan, and that's part of their guidance. So I just want to make sure I articulate correctly what they have articulated. to us.
Yeah, because I read that memo from Bruce Anderson, and I didn't think that really fulfilled what we required. So I'm very disappointed from that perspective. But let me just go to one other thing is that, you had mentioned that we had or was in the process of hiring 15 registered nurses for our schools before reopening, but I still see the ads in the paper. Where are we on that? Have we not hired the 15 nurses?
No, let me make sure I'm clear on that. We got approval to hire 15 additional nurses by getting the funds transferred to us from Budget and Finance Office. And so we were able to advertise for them. It takes time to hire them. A.S. Armstrong had provided information about the timeline. It's sometime in September, we should have all of our 15 nurses. We have nurses in place right now. So this is really doubling up our nursing staff, knowing that COVID will continue to be a reality for us this year, and knowing that there may be, and will continue to be, shifting guidance from the feds and the state, and also shifting opportunities. So being able to turn to a professional staff of nurses is a real value add for us to have in place.
15 nurses were hired so far.
I'm sorry, you got cut off.
Do we have any update on the number of nurses that of the 15 have been hired?
A.S. Armstrong, we're probably just receiving applications, so we probably haven't hired any yet, right?
Hi, this is Heidi Armstrong. Yes, so the application period is over, and Hawaii Keiki has received hundreds of applicants for each complex area. We're still, except for Molokai, we're still looking for applicants for that area. Hawaii Keiki has conducted the initial interviews. They are now in the process of setting up the potential applicants to interview with the complex area, the superintendent and the principal of the host school, where the Hawaii Keiki nurse will be based. And then after that selection is made, the Hawaii Keiki nurse spends 3 weeks shadowing the other Hawaii Keiki nurses as their induction period. And so the goal for both the department and Hawaii Keiki is to have the nurses in their host school by the end of September.
Okay, thank you, Heidi and Superintendent. I'm going to yield the floor, Chair.
Thank you. I believe Board Member Nama'u had her hand up earlier.
Aloha. I had my hand up earlier, but I believe that A.S. Tanaka kind of answered most of those questions that I had. But perhaps I should just reiterate it, because there was so much angst out there in the testimony from so many in regards to the PPE. I just want to be really clear about, if you can reiterate again, please, to all, that you do have all this PPE available. I'm kind of curious to know who is determining how much PPE is needed. Is that coming from the central office? Are you leaving that up to the principals themselves? And I really want to be sure that we have the appropriate and proper amounts of PPE, especially for those teachers that are working with our special needs children. Could you help answer that a little bit for me? And if at all, if there's a standard or at least a minimum amount that you are requesting that schools will have on hand.
Yeah, so A.S. Tanaka, can you answer that? You guys have done a great job of working with Haima to kind of standard set. It is also driven by number of employees, employee types, and number of students, and also our hardest to reach areas have some additional PPEs, as A.S. Tanaka indicated. But can you talk about that process?
Superintendent, exactly what you said is how we've metered it out. We've taken 3 steps to get the matrix together. One is a recent poll to the principals statewide, of which we had 150 responses to tell us what they need or what they would like to have. The second step was up to the point where we have delivered the first 2 rounds. We looked at the high needs area. Health offices, Sped teachers, and the student population and staff population at our schools. And that was the other cornerstone, so to speak. And then we went back and had a discussion with our HAIMA partners what standard they use, and they use a standard against hospitals and high need situations. So that's how we've come. We've aggregated those 3 numbers. We're massaging it a little bit more, and that's how we determine what the schools would get. Now, once again, some of the schools in hard to reach areas or high probability areas, we went through a little rebalancing also to give them more. So Molokai, Lanai, Hana had a higher percentage one because we couldn't get to them sooner to refresh at that rate. So that's how we've balanced the counts.
Mahalo. And can you just clarify too that in terms of Hana, Molokai, Lanai, that you are delivering those PPE or anything, any supplies that are needed to them directly to the schools themselves? Because in the past, those have been delivered to Maui, the island of Maui, but then it took, additional efforts to get it out to those specific schools on Lanai and Molokai. So I just want to make sure that they're getting direct deliveries at this point.
Yes, we dropped shipping to the schools. Now there was a period, maybe this part of the first and second round where they were going to a district office, but now the next steps, it'll go all to the schools.
Okay, thank you very much, Randy. I really appreciate it. I yield the floor.
Board Member Voss.
Thank you, Chair. Superintendent, this sort of follows on Keely's question, and it relates to special needs students that will be on campus potentially starting next week. And we have an obligation by law to provide services in a meaningful manner to those people, and some of those can only be done in person. But at the same time, there are legitimate concerns about potential crowding, particularly for those special needs students that require multiple assistants. So my question is, what direction or guidance is the department providing to schools on whether use of multiple classrooms or other spacing techniques to ensure that there is sufficient and safe spacing?
Thank you for your question. Very important question, and principals are doing a great job. I think if there are concerns that anyone needs support with that planning, certainly A.S. Armstrong's team is on hand. They've been doing constant training and touching bases with the team that supports our special ed teachers. So that's extremely important. I'm gonna have A.S. Armstrong talk about some of the things that have been put in place. We have about 18,000, or just under 18,000 students receiving special ed services, and many of them can receive instruction or telesupports via distance supports and distance learning. And so those students can access through that technology. We have approximately 3,000 students. Heidi, make sure you correct me if I'm wrong. I believe it's 3,000 students that cannot receive their supports at all through those telesupports or telelearning. And so we know that that's our number of students that we absolutely need to have on campuses. And then above those are those that through the IEP determination is made that telelearning or telesupports are not appropriate. So A.S. Armstrong, can you add additional information about those incredible supports you've been putting in place, and then how you're keeping track as teachers at particular schools may notify us of where something may not be sufficient or a principal may need additional support?
Oh, hi. Thank you, Superintendent. And yes, we just had a question and answer session for complex area superintendents, district educational specialists, and a principal from each school level, elementary, middle, and high for each complex area, to ask the specific questions they're having as we are bringing our high needs students back on campus. There are options for families who are not comfortable having their child whose services cannot be delivered via distance learning, but the family may not be comfortable having that child on campus. So we do work with the family and create an alternative learning plan where the school team, the family, and all of those who work with the student discuss what services can be provided through distance learning, and then what services won't be able to be provided that are stipulated in the IEP. We know that we have many direct service providers who do work with students who have toileting needs, they have feeding needs, and we have special training for the additional protective equipment that they will need, and also training on how to properly conduct these very needed services for these students in a proper and safe way. We know that these students need us at this time, and we are here to support them in the safest manner that we can. Thank you.
Thank you, Heidi. Just, I want to follow up though on that. And my specific question went to spacing and crowding, because that is a concern that we've heard from special ed teachers. Will you be encouraging schools to use multiple classrooms, rearrange classrooms, whatever needs to be to make sure that there is not a large number of students as well as their assistants in the room at the same time?
Absolutely. With the amount of distance learning that is going on now, there are multiple classrooms that are not being occupied in this school. And if schools do need additional assistance in how to configure the learning spaces so that proper physical distancing can be maintained, our office is always able and willing to meet individually with whatever school needs assistance to help devise a learning space design that will meet all of the needs.
Board Member Voss, do you yield the floor?
I apologize, Chair. Yes, I yield the floor.
Thank you. I don't see any additional hands up, but let me double check. I don't expect too much of a response to this, but I want to put it out there because we did hear from a number of people in the different testimonies. And this, I guess, would go mostly to Randy Tanaka also, sorry. But the issue of air quality and air conditioning and the kinds of information that that is coming more recently about air circulation and the hazard of some of that. So those are things that I think we're going to have to answer, particularly as we get ready to bring students back to school, because we have so many rooms that are air conditioned now or that don't have windows even that can be open.
Ms. Tanaka, are you able to answer about the memo and guidance that's been provided thus far and
Yeah.
continuing to monitor this? Thank you.
Yes, we are monitoring the airflow in the rooms. Chair, you're correct. We have 14 schools that have centralized airs that really have no access. We're trying to balance between opening doors and taking out some of the plexiglass that covers some of the windows to promote the airflow. So that's all under consideration. We're taking a look at different kinds of filters that can be more effective to managing that airflow through the AC units. We will have a different kind of problem if we're running AC and opening doors from an energy management standpoint. We have just received on the Big Island through some funding. We've purchased air handlers that will go in the rooms that will promote the airflow. I believe it's 6 times per hour airflow in the room. So that's a beta test that's happening within the next 15 days. And we'll see if those devices satisfy the airflow requirements. So that's kind of where we are. We have about 1,000 rooms that have been AC'd, whether it be split systems or window AC. So we're monitoring all of those.
Oh, thank you, AS Tanaka. I think we learn all the time, every day, what more we have to do. But that one is a tough one and a bit ironic because we worked so hard to get the air conditioning. But thank you. And I see Board Vice Chair Imura, your hand is up. Go ahead.
Yeah, thank you, Chair. This question again is for Randy. Real quick, on the facilities, on the training, cleaning, and personnel, I know you talked about supplies. I think you said we have sufficient supplies. It's really and training. I think there is training available to all the people that have to clean the rooms. But what about personnel? Do you have enough personnel to clean more frequently?
Thank you, Vice Chair Uemura. We started our training on May 20th and 21st. And fundamentally, our facility maintenance branch trains the head custodians. And then the head custodians work with the custodians. When we did our training on May 20 and 21st, we incorporated some COVID-sensitive training. We had 997 participants in 2 days. We continued to reach out to get 100% of our staff on a custodial level and a head custodian level trained. You should know that we have touched every school in the state with some degree of training. It may be the head custodian, it may be a custodian, a vice principal, or a principal. So we continue that effort. The question of do we have enough staff to clean with the frequencies that we have been guided by CDC, the answer is no. Because one of the guidance is that every time a classroom breaks and goes in different directions is to wipe down that classroom. Now, we hope we're addressing it in 2 ways. One is the enforcement of masks, washing your hands, and social distance. And then the custodial staff cleans it at least once a day, whether it be in the afternoon or the morning. So we get at least 1 cleaning in those rooms. That's how we're addressing it. And we're working towards frequency, but that frequency may have to do with how we clean, whether it be misters or sprays. But between the classes, it's not going to have enough time to dry. So we're working through that process now.
So when do you think you're going to have a plan? Because I think one of the concerns that was shared with us was the frequency of cleaning.
Yep. Yeah, that one's I'm having discussions with the head custodians and facility maintenance branch. How do we get at least 2 cleanings a day? I got to get back to you yet. It's a simple math problem. We can't get in there fast enough, and if we got 30 rooms turning, we're not going to have enough.
Yeah. Okay, Randy, not the answer that I wanted, but it is what it is, right? But I think we need to work toward, at least getting the high touch areas and, common areas cleaned, because from personal experience from even where I live, you got to pay overtime, you got to get more people to do the cleaning, and just as it affects the life right now.
Yeah, it's a tough one.
Okay, thank you, Randy.
Thank you.
Are you the floor, Chair?
All right, I don't see any other hands up. I will double check, but if not, we're going to be moving to our next item, which is distance learning. I think the first 2 are the hottest topics that we have, so I appreciate all of the responses. I think just getting that out, Superintendent and your team, is really important. And so we did take certainly more time than I was thinking we would allot. But we're going to move on now to distance learning. And the guiding question in this area is what's been done to ensure that everyone, students, families, teachers, and administrators, are ready to engage in effective distance learning. And then the same kinds of follow-up questions if you want to embed those in your response about what still needs to be done and when and how we will know it's been done and what other concerns you have. You can embed those responses in your response or in the responses of your team. And I think we want to have some particular attention paid to how the online program that has been adopted, what sort of vetting was done and what were the criteria that were used. And I know there's concern about that, so if we could hear that in the response too. So thank you. Go right ahead, Superintendent.
Thank you, Board Chair. I'm going to again give some summary comments because this touches upon two things. One, the device and connectivity that's needed for distance learning, and then the actual the training for teachers and the curriculum related questions that were asked. And I'm going to be calling upon AS Connor and AS Bender to provide some additional comments following my comments. We had done early on, and I had provided the data from our statewide survey, which was actually a data collection process from principals. And so we were able to verify that we have statewide 139,000 devices for students, and that's separate from the teacher devices. And so with the students who need devices and those who indicated about 75% of them indicated that that they have access to a device at home. We knew that with the purchase of some additional devices, we would provide or create a condition where schools could absolutely distribute or put in place a loaner program for devices at home, whether that's for blended learning or distance learning. And so we have purchased 34,500 devices between June and August using CARES dollars. 21,000 of those devices have been received, and then 13,000 devices we are still waiting for. Without those devices, we still have devices at school to give out. This really provides some up-to-date modern devices for our neediest students. And between the survey that was done early in the summer and the follow-up now with school reopening, principals and teacher teams are connecting with families and double checking whether in fact the device that they said they had at home is the appropriate device. And so that teacher conversation, teacher-driven conversation is really what's helping to make sure that there aren't additional gaps that really weren't captured by that early survey. And it's that one-to-one checking in that really helps with that. As we wait for these additional devices, as I mentioned, we have enough devices at school for now, but we also have the issue of connectivity. And so we continue to connect and have conversations with families around that connectivity, what that connectivity looks like, and actually trying it out this week. That's why this week was so critical. And teachers, principals, and school-based teams were able to work together with their tech teams at the school-based level and complex level to identify additional supports that were needed that were not captured previously, or where the connectivity at home is not sufficient for distance learning. And it's not until we could have that one-on-one with families that we really could capture the accuracy of this data and making sure that we don't have any students who are not captured by this support. We have over 5,000 hotspots that were purchased in the summer and have been distributed to support the school year, that is not sufficient. That was an early order with the monies we received. We have received additional monies from the through the governor's support this week through budget and finance, and I have just issued a report to the board about those new monies that are not only paying for the nurses that we talked about, those additional nurses, but also supporting an additional purchase of 11,000 hotspots to support our families who we're finding do not have sufficient connectivity from home. This is why, in order to do distance learning, not only do we want to empower and ensure that families have a good setup at home for the equity of access, but absent of that connectivity from home, we are having our school sites serve as hubs and safe spaces for families that don't have that connectivity to send their child to do their distance learning from a safe space on campus. And so as schools went through and welcomed back their students this week, they're also updating their information on how many students can learn from home and how many are going to need access to a Wi-Fi space on campus for the next few weeks as we wait on these new hotspots. And as we receive them, providing those supports to families to understand how to set them up and be ready for distance and or blended learning. We have tremendous increased demand, certainly with the use of video across not just DOE, but across our state. And the conversation about connectivity is a statewide conversation. We've been part of the broadband HUI, having that continued conversation and having conversations with our congressional delegation about ways to solve the state issue on connectivity. For us, I would like to see the issue of connectivity, which is a broader issue beyond the DOE, but impacts the DOE. I'd like to see another agency actually take on solution setting. But we are going to solve for this year. Long-term solution is necessary if we're going to have true equity of access. We've had training for teachers. We added, remember those 9 days with 25 added mandatory trainings. I just thank the staff because the teachers created the training for other teachers, and we provided training for also other within groups. But I'll focus on the distance learning. We had 7 modules or courses that were created for teachers on distance learning, and that was a great way to kind of norm across the state, knowing that we'll, as we implement this distance learning, we'll have to continue to provide added trainings and supports. We have a great cadre of teachers who now are trainers of teachers, which is great. We are using Google Classroom, which is provided by the department to all schools and has been used comprehensively by all staff for over a year, also with continuous training in the utilization of that platform. ASU Prep Digital uses Canvas learning management system. That's a pilot we are doing with Kamehameha Schools. Kamehameha Schools is using ASU Prep Digital with their entire campus. And we're using it as a pilot for schools who elected to be part of that pilot for either their K-5 or their K-6 elementary schools. We have capacity there for 6,500 students. But the opt-in of schools, we are actually using ASU Prep with about 1,700 students and 107 teachers. Those teachers have been trained over the summer for a 9-day period around that platform. We also have Florida Virtual Learning that uses Blackboard Learn as the LMS to serve secondary students, secondary schools. And as of August 13th, we have 53 participating secondary schools that are enrolling over 96,000 students and is offering over 3,600 courses. There was training this summer, and there'll be continued training, I believe, this September that will continue. There are questions about Acellus Learning Accelerator, and I'm going to have AS Bender answer some of those questions. we're using Acellus Learning Accelerator, but we're also using Edgenuity and Edmonton that schools have opted to use as part of their online distance learning. These platforms do require a teacher from the DOE who can monitor and deliver instructions synchronously or asynchronously. And so that teacher piece is extremely important. For families who chose 100% full distance learning, schools may have opted to offer Acellus as their selected distance learning platform and approach that includes online curriculum and instructional materials. That was at a purchase at a pretty nominal rate of $100 per student. And if a school is using it school-wide, the cost drops tremendously to $35,000 a student. That program actually has been part of the DOE for over a decade now. So it is not a new program, and it was a program that was that our school-based staff asked for in order not to introduce new distance learning approaches for the start of this very difficult year. And so that was actually the impetus for that selection, is that it's been in place for 10 years, and there was a request to continue having that as an option so schools can select in. Very quickly, I'll just close up my piece by saying we have launched the Ohana Help Desk to also assist with distance learning. It launched on August 4th. We have a whole team behind that program on the IT side in our office of our IT services. And they are working with Hawaiian Telecom as our partner who has hired staff to be able to provide call center support in English, as well as Hawaiian, Tagalog, Ilocano, Chuukese, and Marshallese, which are the most common languages of our families. We'll continue to look at whether there are other language needs. There are some languages that, some language needs of families that are need to be provided in a much more personal, interactive, school-based way. So we'll continue to look at how to provide those IT services across our language groups. I do appreciate the work that everybody's done to stand that up. I will now turn this over to, let me start with AS Connor and see if there's some additional highlights that you want to provide. There's just so much happening, really good work that his team is providing. And then I'm going to turn it to AS Bender to provide specific information, fill in anything you want to that I left out, but more importantly, just have an answer to the Acellus question, which I think is very important for the community to hear. So AS Connor, please.
Hello, this is AS Connor. So adding some more details and color to some of the things that the superintendent has said. So she talked about the more than 35,000 devices that we have purchased using the federal funding that's come to us through various channels, and the more than 21,000 that have already been received and deployed to students. Those are a variety of devices. Many of them are Chromebooks, some of them are Windows laptops, some of them are Macintosh laptops, many of them are iPads. One thing that the board should be aware of is that many of those devices are still pending delivery. Part of that is due to the very high demand that devices suitable for use in a school setting are experiencing right now. There have been supply chain issues in the computer manufacturing industry for a couple of years that hasn't been really noticeable to the public until several issues hit simultaneously with the COVID crisis. Some of that included the Chinese manufacturing shutting down in February as part of their COVID response, which produced unintended delays, cascading along with delays in shipping, increased demand, all of the same things. March, when computers started being asked for in significant numbers, is when shipping and plane flights just were not occurring. So that's leading to substantial delays, and that's why we're still waiting for devices to show up. This is not something that is unique to Hawaii. It is something that is being experienced nationwide and is attracting nationwide media attention. We are prioritizing the devices that we've got for those vulnerable students, but all of those purchases are in flight and are a cooperative effort between the state level, the complex area level, and the school level to ensure that we're getting appropriate devices to the students that most need them. In addition to the hotspots that we have purchased and delivered and that we're additionally purchasing, we also are working with the Office of Facilities and Operations that does transportation to provide mobile solutions, so that we've got 5 locations, including neighbor islands, as well as an additional one coming to Oahu soon, that allow up to 30 students to connect at a single time. We are also working to identify community centers that can serve as learning hubs, possibly by extending the school's network. We did a pilot of that for Ka'u in extending their network to Ocean View. That was actually simply to meet the needs of that school before this crisis started. That's in place and serves as a model for other community centers that need to provide access to the communities that may not be immediately around a school location. The superintendent did mention the broadband HUI. I've been personally at almost every meeting of that since that organization started meeting at the start of this crisis. The superintendent did also mention Google as something that has been in place for staff for some time. It replaced Lotus Notes as our core communication system last year. That currently stands at over 32,000 accounts. Anyone that receives a paycheck from the department, substitute teachers, casual employees, we give them an email account with Google so that we can be sure that we have some way to communicate with them and give them access. This year, as part of the response to the crisis, we accelerated our plans to do the same thing for students. We were going to do it over a couple of years. We did it all this summer. We had created, as of July 28th, 157,419 accounts as student enrollment has ramped up, as it usually does, as the students actually show up and the schools enter all their information, currently standing at 168,612 student accounts. So that puts us at a total list of accounts in the area of about 200,000. We're doing the same thing with Google Classrooms, automatically creating classrooms for online access from Infinite Campus, which is the department's student information system and is the system of record for grades, for classes, for enrollments, for everything. So that's all in place so that we guaranteed have some level of access at no cost to the schools. It's an automated process that we put in place across the department. As you might imagine, network utilization is at a very high rate. Even before the students returned, we were seeing substantial increases in network demand at our schools as the teachers were using video conferencing to attend training, to attend meetings, even with themselves at schools. Comparing our July utilization from 2019, we typically maxed out at 3.8 gigabytes per second within that month. In July of 2020, that figure was 10.1. And in August, of course, that's a busier time when the teachers are back and starting to teach schools. In 2019, that was 4.6 gigabytes per second. In August of this year, it was 12.7. So you can see almost a threefold increase in demand. We are working very actively to expand the network capacity with our telecom providers. That is proceeding quite well. And in fact, there has, except where there was a hardware failure by a single location for a telecom provider that affected a single school, there's been no outage as of yet. So we've been staying on top of this radically increased demand. We mentioned the Ohana Help Desk that is starting to get questions from families. We expect those questions to continue to ramp up as as families get more involved in distance learning, as we work through all of that, as they come across the issues that they're just going to see day in and day out the way you always do. The department's staff-oriented help desk, of course, is doing more work than it historically has done. The increase there has been from 10% to 25% year over year compared to the comparable time period last year. However, we've actually been staying very much on top of that. Our resolution time for average resolution time, so that includes things that are very quick, very easy, like I need my password reset, that's a matter of minutes, to something that is a much more complicated request, granting access to various systems that requires approval and may take days and days to resolve. Last year, our average incident close time was 3 days. This year, at the beginning of the start of this school year, it was 1 day. So that's a threefold increase in our responsiveness. And at this point, this week, we've got it down to 6 hours. So we're doing a great job meeting the needs of the staff as they come online with all of these issues. So as the superintendent said, there's been an awful lot of work going on. This isn't even getting into some of the changes in Infinite Campus to provide more support, more detail on the evolving student models that we've got. And there will continue to be improvements across the board as all of our software and system vendors continue to add their own improvements to meet the needs from all school districts across the country. And we'll be continuing to deploy that and continuing to make those improvements as the year goes on.
Thank you, A.S. Connor. A.S. Bender, can you quickly go over the new resources that your team has put online around distance learning and answer the question about how the process we're going to review the concerns about Acellus?
I'll start with Acellus. When we learned about the negative tweets, we had reached out to Acellus. And the representative had shared with us, and I'll just quote it word for word, the claims have been tied to a competitor and have not been substantiated. Therefore, we are unable to speculate. And similar allegations by the affiliate of this competitor were recently withdrawn after litigation. So for us, we have been using the Acellus Learning Accelerator program for more than 10 years. And we did use it during as a solution for credit recovery over the summer. And it was not until the August negative social media campaign did we receive any complaints or scrutiny. So going forward, as we transition, the Acellus Learning Accelerator program, we're going to continue to use it as a distance learning instructional material solution. It is still WASC accredited with courses that are endorsed by NCAA for scholar athletes and the College Board for advanced placement. It fulfills a right now need, and as we go forward, we see our teachers getting professional development on creating their own curriculum and instructional asynchronous materials, getting more effective with creating self-paced activities for students. And as we go forward with the work on developing our digital learning environment, we may or may not need Acellus Learning Accelerator instructional materials. Going to the looking at our training that has been going on, we released that onboarding course, and that was professional development that included how to make some pedagogical shifts, included best instructional practices for distance learning, lesson planning, and instructional delivery. and it included how to make strategic decisions for learning activities and the use of the tools. We are committed to professional development that helps educators continue to not only be competent in distance learning, but also excel in it. And so what's going to happen next is we are planning our multi-pronged approach for growing instructional leadership and also effective, powerful instructional delivery by teachers. And I did want to also mention that we have been looking at the surveys of our onboarding course, our 7 modules. We have confirmed that over 5,700 educators have been certified or confirmed completing the course. And we've been looking at what kind of answers or responses they had to the training. And we can see that there is a lot of positive, that they felt it was effective training. And then we also can see where there is varying comments, you know, where they might have felt either overloaded, or they felt it was very comprehensive, or they felt it was too much videos, and then there versus being helpful videos. And then they also added information. Our teachers gave us information about what additional things they want to see going forward. One of the things that we are doing besides providing these kind of professional development learning courses is that we've also created resources, which has all been placed on our learning design website. And on that website, you'll see that there is resources for how to accelerate the curriculum, how to assess students as we go forward, as well as how to be more effective with distance learning.
Board Chair, we'll stop there and see if there are specific questions board members have.
Okay, I am looking for hands. Let's see. Oh, I see several. So we're going to start with Board Member Voss, and then Board Member Bakarse, followed by Board Member Fallon.
Thank you, Chair. Superintendent, I want to start with the issue that we heard a lot about in the testimony, which is where is the distance learning going to be taught from home or from schools? And I want to echo some of the things that the chair said at the beginning. We need to de-escalate the rhetoric. We need to stop the personal attacks because it's just not helpful. And I respectfully but strongly disagree with many of the comments made about the superintendent today. But that being said, when you have a situation that needs de-escalating, somebody needs to make the first gesture. So in light of some of the testimony we heard today, might you consider directing schools to permit more teachers to do their distance teaching from home if they can show that it's necessary or beneficial under their personal circumstances?
So thank you for that question. I think it's an important question. I think one of the things that I want to be mindful of is that it was a short 2 weeks ago that we made the decision to transition to phase 1, phase 2, phase 3, where we would have 4 days in person and then go into 4 weeks in distance learning and assess whether that distance learning should be continued for another amount of time or whether it was safe to come back. And in that time period, we've heard from everyone about how important it is to have school-based teams make decisions that are the best decisions for the staff and the students and the families, understanding that there are differences from areas of the state. And one of the recommendations that came to me by our leaders, our complex area superintendents and our principals, is to allow the principals and complex area superintendents to work together to make decisions about where that teaching, amongst other decisions, where that teaching has to take place to ensure a really strong startup of the school year that's focused on students and what parents are needing and are giving feedback on, but also focus on teachers and staff members' needs to have access to resources. So I think one of the things that is important to recognize, and I want to articulate it, is that I have heard from teachers who want to have access to campuses and be able to teach from campus, and I've heard from teachers who want distance learning. And I've reiterated, we have a distance the distance work approach and policy that allows for supervisors to make that decision. I do not agree with a unilateral approach from me top down telling principals how this can best roll out. I think we have provided enough guidance and structure to now allow principals the time to work with their school-based staff to make those decisions. And a principal that says, look, we have a higher population of parents and students that need support, or we have a higher population of teachers that are saying they need more technology support and want to be on campus. Those are distinctions that the principal is well aware of and is being very accountable to. And so we've got to provide time for principals to lead. We can't keep interrupting them and telling them that there's one approach to doing this. We've provided the one guidance on safety to open up. We've provided the one schedule that we've all agreed to for this first quarter. Now I think we need to let the principals lead. They have a policy they can utilize. They are having their meetings with their staff. It's not just teachers, it's other staff members as well that are seeking telework. And where appropriate, we need to provide supervisors the opportunity to design at that school-based level for those opportunities. I have never told anyone they should not honor telework. In fact, we were very strategic about making sure that that telework system is in place so that it is an important tool that we can use in these uncertain times, and to be able to provide flexibility while still holding to our accountability. But that accountability, I've heard teachers and other staff members today, make comments that I take to heart. I don't want anyone thinking that we don't trust our staff. That's not what this is about. This is about making sure we have comprehensive systems in place at each school-based level, at each department, to make sure the work gets done, and it gets done really well in that delivery to students. So we need to give our supervisors a chance to do that without saying that at every turn, everything's going to be top down, because everything is not equal in what the needs are at the school from the staff themselves asking for these considerations. So I want to give them the space to make these decisions.
Well, Superintendent, I agree with everything you just said. For example, in the testimony we saw, the written testimony from those Kainalo Elementary School teachers, my old neighborhood, they wanted to teach, do their distance teaching from school. But I think there's a perception, rightly or wrongly, whether it's the administration or some of the complex area superintendents, that they are urging or directing some of the school principals to discourage telework. And I just want to have you state clearly that that is not the direction from the administration, that the schools make the decision based on the specific request from the teacher and the circumstances. Is that right?
That's absolutely correct. And what the complex area superintendents are doing that I absolutely support is that they're telling their principals, don't jump to a decision because there's this demand. Let's make sure you're being planful. I'm going to support your process for making these decisions. And so I completely support that in terms of the leaders doing that. And I do feel that there's a certain amount of, I've got to get out of the school's ways right now so they can lead from that level. I have great leaders in place, and I have great teachers and staff in place, and they can, at the school-based level, design how to appropriately do this.
Thank you, Superintendent. I yield, Chair.
Board Member Bakarse.
Aloha, mahalo, Chair. Board Member Bakarse. Mahalo, Board Member Voss, for bringing up that last point. So this question is for A.S. Connor. We stated that there's 5,000 hotspots purchased and 11,000 more on their way, and then 35,000 devices and 21,000 received. So I guess my question is, what is the timeline for arrival and dispersal of, I know we said they're back ordered and they're delayed, but is there a a timeline and anticipation as to when the delivery will happen. So that's one question. And the other question is, will 16,000 hotspots and 35,000 devices be enough? And is there a backup plan that you folks have in place until the devices arrive? Or should there be a mass service provider outage? And I guess that question is largely based on our island. You know, what is the plan for extreme rural areas like South Kona here on the Big Island that may not have the infrastructure to get online? I live in a semi-rural area in Kona, and I still only get 1 bar on my MiFi or cell phone, which is definitely not enough to jump on any kind of distance learning. So so what's the backup plan or the approach for that? Is there a system-wide approach, or is that going to be left to the individual schools or complexes to figure out?
So just to be clear, the devices that are taking some time to arrive are the computers, the laptops, and those are still anticipated. Some of them are starting to arrive right now. Some of them we have shipping information on right now. The vendors are currently projecting that they will arrive during September or possibly early October if there's additional delays. As far as the 11,000 additional hotspots, those are anticipated to arrive in 2 to 3 weeks. So there's much less of a lead time there. There's much less of a supply chain issue with that. As for will it be enough overall, we believe that it will be sufficient to address the vulnerable students based on our estimates of vulnerable student enrollment at the time the purchases were made. Obviously, we recognize that this is a changing situation. Families' financial needs are changing as employment changes, as everything kind of works through this. Enrollment is changing, going up in some places, going down in others. So we're keeping an eye on it. That is why we included, for the first time ever, questions on device and network availability as part of the start of school packet for every student. So we are now collecting that data, and the schools are starting to enter it. However, as you point out, for specific communities, a cellular solution may not be the best solution. It's part of why we continue to work with the broadband HUI and continue to work with the telecom providers to encourage them to improve access in those rural locations. That can be challenging, that can take some time, but that is something that they are committed to continue to push ahead on. That is also why we are not just saying, well, hotspots are the answer, we'll give a hotspot to a student and then we'll be done. That's why we have the mobile hubs. That's why we are taking approaches like extending to a community center to do a in-place learning hub, and continue to expect that the school leadership will work with the individual families that may have very individual situations in terms of what kinds of access they can and cannot get, and how we can close that gap on an, in some cases, very individualized basis. As far as overall outages for network access, system-wide, statewide, certainly the stuff that the DOE itself manages and controls is fully redundant everywhere. There is always a failover option across every connection that my team manages. As far as whether the telecom providers themselves can manage the increased level of capacity, that's something we've been talking about with them, talking about it both with the broadband HUI and directly with those providers. And so far, every indication they have given us is that they are also redundant, and they also expect to be able to continue to meet the needs. Are there going to be hiccups ever in a particular location? Absolutely, there are going to be things that happen. High winds may take a telephone pole down and interrupt service in a particular location for a period of time. There's going to be things like that. There's going to be the occasional hiccup. But overall, everybody is saying, yes, we can handle even the substantially increased capacity that we're seeing. Thank you.
Board Member Bacarsi, did you have any follow-up, or should I move on to Board Member Fallon?
Sorry about that, Chair. This computer issues here. Thank you for those responses, and I just want to reiterate that I sure hope that there are. It sounds like there's a lot of confidence in the systems that are in place and the backup and the redundancies. I just sure hope that there are backup plans for those times that we have hiccups. As like you stated, there will be those. No further questions, Chair. I yield the floor.
Thank you, Board Member Fallon, followed by Board Member Cox.
Thank you, Chair Payne. I'm not quite sure who to direct this question to and comment. It's related to Acellus. In the information that was shared by testimony and some of the examples, and some of the questions you answered previously, but I'd like to hone in more specifically on some of the issues around criteria related to curriculum content. And if when you're doing a vetting of a provider, that is an area that would be criteria for selection. I'm particularly concerned because, and these are excerpts, so I don't know the scope of the curriculum they offer, but there were some areas that were very sensitive that, especially at a time when we're looking at things like institutional racism and sensitivities around culture, that may be problematic. So specifically, how do you look at and consider criteria related to curriculum content?
Thank you, Board Member Fallon. This is Elisa Bender. We did our review of Acellus. We do have a criteria for the online course material. We did it for all of the different curriculum course materials that we are looking at, including Florida Virtual and ASU Prep, and also for the one that's on the learning platform, Acellus. In that content review, we did look to see if it was informed, if the curriculum was informed by issues of equity and justice. We look at interactivity, we look at engaging. We also try to understand how much students are doing, and it's not just watching and reading. And then we also want to make sure that we identify the skills, abilities, and knowledge for the activities to acquire. And then we also look for how it promotes student agency. When we heard about these reports from the UH professor and from parents, we started to make sure that we didn't miss anything. So we have been looking for this content that has been shared with us. And at this time, we have not been able to find it, but we are continuing to look through it for these controversial content that's been, we can only find screenshots of it. We can't seem to find it within the curriculum itself. We also are looking at what's happening with WASC, and that's because this curriculum has been accredited by WASC, and so we have been looking to see if there have been any red flags or concerns because the accreditation is still in place and was granted to in 2018. And we've been looking to see if there had been any other reports or concerns over this time period. And it's only come up during this time of the negative tweets that we've seen. And we haven't been able to, like I said, locate the specific, but we continue to be looking at what's happening because we are also concerned and we do take serious these things that have been brought up to us.
So in looking at some of the examples that were provided, you know, I went and I tried to locate some of the information, and some of it was withdrawn. So it's really difficult, but I really encourage you to continue to vet this. And going forward, it sounds as if you are looking at the curriculum content area seriously, and you have criteria. So I'm happy that that's in place. This particular vendor has been contracted by the state DOE for around 10 years. Is that correct?
That is correct. It's been about 10 years, and I believe that the Acellus vendor has been established for about 18 years, if I remember it correctly.
And there have been no previously reported concerns?
We have not seen any off of their WASC accreditation, and we did not see any similar concerns until, as I said, since August has been when we've got these reports.
How about schools?
Excuse me?
Have there been any local concerns expressed in the past?
I can only think of, you know, some folks feel that they would like to see an increase in rigor, and that's been the only concern that I've can think of that was in the past. And so this, like I said, is one of the different types of curriculum and instructional materials that we've been looking at.
And how many schools locally are using Acellus?
I can follow back up with you on that number. I don't have that information off the top of my head. I apologize.
Thank you very much. I have another question that came up as part of the testimony, and it has to do with the definition for distance learning and the difficulty understanding the definition. What thoughts are there? Do you agree? And if you do or do not, what plans might there be to help to clarify the definition, or at least make it simpler to understand?
So AS Bender, if you could talk about the feedback we got last time was related, and so you've had a team meeting and pulling together ways in which to understand distance learning instruction. Can you talk about some of those resources that you've added that's available to teachers and leaders?
We have been working, and we've been adding people to our digital transformation team, as well as our distance learning readiness team. And based off of the feedback and the information that we are getting from our various stakeholder meetings that we've had, we are developing different pieces and parts to help with communicating, as well as ensuring folks are understanding what is needed in distance learning and defining it. We have been even considering, and we've been working through how we can go ahead and get standards of practice together, which talks about bringing consistency to all the different components of distance learning. And we've also continued to look at how we can have supportive training for each of those particular standards that are coming out.
And I guess the other question, and this is kind of a next question, is related to the use of the term attendance and how it's being implemented at the school level for purposes online. Can you please provide what the definition is and how it's being used consistently across the system?
Yes, so we've made some major shifts to try to account for, to make sure we account for a daily attendance of students. And so AS Kana on the technology side and Heidi Armstrong, AS Armstrong, have been working very closely in leading through this change. So AS Kana or AS Armstrong, can you provide a response about the shift that we just made?
Oh, hi. This is Heidi Armstrong. So with attendance with distance learning, it does vary depending on what kind of program that the school has set up. So it might be an option to do a minimum login requirement, and the teacher, this would be approved by the principal, would determine how long would the child need to be logged on a program. Another way to do attendance in a distance learning platform would be the combination of face-to-face time, how much face-to-face time there was the student present, how long did they log in when they were supposed to. And another method is also assignment completion. So they might spend some time online and then be given an assignment that would be done offline that might take 30 minutes or 3 hours, depending on what the assignment is. And then that assignment completion, along with the login time and the face-to-face contact, could be taken into account. So we have a guidance book with different models that schools across the nation are exploring, and it would depend. There's not one specific way to do online attendance because all schools are not doing the distance learning exactly the same.
I am concerned about the definition and some consistency because we had adopted some dashboard metrics, and attendance is one of them. And in the description, there was provided different kinds of ways that attendance would be measured. So I'm wondering, when you report to us on the dashboard metrics, what you will be using as a definition so that it really tells us how well the students are doing and if in fact they are participating and the quality of their participation.
Board Member Fallon, I think you're bringing up a point that is very important. It is not a Hawaii unique situation. This is a brand new model and a new way of engaging students that really has been thrust upon us, and now we're using as a good, needing to design as a good model of practice. And the attendance piece is it's going to have to be a continued conversation as we look at student outcomes, look at the engagement level, have teachers and principals working together around the level of student follow through on those times that they're supposed to be online or need to be sending back their finished projects or progress on their projects. There's a lot of components to this, and it's really about providing an attendance approach that captures the fact that we are in a much more dynamic environment than checking in a student in the classroom. And so this is a huge change in practice for us. And it's an important conversation, I think, to keep at the forefront with the board around that metric.
I would appreciate very much if this particular conversation and the discussion you're having and the status and the progress be something that you update us on regularly, because this is a very key metric, you know, especially as we are using increasingly distance learning, and especially as we know that at least 70% of the students enrolled in our public schools are ELL and special ed or disadvantaged. And so it's a really important metric.
Agreed. And it's part of the monthly data reports we will be providing and the dashboard we're developing. And those progress reports that we provide to the board, you know, I will take guidance from the board on how you want to dig deeper into any one of those metrics.
Thank you. Just one final question, and sorry that I have so many. In the special ed area, this is just clarification for me. If a student, if a parent working with the school opts to do distance learning for their special ed child, what is the expectation in terms of the parent responsibility and the school's responsibility for providing special ed services or continuing to provide it? Is the parent on their own, or exactly how will that work?
Hey, Ms. Armstrong, can you provide a response, please?
Sure. So if a parent opts for distance learning for their child, the team meets and reviews the IEP, and the team includes the parent and all of the providers, the teacher that work with the student. And the team determines what components of the IEP can be implemented via a distance learning model. And in many cases, especially with our students who are in inclusion classrooms, distance learning can be a very appropriate methodology for them. There are some students, though, who have services in their IEP that cannot be delivered online. These would be services that might require one-to-one attention. And so at that meeting, the team would determine and have a written plan on what areas of the IEP can be done via distance learning. And if the parent opts for full distance learning, but the IEP cannot be fully implemented through there, a plan is completed so it's clear between both the school and the family on what services the child will be receiving during that time and what services won't be able to be provided.
And is that consistently the policy for every school?
Absolutely. We have a specific form that is to be completed, and there is very specific training on this process.
Okay. Thank you.
And again, any schools or any teachers who have questions, they can always call our office and we will walk them through the process personally.
Thank you. I yield.
Okay, Board Member Cox, followed by Board Member Takeno.
Thank you, Chair. Couple of things. First of all, on this Acellus, I spoke with the complementary superintendent for Kauai because we have 7 schools that are using it. And he said he's heard rumors, but what he's asked the schools, with the principals, is if in fact they do run across something like what we've gotten in the testimony, that they make copies or get the information to him so that it can come to the state. As of now, there's not been anything other than what we saw in the testimony that came in. So I'm just saying that I think that our CASs and our principals are on the ball on this one. Second thing, on the MiFis, the 11,000, I want to know, were they actually ordered? Because the principal told me they had not been ordered. It was just a plan the department was going to be doing.
Ms. Connor? Oh, yes, Connor, did you hear me?
So I'm sorry, I'm slipping on the specific details of what the question was on the Wi-Fi orders.
Yeah, whether the order
Question
had
is on the MiFi. The MiFi, the 11,000. A principal told me that they were told that you were planning on ordering and that they have not been ordered. And then you said that they would come in within 2 or 3 weeks. So I'm just trying to figure out if they've actually been ordered or not.
Okay. I'm sorry for missing that point there. So they actually have been ordered today. The grand total ended up being 11,777. When you talked to your CAS, it is likely he had just finished reviewing where in his complex area those MiFis were going. Once we had that confirmation from the CAS, we placed the order, and that applied to all of the complex areas.
Okay, great. Thank you.
So that order was placed. Those are in flight. We are expecting them to arrive in 2 to 3 weeks. That's what the vendor is telling us. We will be telling the CASs more detail on the shipping information as soon as the vendor provides that.
Okay, and the other part of that is that our large schools, especially some of our large high schools, are concerned about not having enough, especially if they have a large number of students that cannot, that don't have any kind of connectivity. So I'm going to be wanting you to make sure that when that comes in, if that's really actually going to be enough, or if you are going to have to come up with more orders in that area. Because that's been the big concern, is that the big schools, you know, because they have to be divided out all across the state for whoever needs whatever. And so big schools are going to have more of a problem getting them out to everybody that they need to have. And this is a question of equity.
So our expectation is as those devices arrive, as enrollment settles down, and as the schools gain the information from the families in answer to that that questionnaire, that is when we will have the concrete data-driven answer to that question. Is that enough devices? As the superintendent said earlier in this meeting, just this week we received more funding to support exactly these activities from the governor. So as soon as we see if there are any gaps, large or small, we will move on that. In addition, part of this purchase was a small number of devices, and these are the MiFi hotspots I'm talking about here when I say devices, are provided to each complex area to distribute as they see fit to be able to address any immediate needs. There's a student that is in desperate need over here. They have a device that they can make available so that that child can get on the network.
Great, thank you. We've asked, and other people have asked for a long time, you know, do all of our schools, once these orders have come in, are they going to be one-to-one? And I don't know that we've ever gotten any kind of a response on that. So we're just assuming when you give us these numbers that that's going to take care of it, or then you're going to say, no, such and such complex needs 2,000 more or whatever it is. So we just need some data on when you finally get all of these things as to where our schools are, because if the numbers keep going up and we do more and more distance learning, we're going to need to make sure that every kid is going to be able to have their distance learning. So that's really what my concern is that, and it's not so important that I know exactly how many numbers you've ordered. It's more important that I know how many kids don't have any kind of device or don't have any kind of connectivity? Because that's really the question that we need to be having answered. So thank you. The other thing that is bothering me about distance learning is that for our elementary kids, that you can't expect them to sit for 7 hours and work on a computer. And so some of the things that I have seen happening or I've heard about that's happening on the mainland is that even though the classes are all distance learning and the teachers are in the schools, but they're doing things like every 2 weeks they have, not necessarily worksheets, but pencil paper or coloring or work or art things that the students can pick up to go along with their distance learning. Because for small kids, they need to learn how to use pencils, they need to manipulate things, they need to touch things, they need to work with things. And so I'm not sure if in all of this training that we're giving for distance learning, quote, in quotes, is going to involve some of those things that are really important for kids to have. And yes, if we end up with a blended way of instruction, then kids will get some of that. But for those that are totally on virtual learning, or if we have to end up that way because our numbers go so big, then how are we going to make sure that all of our kids are getting those things that they need to have? Because for K-3 at least, they need to manipulate, they need to learn how to use their pencils, they need to color, they need to paint, they need to do all those kinds of things. So in your training, is any of that involved in trying to incorporate all of that into distance learning?
Thank you, Board Member Cox. This is Elisa Bender. In our training, we are having those helping with teachers understanding the pedagogical shifts, as well as how to design their learning activities and what their instructional minutes should look like. There is a distinguishing thing that should be happening, is that they should be understanding that instructional minutes include, of course, asynchronous activities, synchronous activities, as well as offline activities. And the other thing that is part of designing, or a consideration to designing the instruction, is that there should be a consideration to the developmental age also. And so we are working to make sure that teachers are highly effective with all 3 of those areas of instruction, and also making sure that they are considering developmental age as well.
Okay, so if the teachers are going to work from home, then how are you going to be doing all of that?
I apologize, Board Member Cox. Are you talking about their training, or are you talking about the delivery?
Once they're trained, if they're going to be, is there any consideration when we talk about teachers working from home that maybe they would come into school for a certain amount of time for other things? Because I'm real concerned that for especially our younger children, that if we go totally virtual learning, that they're going to be behind some of the other kids, because they're not going to have all of that development that they need to have. So I'm just trying to figure out how the department, or are we just flat saying, well, schools, you just figure it out, and principals, it's all on you, so you work with your teachers and go from there, which is some of the complaints we're getting, because they don't really know exactly what it is they need to be doing.
Yeah, so Board Member Cox, this is Dr. K again. That's a great question, and it's a learning process. One of the exciting things that happened over the summer, and it happened even before now for the teachers who were part of either summer school or were part of the development of training modules, is they've been sharing practices with one another, and those practices are age appropriate. So they've done everything from sharing ideas around creating little art kits that they can pick up at school at an assigned time that has some of those materials, helping parents to understand what kind of materials at home they can pull together, having the students given in their packets a whiteboard with markers so they can write or draw something and show it up to, show it to one another on the camera. Having the students do work before they're on the camera so that we're not relying on just being on video, and providing students that work time, and doing performances for one another, doing discussions with one another. So yes, trying to use all those different learning modalities, because it does have to be age appropriate. And it's those sharing of practices of teachers with one another where teachers learn best, and because they're learning from one another and they're trying out things together. So there's a lot of richness in what's happening between teachers. It's a matter of making sure that in all of our coordinated training modules, we are providing those best practices. There's even been science kits mailed out to kids that are age appropriate for those very young grades, that are very simple, but it helps the kids to receive something. And so all of that is part of this. It's really about thinking about instructional materials and manipulatives very differently, because it's done in this distance approach, but it does have to be appropriate for that age group. And we'll have to monitor that very carefully in terms of making sure we have great resources, ideas, and training for teachers in those younger grades.
And that's exactly what I'm talking about. I realize we have some really super teachers that are working together and doing stuff, but it needs to spread out everywhere. And so that's what I'm depending on the state to help all of our schools be able to know and how to do some of those things to go out to them. Because it sounds really good that teachers are going to share. Well, teachers in a school or a complex might be, but it may never make it out to, I don't know, Kikaha, So I'm really trying to pinpoint that the department and their training procedures is really giving those kinds of things that teachers need to be able to do the job the way they want to do the job. So I'll yield the floor.
Thank you, Board Member Cox. Board Member Takeno?
Thank you. Can you hear me?
Yes.
Okay. Thank you, Board Chair. Could I get permission maybe to just talk in a little off topic, but kind of broad? Sorry, I have a personal commitment and I didn't think it would run beyond the time we're going now. So I might have to leave pretty soon. So I kind of wanted to wrap up some stuff that I was having some thoughts on.
Yes, you can do that. And remember that weaving through all of this, if you have anything related to communication and some of those things in the last two issues, that's quite appropriate. So go right ahead, Board Member Takeno.
Okay, thank you. There's a lot of great discussion today about, I guess, the evolving situation with the reopening of schools. And so, I'm kind of looking back upon, I guess, a memo that the superintendent provided the board on July 23rd. And it was the board action on metrics to monitor and evaluate the DOE's comprehensive plan for reopening schools. And if you take a look at that, there's a lot of metrics and I guess a proposed vital sign metrics that again has been proposed and approved by the board to address the priorities as well as some of the descriptors. But that was July 23rd, 2020. Today, I think we can all agree that the situations and the concerns that have evolved are more than what we initially thought on July 23rd. That there are a lot more, I guess, variables that when you take a look at these descriptors are not addressed, and those variables have been coming about within the past month. And I think today's discussion, there are a lot of them that have been brought up to the board and for the past month. And I don't think that just having this one discussion would provide those some validity. So what I would like to see is that the department take a look at its July 23rd memo and take a look at the descriptors that they had initially proposed. And from what was presented today in the I guess an update to the resolution, all the concerns that are coming out, if they could propose adding those descriptors in as well as their proposed vital sign metrics so that we can have an update on them, maybe, as a monthly report so we can keep on following up, because it seems as though these concerns keep on coming about. And some of them are the same concerns. So there seems to be like a little disconnect between what we hear from the testimony and what we're getting, I guess, from the report. So I suggest the fact that the department, I guess, take a look at that and amend, again, that plan, that return to learn plan, as well as provide additional descriptors that have been brought up to date, as well as what they would suggest as their proposed vital sign metrics. With that, I'll yield my time. Thank you.
Is there any response from Superintendent on that?
Yes, absolutely. We are continuously adding to that return to learn plan. So there's lots of additional resources that have been rolled out that AS Bender talked about with the distance learning descriptions and the training around how to utilize the time within a distance learning structure for instruction appropriately to those age groups. So there's lots of new stuff that has been added, and we're going to keep exponentially adding to that. And it's interesting that you brought that up, Board Member Takeno, because just a few days ago, I met with one of my data governance staff members, and we were having a discussion about kind of how we are capturing based on these metrics, but also getting to a more comprehensive story or a data story that tells accurately what some of those growth areas are, because there are going to be these exponential changes and growths and adjustments that we make throughout this year. So I do think that we need to keep the conversation about the metrics going while and certainly telling the context around those metrics while still having some consistent metrics. So I'd be more than happy to go back and look at whether there is an adjustment that we need to make to that July, I think you said it was the 23rd. I don't have it in front of me, but I believe it's July 23rd memo, and revisit those descriptions in light of what has happened between that time period and the actual opening that we have delivered on this week, and how we're staging out the next quarter and semester.
So I guess I acknowledge the fact that it's going to be ever evolving. So if what I'm asking is, at the next meeting, can we have the board provide? Can we have the department provide the board with its update to this return to learn plan, the descriptors and the proposed vital sign metrics, and then get a report from thereafter? And then anytime it's changed, we get updated as to what are going to be the changes, since it's going to be ever evolving. But we just want to make sure that we're keeping track of all of these, I guess, situations and these variables that are coming up, so that we as a board, we know where the department is in a sense of where they are in addressing the concerns that are coming out. So could we have that by the next board meeting?
I would need to kind of set up a time to meet my data governance team and make sure that we can get something turned around within that time period. But I can certainly deliver on another kind of look on this by the next board meeting, and then we can have the discussion whether there's anything else. But we're already in the we are already in the process of staging the report, and I want to make sure that I meet with them about what these changes mean and how to capture them, but certainly can take a look at that and have something back for the board for discussion if we want to reopen that discussion, or whether you want it in kind of a report format and I meet with board members to give me feedback, and then we share something with the public.
Well, I guess what I'm requesting is can we elaborate more on the descriptors, provide some metrics, proposed metrics first, and then after we would get these reports. But we meet every 2 weeks, so could we get it at the next meeting? And if not at the next meeting, then we'll meet 2 weeks thereafter. So could we get it done within 2, or could we get it done within 4? Is my question.
Yeah. And the challenge, of course, is the sunshine law, and we would essentially need to get this done in a week in order for it to be posted for a 2-week meeting. And that's what I'm saying. I want to make sure I spend the time on this. So this may be a matter of by the next board meeting, I can send something to the board members to start looking at, but it may not be able to be posted on time because it would have to be done within a week's time. And next week, we're doing this huge transition to distance learning, and I need all hands on deck in terms of supporting the distance learning piece. So what I'm proposing back is I get something back to the board in writing by the next board meeting, but it gets posted for the following meeting.
Okay, so there's a commitment that by the next 2 board meetings, we'll have something before us.
Yes, we can do that.
Okay. But, if we meet once a month, I think that would be, because that's what we're doing now, we're meeting once a month. That would give you the full 3 weeks leading up to that. So.
Oh, if that's the case, yes. I just wasn't sure if we were having another.
Yeah, no, I'm sorry. Yeah. So, okay, but so by September, when we should be able to take a look at these things?
So today's the 20th. We're shut down tomorrow. We're in our first week of distance learning. So it's really by the end of the first week of September, by the 4th, I send something out to the board that weekend with my Friday board brief.
So I would say the next time we would meet would be September 24th. Would I be, because it would be the third. We meet on the 2nd and the 4th week, right, of each month. But now we're meeting only once, right? Well, September 17th, rather.
Yes, it's the 17th of September.
17th. So you have 1, 2. You would have the 3 weeks leading up to the 17th.
Yep. That's
okay.
Correct.
All right. Thank you. Yeah, I would appreciate taking a look at that. But thanks. I'll use my time, Chair.
Okay, we have Shanti Asher. She hasn't had a chance to speak yet today. So welcome, Shanti, to the conversation.
Thank you. Thank you, Chair. And thanks everyone for all the updates. I have 3 questions. I wanted to know if I should ask them all together or in segments.
Why don't you ask them all together, and then because they may go to the same person. So
Okay.
go ahead.
Thank you. So the first question is, I heard, if I heard it correctly, there are teachers from the testimonies today. There are teachers who wishes to do telework, and there are those who prefer doing distant learning in their classrooms because it's more effective. My question is, are the teachers given the flexibility to ask to do distance learning or not given their wishes? And if so, what is the process of approval? Because I kind of felt that the testimony shared today, there are justified reasons for why someone wishes to do distant marketing due to health and safety concerns, bringing it home to families that may have pre-existing condition and putting them at risk. Or the other side is it's more effective to do distance learning in their classrooms. So that question is really, if a teacher requested, is it the principal or the CASAs that make the decision to grant that request? The second one is, the past week or this week, I understand that schools are doing arrangements of devices based on needs. Now, there are two common issues that were expressed. One is that some families do not have connectivity, which was really talked about earlier. And I'm not going to ask about, timing and all the connection issues because I heard enough of it. But I'm going to ask the question after the next one. So one is connectivity.
Yeah,
Some schools are.
I was looking for my number. I just got
Sorry, is someone asking me a question or? Chair?
I don't hear any response.
Okay.
Maybe we
Sorry,
need to
I
get
heard
better
the noise, so I thought someone was trying to ask me a question.
I think somebody's
So
trying to get
I'll go ahead and continue. The first one is connectivity. And I know some schools are trying to find like hotspots and do those arrangements. Now that's one. The other one is some families are saying that they need the device, but they're worried about their liability that if something happens to the device, they cannot pay for it. So with both of these concerns, how will these delays on their kids having connection or having access to a device, will this delays affect the students in their attendance or participation, ending up, affecting their grades? So that's the second question. Now, the third one is I wanna say thank you to the superintendent and all the CASAs for creating the Ohana Help Desk. I tried that out and families did reach out, and I congratulate you for the training and having the language access available through that line. My question regarding that is, what is the scope of their service, the hotline? What kind of services can they provide? Let's say if a child or a parent wishes to get some tutoring resources or ask questions about tutoring, can that go directly to the hotline since they have language access availability, or is this a matter directly to the school? So those are the three. If you wish me to ask, maybe summarize it, I can do that. But those are my three questions.
Thank you for those questions. I'm going to have A.S. Covell talk about the telework process, which is a process that principals and CASAs are working on together to balance between the work that has to happen in supporting special ed and the Wi-Fi hubs that still exist at school, and their considerations for employees. And then the next two questions, which is the accountability for the device, as well as how we're ensuring access for students that don't have that connectivity, as well as your third question about the scope of services of the Ohana Help Desk. A.S. Connor is going to answer that question. So we'll start with A.S. Covell.
Hi, good evening, board members. This is Cindy Covell. The telework piece on the policy, we wrote it to be, hello? Can you hear me? Okay.
Yes, you're
We
fine.
wrote it to be, thank you, to be broad enough to allow the supervisor, whether they're sitting at the state complex level or the principal at the school, to be able to consider many factors when they consider approving the telework or not. So it depends really on the job description and what the person is doing. But because we're talking about teachers and the request for telework from teachers, we'll leave it at the school level for the discussion right now. And again, the policy is written, as was stated earlier, to provide flexibility to principals. But what we're learning as we go through this journey is that they prefer to have the teachers in the classroom as we start out with distance learning. And there's many positive reasons for that. First of all, it is still relatively new for a lot of our teachers. And if they're at the school in their classroom conducting distance learning, they have already automatic supports there. So they have the internet, they have the tools they need, they have technical support, they have coaching support, they have other teachers they can collaborate with. So the principals would like to have their teachers in their classrooms at the school as we go through this process of getting better and better at distance learning. There are also conditions at school that make it more productive for them. They do have their devices there. We've had teachers that say they don't have what they need at home. We've had other teachers that say they do want to be at school to teach. The other part is just looking at other states who are struggling with the same things we are with distance learning and with telework, is that they have found that students that are at home and they're able to see their teacher in the classroom as the teacher is teaching, it makes them feel more connected to the school and the teacher in that environment. There's many reasons. And again, as Superintendent Kishimoto said earlier, this is a leadership decision at the school level. I think the question was who approves it. So the way the guidance is written is the supervisor has the authority to approve telework, again, based on many different factors. Did that answer your question?
Yes, thank you. Thank you very much.
Okay, thank you. I think there's two more. Jess is going to respond to the other two questions, please.
Correct. This is A.S. Connor. So the first question was on the device needs and the connectivity, as well as questions about liability for damage or loss to the device, and whether delays in device access or device loss, whether that would actually affect a student's grades and their overall performance in school. And then the second question I'll be answering is on the Ohana Help Desk and the scope of its services. So certainly I recognize the concern in asking a family that is in significant financial need and therefore needs a computer to be loaned to them by the school, asking them to be liable for replacement costs for that device. These are exactly the families that can't pay for a computer, so asking them to possibly pay for it is not a realistic expectation. That being said, I think it is realistic to ask the students and the families to treat school property with the same respect that they would treat property that they were with at school. And that is the sense of liability, not liability in a legal sense, but that you recognize that this device is school property. You're going to take good care of it and make sure that that you're treating it with the respect that it deserves, in the same way that you would treat the school buildings or the library books or the desks with respect. And if you intentionally or accidentally cause some damage to that, just as if you intentionally or accidentally cause damage to school property at school, there will be some sort of consequences that you will need to deal with. As far as affecting a student's grades, certainly in line with the challenges that we faced in fourth quarter last year, I would not expect delays in access to a device to be something that would be seen as the student's fault, as the individual situations that are leading to individual challenges in how a student accesses their education. I would expect the teachers, the principals, the complex areas, the state levels, all to be working together to ensure that the student has access to their education. And as long as they do, then of course their grades and their performance is exactly what we should be assessing them about. If we're having problems because network access is something that we need to be addressing, for example, I would not expect us to be punishing the student for not being able to get to their school in the same way we would not punish the student necessarily for not being able to physically get to school because they had a car breakdown. Would they have to make up the work and catch up with that effort? Absolutely, that would be a reasonable expectation. And we would expect a situational way to address each of those issues. Now, as far as the Ohana Help Desk and its scope of services, it is very specifically a technology support help desk. It is there to answer questions from the families about how to use the technology that they need to access their education, how to do that effectively. It does have some mechanisms to transfer requests that are not within that scope of service to other parts of the department. If it is something that is dealing with the department's technology overall, it may be transferred over to the OITS team directly. If it is something that is educational or instructional or something that is handled directly by the school, then the expectation is that request would be transferred to the school. So in particular, your question about tutoring, that is not something the Ohana Help Desk does, nor does it directly provide access to tutors. That's a request that if a family feels that they need that for their student, they can start working with their school to say, my student needs more support to be successful in their education. And so if they made that call to the help desk would say, great, this is a school answer. Let's get you connected to the school for your child and get that addressed. If a parent calls and says, why did my student get that grade? That's a school question. If the parent calls and says, I don't understand how to make my Wi-Fi work better at home, that is a family technology support question that would be answered by the Ohana Help Desk. That's the scope that we contracted for the Ohana Help Desk and that they're equipped to solve. Again, we recognize that lots of calls will come in and they'll be routed appropriately if that's not something that particular team should be addressing. And hopefully that answered the second two questions, Board Member Asher.
Board Member Asher, do you have a follow-up or did you get your questions answered?
I got my questions answered. Thank you very much.
Okay, thank you very much. Vice Chair Uemura.
Thank you, Chair. I just have two quick questions. One is for the superintendent. It's a general question. It's really a follow-up on the conversation that Board Member Bruce Voss had with you. And it's really about just to confirm with you that you really have no concerns about doing distance learning for the first quarter, because that's been a that has been discussed both in the media and testimony and with the unions. I want to make sure that that my assumption is correct, because what you stated was that the principals are the leaders, they make the decisions, and you don't want to be given instructions going from the top down. Is that correct?
I'm sorry, are you referring to distance learning or this telework?
Distance learning.
So I have huge concerns about distance learning because this is the first time we're ever doing it. And that's why I said next week, it's all hands on deck to watch how the process goes next week. It'll be the first time ever in DOE's history that we're doing distance learning for an entire state system. And so, yes, we have lots of concerns because it's the first time, but we've put in place lots of supports, training in place, and then we know there's a lot of support and training that has to follow.
Yeah, I think, I guess, let me clarify a little bit more, because what we're talking about is the ability for the principals to decide whether the school goes to distance learning or not. Not whether, you have about the whole concept, but I think what I was trying to clarify from you was that you're leaving that decision up to the principal. Is that correct?
No, so the discussion with board member Voss was about telework. Was that the allowing the principals to set up the structure to review the telework requests from employees because they're the supervisors. And that's where I said I was not looking to do that top down across the board. That was a different question.
Okay, I'm glad, I'm glad I clarified with you, because I hate to make assumptions and not be correct. So I'm glad you clarified that. So basically, the decision still rests with you then.
The distance learning approach that we're taking, we've done statewide by bringing all the CASs together for recommendations by county, and made a decision in Oahu and then by each county. And all of them decided, let's do this all statewide. This is the first time we're rolling this out together. And so it is a recommendation that came from the CASs in looking at this new start to the year, that I agreed with wholeheartedly and certainly am supporting. And so, yes, the decision ultimately I rolled out, but that's in honoring what I think was a very thoughtful recommendation from the CASs working with the principals.
Yeah, so more and more we're seeing schools now saying that they're going to go strictly to distance learning. So the assumption there is that you have given them the blessing to do that.
Yes, all of them, with the exception of Molokai and Hana, who have asked to be more tailored to some additional requests from community to do things slightly different. So everyone except those two schools.
Yeah, so just to clarify again, I'm sorry, because it's something that, it's been buzzing around. I want to make sure that we all understand what you're saying here, because you came up with 3 phases, right? The first phase, 4 days, and then you do distance learning and then in-class learning, correct? And so there are some schools that have come back and said, no, we're just going to go distance learning. Are you familiar with that, or am I not reading that correctly?
So some schools working with their CASs, if they assess that students and teachers and parents were ready to do distance learning, did their practice and support via distance learning. And now they have to make sure that those supports were in place over the 4-day period. So they went ahead and started practicing the distance learning and backed into whether supports were needed, day 2, day 3, day 4 of this week. So how each of them rolled it out, as long as they were focused on monitoring and receiving feedback on the supports that kids and families need for this time period, then there were some variations, but this was a week of practice and support.
Right. So if a school came back to you and said, no, we don't want to go to in-class, we want to go to full distance learning for the first quarter, which has been advocated by a lot of people now, your response would be what?
Yeah, so I am giving the principals the time period of the next 2 weeks to look at what's happening on caseload and what's happening for their various islands and counties, and look at what recommendations they have about how quickly they want to get back to blended learning, as long as they've done 4 weeks of distance learning, because we have we're all doing distance learning for 4 weeks. After that, or not after that, in the midst of that, I'll be gathering with them again and saying, where are we? What are you seeing? Where are supports needed? Are we ready for blended learning? Or I may be going back to them and saying, look, I'm looking at the numbers out of DOH, and there are still alarming numbers, and we really need to remain in distance learning. But this is a collaborative conversation and make sure we're all on the same page and sharing with each other. I have a much more bird's eye view at the state level than a school principal that is hearing from his or her community, teachers, parents, and so forth. And so it's important to have the conversation before we roll out a decision.
Yeah, and I guess that kind of goes back to, the guidance that we're looking for from the DOH as far as when, we actually go back to in-class learning. So you're looking at that metrics to, just to use the terminology. But, then it, sort of goes back to some of the concerns and testimony we got is that, to go back in 2 weeks or 4 weeks and say, well, now we're going to pivot again. We're not going to do this. We're going to go to distance learning. So how would you address that? Because I know you're looking for data, correct? You're looking to see how the COVID cases and the DOH, what their responsibilities will be. But is there a possibility that you can give people more time, especially your principals and your teachers? Because they're asking for more time to prepare now. So
yeah, these changes have been so fast and furious. I understand that frustration. It's we're all experiencing that frustration. It's not even it's very disruptive at all levels, essentially, and especially at the school level. And so, yes, if we can elongate the time periods in which we are in something more stable in terms of a decision to stay distance learning longer, we're checking. I have 2 check-in points next week with leaders, twice next week. And so we'll be able to see how next week is happening and start gauging how quickly can we make a decision about lengthening this time period in distance learning, or hearing back about, any major concerns that the principals have around, student engagement and students coming online and how successful that is during that first week. Next week is going to be a critical point to really get the data, at least that first 5 days of distance learning, to be able to have this next level conversation.
Yeah, I think,
I hope we can get to less disruption as quickly as possible.
Yes. So that's where I was going. That's where I was going, Superintendent, is why not just say, let's do it to the first quarter to give everybody the time, teachers, principals the time. So they got some breathing room now versus waiting for all these key points to come up and say, well, maybe I'm going to wait another week now. You know what I'm saying? Just say we're going to do it at the end of the first quarter, give everybody the opportunity to prepare for that.
Yeah, and I'll have a chance to have a conversation early next week with the complex area superintendents as they're gauging. We have some complex area superintendents that were ready with their principals to say, let's go the whole quarter, and others that were saying, look, I have some other data and some feedback from community saying, okay, we'll do this 4 weeks, but at 5th week, we need to get back to blended. So we have community with so many different needs. We have families saying we don't want to stay in distance learning, and that's what the leaders are really trying to manage, is how do we support our community and make a good decision based on the data. So I think giving them, in all fairness, they've asked for this time to make that decision. But as they start, they have this week of data, they have next week of data. I think they'll start making decisions fairly quickly around what they're learning from their community.
And there is one more point, Superintendent. There's been talk about, because your CASs are really separate districts, and there was talk about treating each district differently based on their communities. Have there been consideration to do exactly that? In other words, some CASs would say, let's go distance learning for the quarter. Others would say, no, we're going to stick to the timeline. We're going to do the blended learning. Have you looked at that at all?
Yes.
Or considered that? Okay.
Actually, that's what I've stated, is that that's why I think it's so important to have complex area superintendent voice about what they want to do with their team of schools, and not have a top-down, state level top-down approach to every decision. We want to be able to honor what these complex areas are seeing in their area based on their own data and input from their community. So yes, we are looking at having each of them come back with their recommendation on what they want to do. So as I mentioned, I already have 2 of them who have said distance learning longer, and I have one of them saying I'm getting a lot, actually I have two of them, a lot of feedback from community really saying we've got to get back. We have too many students with connectivity issues or high needs issues, and families really demanding blended approach. And so again, they're being very thoughtful about this and engaging their principals, and they need to be able to finish those conversations.
Yeah, thank you, Superintendent. I think that's the school of thought about do you wait for the district that's not ready, or do you go with the one that's ready? And I think the consideration is maybe you got to do both. So with that, I'm gonna flip over to AS Bender and ask her a couple questions on Acellus, if you don't mind, Superintendent.
Of course.
Hello.
Hello.
Hi, Lisa. This is Ken Waymore. I wanted to just backtrack with you on some of the questions that Board Member Lynn Phelan had asked you about the Acellus program. And it's more clarification for me. I want to understand it a little better. Because exactly what program are you using? Is that, because you said that the WAS is accredited. I mean, Acellus is accredited, but it's only for their academy. It's not for their learning platform, correct?
And what that Acellus Academy does use is their Acellus Learning Accelerator program.
Okay, correct. But so are we using their academy or their accelerator program, which is a supplemental teaching?
Yes, we are using, just like what you just said, the Acellus Learning Accelerator program, which is supplemental and is instructional materials and curriculum resources.
Okay, but is the Learning Accelerator program accredited then? Because I know the academy is, but not sure if the Learning Accelerator module is.
So and I apologize, maybe I'm not totally understanding, because the Acellus Learning Accelerator program is what the Acellus Academy uses as part of their curriculum and instructional materials. And the Acellus Learning Accelerator courses, materials, and program has been endorsed by the NCAA for Scholar Athletes and the College Board for Advanced Placement Courses.
Okay, so now you're confusing me now because
I apologize. I apologize.
No, because I know there's two separate, right? There's the academy, and the accelerator is really an online tutoring program. So we're using the tutoring program, but you made a statement that it's accredited. So I just want to make sure that we're talking about the same thing. And my understanding is the accelerator program is not accredited, but the academy is. So there's two different programs. It's not one and the same.
And I apologize. We don't look at curriculum as being accredited, but as I was saying, with the academy, they are utilizing it, and that's what helped with their accreditation.
Okay, so
it's one of the components of their accredited program.
Yeah, so just to clarify that the Learning Accelerator program is not accredited. It's recognized, but it's not accredited. Just because, it makes a difference when you state that a program or college is accredited, because it lends a credibility to them, right? So what you're saying is that because the academy is accredited and they use the accelerator program, that's the credibility that they're lending to the accelerator program. But to be clear, that program has not been accredited. So that's the distinction I'm making right now.
And I guess I would add to that we have made a criteria and evaluated it also ourselves. And we are doing our best to go ahead and look for where those concerns that were coming out from parents about all of those different exact, I guess, videos or exact instructional material that's being scrutinized.
Okay. No, thank you. Yes, Bender. I just wanted to follow up just to make sure that we're all clear on what's happening. I'm glad that you're responding to Board Member Fallon's recommendations and questions. So with that, Chair, I'm going to yield the floor.
Board Member Nama'u.
Mahalo, Chair. And thank you, Vice Chair, for answering or asking some of the same questions I was about to ask as well. But maybe I can just pivot a little bit around some of those questions. Going back to Acellus, AS Bender, if you could just, I mean, you stated that in the last 10 to possibly up to the last 18 years, Acellus has been used by the DOE. Is that correct?
The Acellus has been in existence and established for the last 18 years. For the Department of Education, we know of about 10 years of us using the program.
And has it been used primarily for credit recovery?
It has also been used for credit recovery, yes.
Okay, but now we're in a different situation where this program is primarily going to be used as the primary curriculum for many of our students. Is that correct?
It can be used for the curriculum and instructional materials, correct.
Yeah, and I believe it's my understanding that many schools quickly, you know, signed on to using this program because at the very beginning, you know, when, you know, it's very chaotic and I understand that, you know, everybody's just still trying to figure out what were some of the next steps. And so, and I know that parents were very worried and concerned about sending their children to school, but they wanted to have something available for their child's education. So they were out there going, I need to have distance learning. I don't want to send them to school. And as was shared with them by many principals or schools, that they had this distance learning available to them. And I believe for many of them, the Acellus program was what they were going to offer these students. So the reason I'm going down this pathway, I'm just, and please interrupt me if none of this sounds correct as I'm going through this story here. But as they signed up for this distance learning, then they were also told that they had to be locked in to this, that if they were going to choose this distance learning, that they were going to be locked into this and that they would be their child would be expected to learn this way for perhaps the rest of the school year. And that they understood also that it would not be so much of a teacher engaged thing. There might be a teacher that would monitor their progress, but it's pretty much a curriculum that they would be doing on their own. Is that correct?
I think there's been some confusion about the Acellus Learning Accelerator. This is still instructional materials that still requires a teacher. And we have been very much depending on our teachers to determine pace and sequence and when to engage with the child. Part of the Acellus Learning Accelerator is there is ways to monitor what's going on with the learning, and that then is something that the teacher can use to go ahead and address a student's needs or intervene and decide, you know, how much more what I would call synchronous learning needs to happen for a child.
Okay, so that's the kind of monitoring or interaction that they would have with this particular student, but the teacher itself is just following along with the prescribed curriculum that Acellus is providing. They're not going to be doing any additional teaching on top of that. I'm asking.
I guess I'll just use it as an analogy. It's for us looking at the accelerator program is like how we would look at a textbook, right, in our face-to-face learning. We are still believe in our teachers that they're professional and that they're able to determine what additional or what other things they need to supplement or what other things they need to plan. And that's part of what we are hoping to also, if there's any help or support that a teacher needs, we're also willing to provide that.
Okay. So the reason why I'm kind of just going down this pathway here is that as we progressed and we changed up how we were going to roll out and what kind of process that we were going to offer the students, and then, you know, the blended learning was introduced as well. But some of these families were locked into this distance learning piece, and then eventually we had to go all distance learning statewide. I mean, and what my concern is now, you know, because I had also heard that, you know, there were some teachers that felt like, okay, well, these students, they're no longer a part of my roster. So I don't have to worry about them because they're with Acellus, and I'm going to just concentrate and create the curriculum I needed for this blended learning. But then as we all went to distance learning, the teachers realized, oh, then now I've got to provide, you know, distance learning for these students that are still on my roster. So I'm kind of getting to this question that I have. The students that were locked into the distance learning initially, are they in a position to leave that program and perhaps get back into a teacher's roster and then be able to continue their distance learning, but having it with the teacher itself that they probably would have been with had they, you know, had we done face-to-face, for example? Is that a possibility? I know I'm kind of digging down here in the weeds, but this is something that brought to my attention a lot from concerned families that are concerned about the type of curriculum that is being presented to their children. And especially since Acellus is having a lot of concerns right now. You know, a lot of us are very concerned about what is really going on there. I'm not convinced that it was vetted properly. And I mean, I understand that this has been part of the DOE program from 10 years ago or whatever, and maybe decisions were made quickly to just adopt it, but I'm not convinced that it's an appropriate kind of curriculum. I have concerns about that. And if I was a parent who was locked into now with this particular program, I want to know that I have the opportunity to go back and perhaps be with a teacher that is at my school and delivering curriculum distance. So that's where I'm going with all of this. I don't know if you want to comment on this or if Superintendent would like to comment on any of what I just shared.
So board member, what I would like to share is kind of following along with your, where you were going with your story in terms of the timeline. At the time when we thought we were opening fully face-to-face, we wanted to make sure there was an offer of full distance learning to a parent, so that would give them an option to opt into distance learning and basically opt out of face-to-face. And at the time, we thought it was best for the school to recognize that if a child is jumping in and out of a program, it might be too disruptive to their educational and to their learning. So we had asked if the parent would consider if they are opting into a distance learning program that has been chosen by the school, that they would stay with it for a minimum of a quarter and possibly for the year. But that was a consideration to make sure that there was continuity in their learning. Since we've now gone full distance learning, This is part of us just making sure that teachers are empowered and have support and the resources to go ahead and do distance learning. This is, of course, as Superintendent has been saying, this is our first time, and we weren't totally sure, I guess, of do teachers have everything they need? Are they equipped with everything? And so the Acellus Learning Accelerator Program is just one of the items that we're looking at and providing and reviewed as we've been going forward with putting distance learning up for our entire state.
Okay, I appreciate that. And I think I just want to, follow up with Vice Chair's comment in what he was trying to ask the superintendent. I know it's difficult and we're not trying to put you on the hot seat about making a decision right away about distance learning, but I do know that for Maui, for example, we are going to go through the entire first quarter as distance learning. And I know that for some teachers, they're very relieved about that because once they have to pivot once again, and the frustration that they were going through, that they felt that if they were only going to do their distance learning for a couple of weeks, it was just going to be just too much for them. And that they appreciated the fact that it was going to do at least through the first quarter. But after that, I don't know, and I'm not expecting you to give me a decision right away or any of us a decision, but I do hope that you will consider, and it sounds as if you are, that there are different districts throughout the state. And although it's really the pandemic is especially difficult going on right now on Oahu, elsewhere, for my county, for example, it isn't as critical yet, but hoping that you will be able to give the decision making, to our CASs here, because they do know best our community on how to move forward and if they should be the ones to prolong the distance learning and how and the rollout for that. So I do hope that you will make those considerations at least at the CAS level in coordination with all the principals as well. And that's it for me. Mahalo.
Thank you. Now have Board Member Asher.
Oh, sorry. I didn't put down my hand. I didn't raise my hand. I'm good.
Okay.
Thank you so much. Sorry.
Okay. I'm going to double check now and see if there's any other hands up. Oh, Board Member Bakarse. Okay, go right ahead.
Aloha, mahalo, Chair, Board Member Bakarsi. Wanted to follow up on Board Member Uemura and Board Member Namau's thoughts about extending it into the first quarter. I wanted to give another perspective that I've heard from community members as well as parents. Although there is a hope to get back to in-person instruction as soon as possible, we've also heard that people really want to be able to plan. Going like Board Member Namau said, a few weeks at a time and possibly pivoting mid-quarter makes it difficult for the teachers, but also for some of the families that have to try and figure out how they're going to do this. And an additional perspective is I've also talked to some community groups that had said they really want to step up and see how they can help, whether it's with trying to set up childcare or other assistances to families in schools, but it's a short 4-week window doesn't really offer them enough time to put resources together to try and find the creative solutions. So, like Board Member Namau, I would encourage continue to at least the first quarter, and if we see that the numbers are not going down by next week when you guys are looking at making decisions, perhaps even looking at trying to go to the whole semester. Mahalo.
Thank you very much, Board Member Bakarse. Looking for any other hands? Let me double check. Okay. I just would like to, we're very close to the end of this section, but there are a couple of things that were not brought up that I thought were critical. And again, don't expect a long answer. I just really want it to be in your head that we have to think about this. One is related to adult education. And we don't really talk about that very much, but it is part of our system. And we are hearing from some of the adult education teachers about the expectation that they have had placed on them about doing the virtual learning. And many of them do not have the technology either in their homes or in the schools to do the kind of online learning that is expected of them. And so I know most of them are part-timers. They're not full-time teachers over there. But in order for that program to continue to stand up, I think that we have to be thoughtful about the kinds of supports we're providing them. I know they took huge, huge cuts a few years ago, but it is an important part of our system. The other thing that I think we need to be thinking about, and we have the special ed teachers that have spoken to us, and the one that mentioned that I had visited his class, and so had the superintendent. I remember it well, and these are excellent teachers. I think that we really have to tailor some specific kinds of supports to teachers who have both many adults in their classrooms because of the kinds of students they're working with. And if we talk about separating them into different rooms or whatever kinds of things we're doing, it's just a completely different situation for them. And I would really hope that we can target some specific supports because these certainly are teachers that are irreplaceable. And I want us to help them as much as possible. So I'm just going to put that there. It is getting late. We have not reached our record time yet, but I think that I don't necessarily need answers to that, but just definitely want to put it out there. Okay, any final comments from any board members before we move to the next item? Okay, so we have finished distance learning and we are now at personnel. And this is our third area of concern. Again, some of these things we have talked about before, and I know that one of the huge concerns continues to be teleworking, and in the teleworking policy, it specifically excludes people who are making the request who are at risk for their own health or who are at risk for causing others to be at risk because of the people at home. So I think that's an issue that's not going to go away as much as, it looks good on paper to have everybody following pretty much the same system. I think that that needs to be perhaps further discussed, maybe not this evening, but I think it is a conversation that's going to continue. So we'll start with that guiding question again, not only about the teleworking, but overall, how are we making sure that our schools have sufficient staffing to take care of people that may have to take longer leaves or to substitute for people who are not able to come in even on a temporary basis? So I will start with the superintendent and then she can hand it off.
So I'm going to go ahead and turn this quickly over to A.S. Covell, who's going to talk about our teacher vacancy numbers, teacher attendance, some things that have come up around childcare and partners that we need with that, substitute teachers, and then just give an overview on the leave laws that we are guided under the federal leave laws. So A.S. Covell, can you share some of that data, please?
Superintendent, thank you. On the teacher vacancies, so it's actually good news for us. Typically, we look at October 1st as the date to take the reading because by then teacher and student count is kind of normal, and then we can report to the board in November. So that's typically our date that we report to.
A.S. Covell, we're having a hard time hearing. We're having a hard time hearing you, A.S. Covell.
This year because of the situation we're in.
Is that better? Try again, say something.
Okay,
Okay, can you hear me now? A little better.
Okay. So,
Okay, you have feedback, you have feedback. Something needs to be muted.
okay, my apologies. Can you hear me now? Okay. So as I was saying, the vacancy rate is actually looking pretty good for us this year. So we took a snapshot yesterday, and we have about 97% fill rate of our positions. So 13,000 teachers roughly out of our 13,447 positions. So looking at about 420 vacancies, which is a little bit lower starting the year than typically, and we still have quite a few positions. That's good. On the attendance rate, we've also been looking at that to monitor teachers calling in for absences, and that rate has also been a little bit lower than last year. So about 95% of our teachers showed up this week for school. So about 600 a day were not in, which is also lower than our normal rate. So we're really pleased that both the vacancies are in a pretty good place. Obviously, we'd like to have all of the positions filled, but also the attendance has been up. I really thank the teachers for showing up and for getting us started this week. The other issue I think has come up from the questions that were framed for us is the issue of the substitute teacher pool. So we did make some other arrangements this year to try to expand that pool if the need continues to grow or does grow. We stood up 2 different alternative courses for substitutes to get certified as a course. In the past, we've only had it at the adult community schools, but we have 2 online courses that we've approved for alternate certification for substitutes, as well as the University of Hawaii. If you have a minor in education, they're offering our substitute course for a true credit course, and that is helping us grow the pool. Another thing we did for this school year is we opened up to, it's called Class 1 subs. That means you can have a high school degree and have completed the substitute teacher course and be approved by a principal at a school. So that's opening up the pool of substitute teachers to ensure we have more available as needed. Also under the personnel, it's called Family Friendly Coronavirus Relief Act. It's a federal law that all employers with a certain amount of employees have to provide paid sick leave for their employees who might have to quarantine, seek a medical test, or have child care or family care issues. So for those that do have those issues, that is one possibility to apply for the Family Care Act leave for family matters. We did take a look at that to see what that might do in terms of our vacancies. And as of this week, we have approved 30 certificated Family Care Act leaves, and certificated our teachers and our administrators, and 112 classified employees, so total 142. So that's also at this point manageable in terms of keeping the staff where it needs to be. On the American with Disabilities Act, we've been receiving more of those than normal. To date, we've approved 41 of those for people that have a request for reasonable accommodations if they meet the criteria. So physical or mental impairment that substantially limits one or more major life activities. We've already discussed telework, but I'll be happy to answer any more questions you have about that, as well as the training. Just a reminder that we did agree with all 3 unions to set aside those first 9 days without students. So rather than those instructional days, we use those days for mandatory training. We had 25 mandatory training courses. Everybody is due to have their completion reports back to us
by the 28th of August, and then we'll be making sure we put all of those into our PDE3 system to record their training. So I'll stop there on the personnel and just be ready to answer questions.
Okay, do we have any board members? I see Board Member Uemura's hand is up. Go right ahead, sir.
Thank you, Chair. I just had really a follow-up question that I'd asked earlier to Randy Tanaka about the cleaning and custodial help. And there was one of the questions where he said, no, they were not doing the cleaning as it's supposed to. So let me ask you the question on personnel there. What is the vacancy rate for custodians in all of your schools?
So we haven't reported any custodial shortages as of yet. We've had a couple that had to fill in for others that were out either for a potential COVID test or out sick. But we've been able to thus far have the schools with the appropriate custodial support they need. There isn't, as Randy said, increased need for increased cleaning. So we have positions called classroom cleaners that the schools can buy those positions, and if they need to increase those, they use that with their rated student formula funding. I haven't had any issues brought to my attention where there are custodial shortages. Just as I said, occasionally somebody's out ill and we might have to shift. They can call in substitute custodians when they need to. And some areas, again, rural areas, it's harder to get some of those personnel than in other more urban areas. But we do have the ability to expand that if we find that schools have the funding and need to hire more.
Okay, let me just follow up on that with you, Cindy. So what you're saying, basically, all the schools' custodians positions have been filled, so there's basically no vacancies. But there is your classroom cleaners that is a position where basically they'll be doing the cleaning of the classrooms and the restrooms and all the common areas. Is that correct?
Correct. And, you know, I'm going to have to go back and check our numbers. I haven't had any vacancy issues, but I want to make sure. I don't want to say there's zero. Yeah. You know how personnel is always in flux. So there may be a few, but I wouldn't report it as a major issue at this point.
Okay, so wouldn't it be a major issue if you're only cleaning your classrooms once? And what does the CDC guidelines or the DOH guideline recommend?
Yeah, it says once, and frequent high touch areas need to be cleaned more frequently. Excuse me, high touch areas need more frequent cleaning, such as doorknobs and tabletops that get
right. But we're not doing that now, right?
We are, as Randy said, his information is they're cleaning once a day, and then there's wipe downs going on quite a bit. I have heard that there's more wipe downs going down than normal, hence the request for more Clorox wipes and sanitizers.
Yeah, I think make sure that we're clear that the DOH has, and in fact, they even met with our leaders recently and reiterated that what they require is use of masks and washing of hands frequently. They are not requiring nor stating that it is an absolute to clean in between every utilization between classes, although that's a goal that we have to try to increase the cleaning in between classes. But we are meeting, I don't want it to seem as if we are not meeting the minimum DOH standards at this time.
So what you're stating is the minimum basically is cleaning the classrooms and the bathrooms once a day, correct? And that
high touch areas need to be wiped down often.
Often.
And yeah.
So what is the definition of often? When they have time?
No, they should have a regular schedule of coming through the building throughout the day and wiping down high touch areas where there is constant student or employee population. So they should be doing doorknobs and the knobs of any water fountains that are being used. So there is a description. In fact, it's part of our custodial training materials.
Okay, so maybe I misunderstood. So can Randy, can you come back on and clarify that for me? Because I thought that we didn't have enough staff to obviously clean every every hour after each class changes. But I thought we were also short on having, just the normal cleaning of the common areas and things like that. I thought we just short of staff. So if you could clarify, that would be helpful.
Yes, Vice Chair. Our normal cleaning protocols we are meeting. The normal cleaning of what the custodial work is. With the introduction of the COVID situation and the cleaning of classrooms, begin to build upon that. So we've cleaned classrooms once a day. That's our protocol. Now, when we have a different kind of occupancy just remember the CDC is a guidance. It is not a mandatory or a mandate. So the guidance is as frequent as possible. Now, it doesn't mean we have to clean after every other shift. Where we're focused on is high touched areas, especially handles, custodial areas. The other thing that is critical is back to the basics. Mask, wash your hands, 6 feet, and that minimizes the potential for spread.
Yeah, I understand that, Randy, but where I'm getting a little confused is that, we have stated, or the department has stated, that we're going to be looking at the CDC for guidance. So what you're saying now is that it's not a mandate, it's a guidance.
I'm sorry, hang on.
Yeah, sound that bad, huh?
it's just technical difficulties.
Hey, I don't mean to be yelling at you, Randy.
No, thank you. Thank you.
But I'm just trying to make sure that, when we state that we're going to rely on the CDC guidance, and the guidance is, do it as frequently as possible, then, we need to have a definition what frequent is. Then I've also, know from talking to some teachers that they were told that they need to wipe down their classes and computers after each student use and buy their own supplies, basically. So that kind of aligns with what CFO Brian Hallett said in a financial meeting, where they're kind of using the teachers to do some of the work that they don't have staff to do. Is that correct?
I'm going to ask AS Covell regarding the teacher cleaning.
Okay.
So our safety and health handbook talks about cleaning and disinfecting frequently touched areas as often as possible and at a minimum each day before and after classes. So I think that might be where the confusion's coming in. If classes turn over and somebody needs to wipe down the frequently touched surfaces and they don't have the custodial staff in there doing their daily cleaning, right? It could be these in between classes where they are thinking that they need to help wipe down surfaces.
Yeah, but I was just told that you only clean it once a day, and that your classroom aides don't do that. They do the high touch areas, right? So I am getting a little confused on how we're doing this. I think the main thing obviously is that we get a sanitary condition in the classrooms. And all I'm trying to do is trying to figure out how are we doing that. If we need more personnel, is there a plan in place to hire more people? Or is a plan that you're going to use the teachers to do that?
No, it's in the teacher contract that they do not clean the classroom. So we're not going to use the teachers to do that.
Right.
If they want to have, the tables wiped down before a new class comes in, then that's something that they can share in that opportunity to do. The classroom cleaners are going to come in not to do the high touch areas over and over, but so it's just kind of like our secretaries and our offices at the state level. They're wiping things down all the time. They don't have to. They're just doing that. And our guidance says our high touch areas will be wiped down frequently. That's not saying once, twice, 10 times a day. It does say though to look at high touch areas such as doorknobs. I have also heard. I'm sorry, I'm getting a little feedback that the janitors are making the rounds more frequently, that they are hitting the doorknobs in the lavatories more frequently.
Okay, I guess, I'll feel more comfortable if there's some sort of procedures and policies in place to do that versus, not defining how frequent it should be. And then you hearing that our custodians are, coming around more frequently now. But that's not for all the schools. It may be just for a couple of schools. So, what we're trying to do is take away the angst of the teachers and the people that are going to school. And by not having clear answers to this, it just adds to it. It doesn't take away. So with that, Chair, I'm going to yield my time.
Board Member Cox.
Thank you, Chair. This is Board Member Cox. I'll just add a little to this conversation. Unless things have changed an awful lot by the custodian's contract, there's a specific area every day that they're supposed to be working on. Classroom cleaners come in at the end of the day. So the expectation is that teachers don't do that, but the way the department works is if they want to do it, we let them do it. So in other words, we're encouraging them, and I don't know that that's necessarily the right thing to do. If in fact we're doing distance learning, then I'm sure schools don't want to pay for classroom cleaners once they've had the rooms cleaned. And so custodians may be able to go into classrooms and clean, or bathrooms and clean them more often. But I think that this whole conversation is showing that we're expecting people to do more than what their job is supposed to be. Because every single custodian has a certain number of places that they're responsible for. And so same thing with room cleaners, and there's a certain amount of time that they're supposed to spend in the room. And so when this is hit, it seems like we're just expecting people to just do more than what their job is supposed to be. And that may be a problem down the road, because it's very hard to change anything that you're expecting people to do that's not in the contract for them to be able to do. So, yeah, you tell teachers, oh yeah, well, they can volunteer and wipe down things or whatever. The contract says no. And you can say, oh, well, they can give the wipes to the kids and let the kids do it. Well, that's not exactly what we're supposed to be doing in educational systems either. So distance learning in this kind of environment may be more helpful in trying to keep places clean, because if you have classrooms that are not being used, then once they're clean, then you just shut the door and you don't bother with those anymore. So I think it's a good question to be asking, but I don't think there's answers, because I think you're just expecting people to do more than what their job calls for. I yield the floor.
Board Member Voss.
Thank you, Chair. I had a question regarding staffing for the learning labs, which during the distance learning, some economically disadvantaged students may be able to come to school and access a distance learning through devices on campus. For those schools that are offering learning labs, how exactly will those labs be staffed?
That's right.
Deputy Unibasami, can you answer that question, please? Oh, Deputy, are you on?
Yeah, 1 second, please. We're making a switch.
I am so sorry. I could not find my unmute button. So let me just explain because I was part of the decision to put some of the sanitary wipes in the classroom, sanitizers and so forth. And the reason for that is that we wanted to have for the teachers accessible, should they want to wipe their hands or they see a spill, it might not be necessary to have a custodian come all the way into the classroom or their office to do the cleaning. They could do that by themselves, but we wanted to make sure that the supplies were ready for them. As for the learning hubs, every school, as they are designing these spaces for kids who are disadvantaged, may not necessarily have access to their to internet and may not be that experienced with technology. Remember that this is for the students and ensuring that our students are have the best chance of success. As the teachers are giving the assignments, then the schools may be using their casual hires, PTTs, EAs, and really taking a look at who are some of the staff, the support staff that they can reassign to help the students in the learning hubs. It might not be the classroom teacher because the classroom teacher is doing the distance learning for the entire class in their classroom, where the students might be in another centralized area, social distance, but is getting support from another adult who is a part of the school community. And my apologies for not finding the mute button.
Okay, this is Catherine, Board Chair Kane. I'm going to call a 10-minute break. There's been a request, and I think there's some technology things that need to be addressed. That's what I've been told. So let's take a 10-minute break and return at 8:02. Thank you. 10-minute recess.
No, let's just get this.
Okay, this is Catherine Payne, Board Chair. We're coming out of our recess and we are still on personnel. Did we need any further clarification? Board Member Voss?
Yes, I just want to add one other comment. Phyllis, thanks for your description. These learning labs, I thought it was a really good idea by the complex area superintendent, and it's a critical piece for our equity of access, particularly if the distance learning gets extended. And I don't want this to be a source of controversy at the school level, particularly, for example, if teachers are expected to supervise these learning labs on their teacher-directed prep time. So will complex area superintendents be working with the principals to make sure there are funds available to get these casual hires or other hires to make sure there's sufficient staffing and that teachers aren't burdened by doing this?
So my understanding is that with the school models and the way it's being set up is that it really is dependent on the schedule in the school. But my and I will check back to make sure how frequent and often it is. But the conversations that I've had the privilege to be in listening to the complex area superintendents and principals, is that what they're looking at is really a priority, and that was set by the resolution. The resolution by the board was to take care of our vulnerable learners. And for them, it was the students that are not going to be successful in distance learning, may be successful in distance learning, but do not have technology. I mean, the internet access, right? And they are determined that the students would not experience any faltering on our part, that we would do whatever we could to help them. In those conversations, what they talked about were reassigning others. So for instance, if there was a itinerant teacher, a teacher who was a specialist, but could help, not a classroom teacher, but could help with the learning hub, that would be one of the people who could help using the EAs, using PTTs. And so what they're looking for is they already have some funds that are already buying those positions. What they're now doing is thinking about how might I use what are existing resources to help stand up these learning hubs, because they prioritize that as an important part of the programming and services that they want to offer to their children. And that's what they're doing.
Well, Phyllis, it's a good idea, but it needs to be well executed. And I would ask you to please follow up, not just with the CASs, but have them with the school level. And we have extra money potentially available through the CARES Act and otherwise for this type of thing. So if the money needs to be provided centrally, let's do that. Make sure the schools have the sufficient staffs to make sure these learning labs are a success. Thank you, Chair. I yield.
Yeah, and board member Voss, I know the school leaders would appreciate your thinking on that, because that's where their heart is for their kids who need the education and the presence of our professionals in supporting them. So thank you very much.
Thank you, Deputy Unibasami. Are there any other comments from board members on the matter, issues related to personnel? I see no hands. So I would like to chunk these next three items, actually next two, sorry. Food service and transportation. The next two items, they both sort of fall under AS Tanaka. I think many of the issues that were raised with respect to food service have been addressed already. And that primarily concerned the need for students to have access to grab and go meals wherever they are, and that has been addressed. If you want to make any more comments about that. And then the issues of transportation, we've covered with some of them with respect to the masks that you are providing. But if there's anything else that you would like to talk about, specifically with if there are any other needs that need to be addressed. I don't think we need to go quite through in as much detail as we did the others. But I'll, Superintendent, if you want to say anything, go right ahead. Otherwise, you can turn it over to AS Tanaka.
I think very quickly for both of them that we are doing grab and go, and it's an unusual year to do grab and go instead of sit down meals. And the team has done a great job checking with federal guidance on how to do this, and also they are planning and making adjustments based on trying to support families who have kids in multiple grades so they can just go to one school. And so as they work through those adjustments, that's a huge shift in how that delivery is happening, and working through all those, having everything in the appropriate containers and so forth. In terms of transportation with the distance learning, we are obviously not running all of our buses, but we'll be running buses for special education in those for those students who cannot do distance learning. So for the limited number of students that are coming on for special education at school, we'll be running transportation for them. So again, to our transportation teams, they have worked very quickly to again adjust for the first few weeks. I don't know if AS Tanaka has anything else to share, or whether we want to go right into questions at this time and see if there's anything that needs to be clarified.
No. What you said clearly outlines what we're doing, Superintendent. Thank you.
So, Board Chair, we can take questions, I think. That's
okay. Sorry,
thanks.
Myself muted. If any board members have any questions related to either food service or transportation, and I see Board Member Cox, and followed by Board Member Uemura.
Thank you, Chair. I guess I'm kind of confused. I got a copy of a memo that went out on Friday morning. It has to do with the grab and go meals procedure. And then another memo that went out to the schools after 5 o'clock on Friday that changed the grab and go. So is there another memo that's going to go out to schools that goes back to the April 13 one that says they can go any place and pick it up? Or is it going to be still with the one that came out that's labeled August 14th for schools to follow? Because this was Friday for schools on Monday, so I don't want any more confusion for the schools on what they do. Hello?
Hi, Board Member Cox. This is Randy. Those two memos came out nearly back to back after a discussion with the CASs had with their principals in terms of having the ability to execute the pickup meals at any location. Some areas weren't prepared to do that, and some areas had greater needs. And let me use an example of Anuenue as a school. A fair amount of their students, or a percentage of their students, come from the Aiea to Makaha location. And to go from Makaha to Palolo to pick up a meal was not only impractical, but really a waste of resources. So what the grouping did, the principals got together and talked about it and said, let's get an exception. Let's feed our kids out on the west side so they don't have to go through Palolo. And that's what drove the second memo to say, listen, we're going to hold up, but if you have a great need or need an exception to the rule, we'll work with you on it. So that's the second move. The other thing that we're working very hard on is a reservation system so we can identify a student from eating at one home school or supposed to pick up their meal at one home school and not being able to because of the distance. We hope to have that beta test at the end of this month and good to go on September 14th live. And that has everything to do with allocating the proper meal pickup if we're in operation to a nui, so their cafeteria staff, based on meals served, would not have to diminish their staff. So it was a twofold challenge, getting kids to their neighborhood school during this period so they don't have to commute all the way into town, and then applying the correct resources to that cafeteria where they would have fed. So that was the second memo. The next option, and communication is key on this one, especially for the parents and the kids, but they'll be able to come online to book a reservation, so to speak, and we will make accommodations for those that don't have the necessary devices through a manual form. It's very similar to what we do with transportation reservations. So I hope I've answered your question.
Yeah, I think you're on the right track. I think that's good. It's just that these are the kind of things that make principals so frustrated, because when school's going to open on Monday, and this principal is an Oahu principal that didn't get the second memo until after 5 o'clock on Friday. So those are the kind of things that what we really want to see is that we think some things through earlier so that they're not so frustrated, because part of this is they didn't really know exactly what it was they were supposed to be doing. And so, yeah, the communication is the real key, and that we don't want to keep doing things kind of last minute. We need to kind of think it through earlier. But I do thank you for explaining, and I do think it's right for kids to be able to go to the closest place and pick it up.
Thank you. And my your concerns are as high as ours in terms of communication, and it's the parents and the kids that we got to communicate to quickly, so they don't have to run all the way into town or otherwise. Thank you.
But it's also the principals, because they're the ones that have to try to deal with all of this. So yeah, the communication just needs to go as fast as you can get it to them. Thank you.
Board Member Uemura.
Thank you, Chair. Randy, a couple questions. One is on transportation, and one I want to just circle back to PP&Es, if you don't mind. On the transportation question, I remember seeing that there was 2 students per bench seat, provided they wear a mask. But how do you maintain the social distancing? Because it's not 6 feet apart if two students sit in one of those bench seats. So how is that? How do you work that out? Because I also understand there'd be no additional buses to provide for social distancing if you wanted to, split the kids up to more buses.
Yeah, so we had some guidance, and I think it's through the American Pediatrics and the Department of Health. Because the seat backs are high backs, we can put a kid in the seat, or if they're brother and sister, they can sit in the same seat. Our first layout of the buses is at a 6-foot distancing. What we've seen happen, and this week is probably not the best model to have. We're going to see what happens next week, but we're trying to keep to that 6 foot, but we can go to 3 feet because they're face to back, and the provision of the masks. What we have found so far this week, and like I said, it's not probably the best model to measure against, is ridership is relatively low. But this is an orientation week, so we'll see what it looks like next week. We're trying to adhere to the standards of 6, and if we're forced to go to 3, but the general driving factor is we do not leave a kid on the curb. And if we've got them masked up, there's degrees of safety being executed.
So if you don't leave a kid on the curb and you have a lot of kids on the bus, and later on, then you pile them onto the bus, and so there's no social distancing. They're 3 feet or 6 feet, right?
Well, I wouldn't describe it as piling them on the bus.
That's a Kalihi Valley term.
Yeah, I understand now. But all the buses are in radio contact with their dispatch, So the other provision is to call the dispatch and say, listen, I've got more kids than I should be accommodating, and can we pull a bus up? And that's on a case-by-case basis. Our guy running our transportation is aware of that and has had the discussion with all the bus companies. So that's what we're going to try to do.
Okay, that's good to know, Randy. Let me just circle back to the PP&Es, because I got conflicting people telling me, or teachers telling me that does the DOE going to refund the teachers for the money they spent for PP&Es, or is it they're not going to because they're not required to clean their classes?
Yeah. Yes. Let me add. Yes, they're going to get reimbursed for their PPEs.
Okay, so there's no restrictions on that.
You know, yeah, we need a receipt. I can't tell you if it's no restrictions, but generally speaking, if it qualifies as a PPE, they're going to get a reimbursement. Yes.
Okay, so just to be clear, it's the mask, it's the sanitizers, shields, things of that sort, correct?
Yes. Yes.
Okay.
What qualifies as PPEs, and the guidance we're using is through the CDC, but they shouldn't have any problems with masks.
Mm-hmm. Yeah, I know. The reason I'm asking a question because I did have some feedback where some teachers were told by the principal they're not going to get reimbursed.
Okay, you know, if you could help us out with that and let us know what school that is, and then we'll go and address it on a case-by-case basis.
Okay, I'll send you an email later, Randy.
Okay, thank you. And just
Sure,
to note,
yeah.
It needs to be an approved PPE.
So can you expand on that just so that?
Well, it's the PPEs. I would tell you that the guidance will come from what we're receiving from HIMA: masks, gloves, hand sanitizers, has to be approved.
Okay, but so the certain type of mask has to be an approved type of mask. It can't be just
Yeah, I would tell you for them to get if we got 1.2 million masks out there, right?
Right.
Approved, yeah, it's got to be an approved purchase by their supervisor.
Oh, so it cannot be by the teacher, it has to be by her supervisor.
Yeah. Approved by the supervisor.
Approved by the super, not purchased by. So what about? So the specific item was alcohol, because they were told to use alcohol to wipe down the computers. Now that may not be on your approved list just to have alcohol.
We've built a criteria for cleaning equipment. OITS has established that. So, you can just buy any alcohol. I think it's got to be an approved product and approved by the supervisor.
Okay, I think that's good. Randy, thank you. Chair, I'm going to yield the floor.
Is there anyone else who has a comment to make or a question to ask regarding transportation or cafeteria? Seeing none, I would like to put the last two items together also, because one really speaks to the internal communications, the reconciliation of multiple guidance documents and collective bargaining agreements and all of that stuff that is all over the place on the websites, and people gave us a lot of feedback about how difficult it is to put all that together. And the other one is communication, which is also internal and external, and we've heard a lot of comments about that. I'll ask the superintendent to speak to this and invite anybody else that she would like to speak to, and then we can, if you have anything you'd like to bring up about either one of those two final issues. Superintendent?
Thank you, Board Chair. I understand this is a lot of information, and we continue to use feedback to put together, whether they're infographics or summative kind of documents as we go through this process. There's also a lot of information that's very particular to employee groups. And as we make more and more information public facing, it's going to add a lot of those nuances to what's out there. And so we'll continue to look at how do we provide umbrella information. It's very clear and succinct while still providing access to a lot of these details, even additional details when we come together with the board that comes from the public about additional access to data they want, and that's important. We're also committed to continuing to meet with our 3 unions, which is HSTA, HGA, and UPW. We've been meeting with them since the very start of this change of the school year in March, in mid-March. And so we'll continue to work with them and work with other groups. I have a group of principals and CASs, a small group that I've put together as well to meet with me at the end of each week. So every Friday of the weeks in which we're doing distance learning. So that as a small team, we can talk about what are those things that keep coming up that I need to be aware of from the school-based level. This is in addition to the various work groups that have been meeting, and I think we'll continue to look at how we improve communications. We have made a change in our area of communications. We have actually pulled Lindsay Chambers from her role to be specifically doing the work of communications of all things related to the COVID-19 pandemic. So we have a dedicated person there and have moved Nanea up to the role of acting director of communications. So we have also restructured a bit in the communications office to provide the leadership for continued broad communications in the department while providing very targeted support related to COVID-19. The other area we have made some recent changes on is the some additions to the website, including the weekly reporting of positive cases, so that there is a public accounting to those cases that are happening. And along with the weekly reports, we will also provide some context to those reports, especially monitoring whether those cases are coming, are being initiated in the school system, or whether it's cases in the community that are impacting schools, especially our employees and our students. So those are things that we will continue to work on, improve on, and revisit in terms of communications. I'm going to ask AS Luke if he has anything to add in this area or to be ready to answer questions from the board on these 2 topics. AS Luke?
Thank you, Superintendent. Maybe just to add a few things that as we pivot, and I know we've used that word many times this evening, that we continue to make changes quickly and deliberately as we make any adjustments needed to ensure the health and safety of our students and our school community. So we know that timing and proactiveness in regards to communication is most critical to assist with the pivoting, I'll say again, or making any needed updates. So with that in mind, we do vet many of our implementation and operational thinking with a tri-level approach. We always engage in cabinet meetings that have in attendance all of our ASs with the superintendent and deputy. And then it's meeting with the leadership team which is our complex area superintendents. And in turn, our complex area superintendents meet with their principals, and then it goes down to the school level, which is with our school employees. So, you know, a lot of our decisions within the process and the pivoting that we do involves a lot of coordination and collaboration.
I'll just add one more piece because I want to make sure that the board is aware that Deputy Univasami is our lead in organizing these various groups, leadership decision-making groups, and heads the meetings with the complex area superintendents and that agenda as she works very closely with them on an ongoing basis. And also leads the deputy roundtable with representative principals from across the state, which gives us also that principal voice that's so critical in our ongoing conversations and decision making. So I'll stop there and see what questions the board has on these topics.
Okay, while I wait for a hand to raise, I'll just make a couple of comments about some of the specific issues that I think are themes that run through the concerns about communication. And one is timeliness. And I think when you're at the school level, it does often feel like you're at the bottom of a funnel where everything just gets poured in from some level, and then you've got to make sense of it. And sometimes there's very short turnaround times. And I think that's been an ongoing problem. It's forever. We haven't fixed this yet. So if you can fix this issue, you'll probably get a statue built, because timeliness of information and coordination of information, I think, is really important, so that they aren't getting duplicate messages from different places or overlapping messages, I think would be really helpful. So the comments that were put together, rather than having us go through all of them, I think at this point, it would be really helpful just to share those with your communications staff and have them reflect a little bit on how all of us might just get better at this, because it's a chronic problem for people in schools, and the communication dump that always seems to end up on their heads. With that, are there any other board members that would like to speak to this issue? I do see a hand. Vice Chair Uemura.
Thank you, Chair. And I thought you summarized it very well on as far as the communications. So my thoughts on that was exactly what you said. Just share the concerns, and I think that would be sufficient for my purposes. But I have one specific comment to the superintendent. This concern has been floating out there for a while, and so I just wanted to hear why when we communicate our COVID cases that we don't identify the schools. Is there a specific reason that we're not doing that?
So as I mentioned at the last board meeting, we're working through a good system for communicating cases. And I'm on a team of state superintendents across the nation that met this week together to share on this very topic. It's something that it's a hot topic for everyone because of both FERPA and HIPAA laws, and making sure that we're very careful that a person is not identifiable. The smaller the community, the more likely it is that it might be possible to identify a person, especially as layers of information are disclosed. For example, if we mention a small community, and then someone even within that community says, oh, we heard about the counselor, and that school is a small school that has one counselor, it becomes easily identifiable for the person. And so those are the kind of discussions we're having around how to best do this. I had reached out to DOH around, and I had mentioned at the last board meeting that I was having conversations with them around what they were going to be reporting and whether they had any intentions of reporting school-related cases or school age-related cases for publics and private to see if we can feed off of a model they put together. But that's not how they're doing their reporting, which is why 2 weeks ago we rolled out our own model for how we're reporting by complex at this time. The other piece that we have been given guidance around is that appropriate reporting is based on the public health value of that reporting. And so we have to be very careful about we as the source of that information, reporting information that DOH determines whether there is a need to do a broad public reporting. Now, that being said, the school that has a suspected or an actual case is doing, all of the schools that have gone through that have done a very good job of getting a letter issued immediately to their local constituents. So their teachers and parents are notified. Parents are notified now that if schools were back, if students were back in schools. And so that's, that localized reporting is important. And then the question is the public health value of broader reporting out. Again, we're managing kind of the guidance from DOH and national guidance around this and just looking at practices right now, even across other states, about what reporting is, what level of reporting is appropriate. Even this summer when we were having some schools that only had small groups of special ed students and there was, you know, a suspected case, we had to be very careful that if we said it was a student, there was only a handful of students on that campus. Again, very likely that the student could be identifiable. And so we have to be very careful, again, also that we are reporting only confirmed cases and that we're reporting at a level that's appropriate for FERPA and HIPAA. So that's a long explanation to help you understand how I've been thinking through and having these conversations with others around this reporting. And so what we've really come down to is we're going to do by complex area reporting from the state level with context provided weekly around those cases, and at the school level providing notification if there is a case coming from someone who's employed or is a student at that school site.
Yeah, I think Superintendent, thank you. And I think where the I guess the problem comes is that you have instances where COVID cases have been identified to individual establishments, you know, people there, even in our own schools. I mean, the community have heard about it, so they know it. And then you have the HSTA reporting through their communication, and then the DOE saying, well, we can't report it. So, you know, so you can see some of the push and pulls there where, you know, what are you trying to, why are you not reporting this when it's better for us to know? But I think that's where your communication is important in explaining why you're not doing that. But I don't think everybody is going to be on board in accepting your explanation for that, especially when all information has been, you know, all other information are being dispersed around us.
And I understand that, but I do think that I have to err on caution right now, because we have already seen that information shared by other entities who thought they had an official word from someone who was positive has been misinformation that then is dropped on the lap of that principal, who then is answering phone calls off the hook because people are reporting misinformation. And so what I'm able to say is, if the principal has sent out a notice to his or her community, that information is verified information. If the State Department of Ed posts the data, that is verified information, not verified by us, but actually verified through medical documentation and the DOH. Because we have had many instances of individuals who have said they are COVID positive, and after waiting for the documentation comes back negative. And so they suspected it because of things that they, family members or friends they hung out with and had a positive case. And so they were worried, and they did the right thing of notifying us, because then we take precautions. But then somebody goes and notifies the public, oh, we have a case here, and it's not even verified yet. And we had several media reports that were incorrect. And that's what we need to avoid. It creates misinformation that we don't need at this point in time, when we really need good information and verified information. So that's really the perspective that I'm using at this time.
Yeah, and just to be clear, Superintendent, I'm not advocating for disseminating information that's not been confirmed. So the example you use would not be something that we would be putting out there. What I'm saying is that if there is a positive confirmed case, and we have already said by CAS, and we identify as a student, as an employee, but we don't name the school. So that one piece that's missing. But I can see your example where if it's a small school, but you're not saying it's a counselor, you're just saying it's an employee, right? So
yeah, we say it's an employee, but the word on the street in that area, it starts to snowball, right? So again, we're trying to make sure that we're just accountable to how we're providing information. And Board Member Uemura, as we go further into this, we'll keep examining what's the right level of information to share. And like I shared, we are norming ourselves of other states and just learning from them. They're learning from us, and we're sharing information, kind of all trying to figure out what's the right level of reporting.
Okay, well, thank you, Superintendent. And Chair, with that, I'm going to yield the floor.
Okay, that hand is down. I am just scrolling to see if there are any more hands. Are there any other board members that would like to speak on this issue? Because this is our very last one. And if not, okay, student representative, go ahead, Hunter. Haven't heard from you today. Please speak.
Thank you, Madam Chair. So I have a quick question about, talking about announcing when COVID cases are at schools. Will this apply for students as well?
Yes, so Mr. Hunter, yes, we will report for students by complex area as well.
Okay, thank you.
Okay, Hunter, you might have the last word, because I don't see any other hands up. I want to thank everybody greatly, with great sincerity. We set another record tonight. Let's try to back up a little bit next time, but I appreciate all of you from the department and from the board, and the board staff particularly. You're really awesome. And the tech people from the department who are helping us through all of this too. Thank you so much. And there being no further business, the meeting is adjourned at 8:42 p.m. Have a good day off tomorrow, everybody.
You as well, Board Chair.